Dr. Tanmay? Hi.
Hi.
Hello? Dr. Tanmay,
Yeah. Hi, sir.
can you hear me? Yeah,
Yeah.
yeah. Tanmay, I think you should be allowing all these guys, for example, who are all the moderators
Right.
to, for screen sharing.
Yeah. I'll do that. I'll do that.
Muscular.
Tanmay, good afternoon.
Good afternoon. Good afternoon.
Good afternoon,
Hi
sir.
तन्मय.
Good afternoन, sir.
हाँ, रिकॉर्डिंग अभी बंद कर देते हैं. जब सेशन चालू करेंगे तब रिकॉर्डिंग ऑन कर लेंगे.
Okay, sir. Okay.
हाँ, नहीं तो वो ये फिर एडिट करना पड़ेगा मुझे. इसको स्टॉप कर दीजिएगा, फिर नया रिकॉर्डिंग नहीं.
So a very warm good afternoon to all of you, and it is such a great opportunity for all of us. And on behalf of the entire Yuva Pediatric Surgeons, I would love to thank the IAPS leadership we have our IAPS President, Dr. Ramesh Babu sir with us, and the IAPS Secretary, Vikesh sir with us. So without further delay, as all are so excited for the sessions that we have today, and the entire program is in a way that these are the things that would be somewhere needed by each of us as we navigate our path in as a young budding pediatric surgeons. So we are looking forward to this exciting session today. And with this, I would like to welcome Dr. Ramesh Babu sir and ask him to deliver the President's address, sir. Sir,
Thank you, Vinay. Like what Dr. Dasmit, our past president, has expressed, I too feel really young again today. And I mean, this idea of Yuvacon has been conceptualized by both of us, myself and Dr. Vikesh. And I'm absolutely delighted with the enthusiasm and involvement shown by all the Yuva members. I mean, I too feel like many of you that I mean, not you, but many of the middle-aged people that, you know, why can't we go back to our PG days and then be a Yuva speaker? And then, you know, it's just a really exciting feeling. I can see the smile in all your faces, and you're all excited as well. So, I mean, those who have been students a few years ago have become speakers today. And for an IAPS family senior member, it's the same feeling. In the elder brother or elder sister of the family takes charge in running the family, takes care of that association, you know, starts getting involved in day-to-day affairs. So I wish more and more young leaders emerge from this new initiative. We have a lot of Yuva leaders and also PGs. You know, I only hope that this activity becomes a regular feature in future. Because during summer months like June, July and all, we cannot have physical conferences, but we can have such virtual conferences. I mean, Vikesh, you want to say a few words on this activity?
I think it's always a pleasure. And only one thing I would like to mention that while working or preparing for Yuvacon, I learned a lot from these people. And the enthusiasm and the vigor which these guys have shown is really commendable, and it is inspiring. So I wish you all great luck, and we can go proceed with the meeting.
Yes, start.
Thank you so much for your words of encouragement, sir. Before that, I'd request if we can get a group selfie with all the listeners who have joined in to turn on their cameras, along with our IAPS President and the Secretary, so that we can have a group photo for all of us.
IAPS Secretary is preparing.
We can click a
Okay, sir, you're live.
I'll request everyone who have tuned in, please turn on your cameras. And we can start clicking pictures. It's a big list, so we'll have to navigate through the screens. And we'll also have a picture at the end of the session as well. So those who are, you know, wanting to prepare themselves, so they can do it in the meanwhile. So without further delay, I'll invite Dr. Vidya for the first session. Dr. Vidya, over to you, Dr. Vidya. Dr. Vidya,
Good afternoon.
yeah, you are on mute.
I was muted. Yeah, understood. Good afternoon, everyone. I welcome you to the first exciting session of Yuvacon 2024. This is about choosing a job. I'm delighted to have you all here and coordinate this session. Navigating career paths is a really challenging task for all young pediatric surgeons. And today we have with us our esteemed panel of experts to guide us through. We have Dr. Sujay Pal sir, Associate Professor from Kolkata. I beg any his game. Yes. Good afternoon, sir. And then we have Dr. Sanjay Rao, sir, who's joining us. He's a senior consultant and head of the Department of Pediatric Surgery at Narayana Health City in Bangalore. And welcome, sir. Then we have Dr. Anthony Robert Charles, who's the chief consultant of Kindersearch Group Practice in Bangalore. Welcome you too, sir.
Thank you.
Okay, sir. With this, we'll move ahead to our speakers. Yuva speakers, I hope, are all ready to speak on the topic. Each will be getting 5 minutes to present the discussion, and then we'll have the Q&A session. First, sir, sorry. The first
A lot of
speaker.
people have their
Please go ahead.
mics on. Please request people to put off their microphones.
Muted themselves, please.
I request Dr. Aditya Manekar, who is assistant professor at AIIMS Bhubaneswar, to talk about salaried practice. Dr. Aditya, over to you.
Yeah, hi. Thank you. Thank you so much. Can I get the slides, please, on the screen?
Yeah.
I have made you co-host, so you can share it from your screen as well. Not an issue.
I have shared everybody's.
Okay.
Is it visible?
No.
Okay.
Vijay, you need to unshare first.
Yeah, I'll do that.
Yeah, now Aditya sir can. Aditya can.
Okay. Should I share my screen now?
Yeah.
Okay. Is it visible?
Yes, it is.
Yeah. Are the slides visible now clearly?
Yes.
Yes.
Yes, please go ahead.
So starting with the first question, I am Dr. Aditya Manekar. I am assistant professor at AIIMS Bhubaneswar, and I'll be speaking about the salaried practice for young pediatric surgery. So as we all know, we undergo through a long educational pathway. We go through MBBS, then our general surgery days, then the super specialization, and nowadays there is the 6-year direct MCH course. And then we can go forward with fellowships, that is plus or minus. Then post MCH or post your super specialization, post your degree, you have employment opportunities like in a government hospital, like a medical college and a hospital, or a private hospital that goes into corporates. So the major advantage of working in a government hospital is that you have a good job security. The job is stable. So you have a regular income. Even in cases of official vacations and all, you have regular income going on. And it has also have many benefits, like you have many pension plans, there are many allowances, there are travel allowances, there is pension cover. And second thing, all allied departments, if you need help of a neonatology, the anesthesiology, or even if you're stuck in some case or a surgery, you have easy access because you are in an institute. And the work environment is variable. It depends on what is the patient load in your hospital. Then coming on to private hospitals generally have a higher salaries and they have better facilities as compared to government hospitals. They have access to the state-of-art medical technology and equipment, but the work environment is variable. It depends on the patient load and the type of the patients you get. And there is one more option of a specialty hospital. It is like focused basically into pediatric urology or just a pediatric surgical hospital or a pediatric hospital. This is what I feel is a better option for if you want to build just a career in the field. So coming on to salary, government hospitals can give you a starting salary of about 1 lakh to 1.5 lakh per month. And this is influenced by the pay scales and grades. And private hospitals generally have a bit higher salary, but they have a potential bonuses and incentives. And as you progress, as you are promoted, with experience and reputations, you have increased earnings, and senior surgeons can earn more. The only drawback being in a government institute is you attain a ceiling. At certain point of time, after that, there is no much of economic progress. But as you become senior, you can have senior administrative roles. You can become a medical director. You can have leadership roles like being the head of the department.
And coming on to professional development, the institute itself promotes you to attend conferences, CME programs.
So I'm unable to hear Dr. Aditya.
Yeah. So work-life balance can be maintained. The stress depends on how you take it and the. Am I audible?
Yes, now you are. Please proceed.
Yeah, okay. So the work-life balance, basically this is 5 jobs. So work-life balance is easy to maintain comparatively. And stress depends on how much you take, depends on the patient load, depends on your on-call duties. The work hours are fixed 9 to 5, except for those on-call duties, which you may have once or twice a week. And because you get more number of patients, more number of practice, this is a good opportunity for skill development. So I conclude that career as a salaried pediatric surgeon in India is rewarding, but it demands dedication, extensive education, and continuous professional development. And the employment opportunities are diverse. Government and private hospitals, it ranges from government and private hospitals to academic and specialty institutions. And you have significant challenges, including demanding work hours and the scope for continuous professional development. Thank you. Thank you so much.
Thank you, Dr. Aditya. That was a very good overview about salaried path for pediatric surgeons. I request all the everyone to make note of questions, and we'll have the question answer session in the end, and comments from the experts also to follow. I request the second speaker, Dr. Venkatesh Kolla, to present about freelancing practice.
Can't talk, I'm for you.
Your screen is visible.
And Dr. Venkatesh, you are not audible.
Venkatesh, are you there? We're not able to hear you.
Hello, call him on his mobile.
Not able.
No, am I audible right now?
Yeah.
Yes.
Hello. Good afternoon, everyone. My name is Dr. Venkatesh. I'm from Rajahmundry. My topic is regarding freelancing. These are the components of freelancing when want to start a freelancing job as such. Sir, ma'am.
So I think you can continue.
I can continue. These are the components which I have seen in during my freelancing and before my freelancing. That is the area to choose for freelancing. One is to have corpus fund, which is the most important before starting freelancing. Equip the basic requirements. Keep clear what you want to do. That is done every day in the morning and in the evening. That is daily journaling and advertising itself. Areas. Depending upon the area's needs, you have to equip yourself. One is the metro city, where freelancing will be of choice in most of the nursing homes and hospitals, except for corporates, where they are already occupied by in-house surgeons. And in 2-tier and 3-tier cities, all the nursing homes requires patients to be treated under them. So it requires you to equip. And nearby towns within the range of 100 kilometers, you should always roam around. During my practice, I have invested more than 30% into the regional reads according to my regional reads, and how to generate. You have to have savings in the starting, at least 10% of your PG stipend. And second is to go for loans, that is personal and practicing loans. When you are establishing a hospital or a clinic, you can go for a practicing loans. Otherwise, you have to go for a personal loan. And take a job as a general surgeon also in the regional hospitals, so that you should have that salary to sustain yourself. And last option is to use your family. It's not at all advisable from my side. What is the basic equipment which is required in the freelancing practice? You should have a four-wheeler first to carry all these things. One is the minor set, second is a major set, and a hypospadia set for yourself. 3 mm lap instruments with a 5 mm scope, which most of the 2-tier and 3-tier cities doesn't carry with them. And if possible, a good bronchoscope. These are the used. One of the cystoscope is gifted by Dr. Ramesh Krishnan, my teacher and my beloved God. And I have equipped myself with all the
Delivery normal, I know. Normal.
And at the end, the journaling is most important. To start a day, you have to decide for yourself what to do on the day 1 to day end. And you decide, if you have not at the day, on the starting of the day, whatever is left over, it will be spill over to the next day. During the meetings with the pediatricians, to gain the confidence of the pediatricians, everything is required by talking to them only in the 2-tier and 3-tier cities, because no one is going to believe you in the starting of your journey. It will take some time. Initially, they will call only for INDs. They will call for small cases, where if you took more time or something like you're giving more care to the patient, they will like you and they will start calling you. And the journaling part, you should do it every day so that you will improve yourself. The advertising, most important form at the end is the advertising in the form of pamphlets and leaflets in the regional languages. Second is the referral pads to the local practitioners and the primary medical caregivers. Most of the primary medical caregivers doesn't know who the child will get operated. Most of them, they will refer to the general surgeons for small cases like hernia, hydrocele, circumcision. Most of these cases will be taken to general surgeon for operating in the 2-tier and 3-tier cities. This is already a regional competition also for us, for which sake we have to go to PHCs in and around, primary healthcare centers and PMPs, primary medical physicians, followed by pediatricians, and we should offer what services we should give in those referral pads. And regarding which, after taking all their numbers, we should update daily to them. But these are the things we do. If we have done anything differently also, or anything which has a very good outcome, we have done thoracoscopy, we have done laparoscopy, we do these procedures in children, they doesn't know anything. First of all, we should accept them like that only, because they know only general surgeons will operate till such time. So all the statuses which we keep in those regarding and educational videos, you have to create and show whenever you go and visit them. You have to show these are the videos, these are the surgical videos, and which we do, and you have to advertise through YouTube also. Thank you.
Thank you, Dr. Venkatesh. That was very insightful. I'm sure based a lot of on your experience, and the viewers are benefiting by that. Next speaker is Dr. Vinay Kumar, who will be talking about group practice. Vinay, so over to you.
Thank you. Now I'll be able to share the screen, right?
Yes, sir. You can share the screen, and I can share.
Is my screen visible?
Yes, sir, visible.
Good afternoon, everybody. I am Vinay Kumar Purname. I am working along with Dr. Anthony Robert and the team. The team's name is called KinderSearch. We are about 7 pediatric surgeons catering to about 25 hospitals in and around Bangalore. So I have been working in this team for about 1.5 years. And based on this 1.5 years of experience in group practice, I will be speaking about that. So you will hear a version of the group practice from a Yuva surgeon's perspective. As far as my journey is concerned, I completed my MCH pediatric surgery from the very famous Indira Gandhi Institute of Child Health, Bangalore. I have been benefited, a lot from my teachers over there, and I owe a lot to all my teachers from Indira Gandhi Institute of Child Health. After completion of my MCH, I was there working as an assistant professor on ad hoc basis, completing my government service bond. And after completion of this bond, I had to decide where to join, whether to continue in the same institute, or to join as a freelancing consultant, or to join a group. I decided to join this team Kindersearch because it was already a well-established team which they were conducting good amount of surgery. And at the same time, I thought I would get more experience and also would improve my skills. So in this 1 year, 4 months working experience with Kindersearch, after a few months, once the team got to know me, they made me in charge of about 4 hospitals closer to my home. So by this, one thing is I got my identity. People who are referring cases to us know that I am the consultant managing them in those 4 hospitals. And at the same time, I operated quite a few cases alone independently. But more importantly, I always had some other person who was helping me out during the surgery, be it a senior or be it my own colleague. With the motto of the team is that always two surgeons are involved in any kind of surgeries. And I also got to experience a higher amount of, the supra major surgeries by assisting the seniors. And I was also given chance to perform few surgeries which I didn't get to do in Indira Gandhi. For example, vesicoscopic ureteric reimplantation. So my skills are also improving. And in these 1 year, 4 months, I also had a stable salary. So people who want to join group practice, I would like to tell you all the positives of group practice are, one is there are more number of people. It's not a single man, one man show. So because more people are involved, and each of them have their own experience or expertise in one or two particular things. So when all of them are put together, it becomes a complete team. So which is why there is diversity. At the same time, there is increased strength. And obviously, the costs are shared, which is why we as people who are newly joining may have a stable income. And because everybody joined together and work, there is cohesiveness, and I'm sure there is work-life balance. So when my wife delivered and I had to take leave, I could take leave of 1 week without any problem because other people covered for me. When I had to go travel to US for a week, then other people covered for me, so there was no problem. And with more people involved in the team, we get to interact with more other consultants, just surgeons, pediatricians, and many other consultants. So, which is why we develop more contacts. But at the same time, it has negatives. Negatives is because it is more than one person involved. Obviously, marriage between two people itself has conflicts. Now, if there are many people, for example, 7 surgeons, obviously there are going to be conflicts and ego. But at the same time, if people think that we are working for the child, and if child comes as first, then these conflicts and ego issues can be solved. At the same time, there is fears about loss of autonomy. For example, if I see a patient in the OPD and I would have planned a particular treatment, and in the team meeting, the decision is taken as the decision is a little different, then I'll have to go back to the patient and tell this is not the treatment, which is good. But at the same time, that I also feel I also have a small fear of loss of autonomy. If I accept it and then move on, it is going to be good. At the same time, there are going to be disagreements and about reimbursement. And because we cater to multiple hospitals, there may be more travel. But for people who want to start a group practice, we should always think about why, what, when, where, and who. And it is a bigger thing, a bigger task, and it has to be thought about properly. In the 19th century, one of the richest men from United States. He had a very big business. He said, strength is derived from unity. The range of the collective vision is far greater when individual insights become one. Thank you very much for the patient hearing. This is our group called KinderSurg, which is headed by Dr. Anthony Robert and the two other senior surgeons, Dr. Shaunak Chowdhury, Dr. Vedant Daj. Then other junior surgeons, junior consultants are Dr. Divya, Dr. Vinay, Dr. Shruti, and Dr. Vidya. Thank you.
Thank you. Now all the speakers are done with their presentations. I request our experts to make a few comments, get some clarity and give more insight to our
all young, recent pass out pediatric surgeons are giving a talk on their perspective of group practice and all that.
Okay. I thought that was a question coming in, but yes.
Yes, I must let me start it off. Congratulate all the three Yuva speakers of the day, because I think it was very crisp and we got to see the different perspectives of all the three different works. Just coming to the first speaker, I was really happy with the way the government hospital setup does work for people. My only fear, as is the fear of the IAPS and everybody, is the limitation in the number of jobs which is available for people as they come out. And the other danger there is of stagnation. Just want to see if our speaker is still there.
Dr. Aditya, you may respond.
Yes, sir. Yes, sir. So in government practice, as a salaried, you reach a point as if after promotion you become a professor. But then after that, as you go senior, there are more of administrative duties as compared to clinical duties. And second thing, the economical progress is, I mean, the salary. It won't go as much higher. It will be, it will reach to a point where it won't increase. And coming to the limitation in the number of jobs, that is true. There are limited posts in an INI setup or a state government setup. That is also a great point.
Sanjay?
Sir, you're muted, sir.
Yeah, congratulations. I think this is an excellent effort, and I'm glad to see a huge number of participants, some who are young and some who are young at heart. Ramesh Babu, take heart. Yeah, we're all young, yeah. We fight the grace. Yeah. So, no, I think the challenges that you guys face today when you come out of practice, come out of your training is probably much different than what it was, maybe 15, 20, 25 years ago when we started, simply because, the number of people, the number of doctors and the competition has gone up. Initially, you were a minority. When we passed out, we were 300 pediatric surgeons across the country, of which several were not active. And that number has jumped up quite a bit. So the challenges you face perhaps are very different than what we faced during the time that we went in. And it was quite clear at that time because the corporate culture was still not well established. So either became a full-timer, as it was called in Bombay, or you were a practitioner, and there was nothing very much in between. I think there are problems at both sides. The full-timer business, as Robert mentioned, the number of positions, especially for a very, very, very niche specialty like ours, are never going to be, bountiful. There are always going to be a limit to the number of positions that are available within these government or government institutions. Private practice is another ball game, and I think there are a lot of other people who are more competent to speak on than I am, because that's something that I have not been involved in any great length of time. But fortunately, over time, there are a lot of middle ground that has come, because before, practice versus full-time were sort of dead tails. There was very little overlap. But now there are systems in place that sort of give you a bit of the benefits of both, which allow you to function like you are in an institution where you have a group, you have help, you have assistance, you have the group, all heads coming together to work. And I think a good example of that is, what Robert is running in his setup and the kind of hospital setup that we are working in now, and a lot of others are. So though they are so-called corporate, we are working as groups, might be independently as a group or as a group within a hospital. And I think that has a fair amount of advantage. The problems that you mentioned are there. all the problems that were mentioned in the last in the last thing by about the various things about loss of autonomy and disagreements within, but they are all disagreements within a small family, and a lot of them are easily resolved. So I think that's a good way. That's a good way. But come what may, I think wherever you are, ultimately it is an attitude that matters, and you have to have the right frame of mind, be willing to talk to people, take suggestions, ask for help when you need it, and move on. The last thing you want is a mishap early on in your career, especially when you're on your own. So, and I'll stop here. Thanks.
Thank you, sir, for packing in so much advice for all of us. It was very good. Sujay, sir, do you like to add something?
Unmute yourself. Can't hear.
Oh, you're muted, Sujay, sir.
No. Dr. Sujay, it's gone back to mute. Just one more time.
Can you hear me?
Yes.
Yes, we can now.
All the speakers were excellent. But I just want to say that indeed it is a great privilege for me to share the session with experts like Dr. Sanjay Rao and Dr. Anthony Robert Charles. First of all, I like to appreciate our National President, Dr. Ramesh Babu's innovation, and Dynamic Secretary, Dr. Vikesh Agrawal, for such a nice initiative of Yuvacon. Also, I would like to congratulate all the Yuva members of organizing to make it possible. I'd like to share one quote which is very relevant for this session, made by Mr. Earl Nightingale, who said that success is not the result of making money. Success is not the result of making money. Making money is the result of success, and success is in direct proportion to our service. So if you love and passionate of your subject, most importantly, if you know how to do or when to do and when not to do surgery, is the key of your success. That means good service and good remuneration. And if you ask me my personal opinion, which is very relevant with Dr. Vinay Kumar about group practice. It is, yes, after doing or passing the DNB or MCH in pediatric surgery, you should need at least 1 to 3 years along with 1 or 2 senior members as a resident to gain some confidence to do surgery individually. Then you can go for freelance or in salaried job. But in group practice, there are so many advantages. But group should be consisted of pediatric anesthetist, pediatrician who has sufficient knowledge of ventilators or neonatology, one senior colleagues of the same disciplines. So in any problem, they will help you. It is not easy to do the freelance practice in peri-pedi. You will not get the sufficient backup. You will not get the sufficient pediatric anesthetist. So my vote will be in favor of Dr. Vinay Kumar. That means the group practice. Thank you. Thank you so much.
Thank you, sir. And I'd also like to bring to everyone's attention, there are a lot of comments on the chat group. Everyone else is also sharing their thoughts. And the speakers can take a few questions on the chat box as well. With this, I think we're also at the end of our session. It's been half an hour. I think we can wind up our session unless anyone else has something to share. Dr. Tanmay, I think we can move on to the next session. I thank all the expert surgeons and the speakers and for this opportunity from Yuvacon to coordinate the session. Thank you all.
Dr. Vidya, thank you all the experts and the speakers.
Thank you.
Moving on to the next session, I hand it over to Dr. Prabhu. Dr. Prabhu, please unmute yourself.
Oh, that's a brilliant start, Dr. Vidya and team. Tanmay, can you see my screen?
Yeah, perfect, perfect.
Yeah, perfect. Yeah. So here the session would be regarding the career opportunities for qualified pediatric surgeons. So we have 4 pediatric surgeons who are young surgeons just out of their qualification coming and speaking about these topics, that is by establishing in 2 cities. And I'm pretty sure that all of you know the headings of the topics, and we'll hear from the speakers from themselves. And we have 4 speakers and as well as 3 chairs. Dr. Vijay Kundal, additional professor and head of the department in Jammu, and Dr. Virendra Shekhar, who is an additional director of pediatric urologist, Fortis Hospital, and Kishore Panjan, sir, his introduction was a director of Galaxy Hospital. So I think with this introduction, now so I'll stop here, and I would leave the stage to Dr. Jagdish, who is our first speaker. Dr. Jagdish, on to you. The stage is yours. Thank you. Dr. Jagdish?
Yes, sir. I'm just sharing my slides.
Perfect.
So is it visible?
Not really.
Share. Okay. But it is showing me. I'm sharing. Is it now?
Yeah, perfect.
Yeah. Now visible, sir?
Yeah, you're visible and audible.
Yeah.
Clear,
Yeah.
Jagdish.
Can I start?
Please proceed.
Yeah.
Yeah, please.
Good afternoon, everybody, and thanks for the opportunity which I got to speak in a forum with all senior and junior colleagues where I can share my views regarding how to start up your own career in 2 cities. So with this introduction, I have done my MSc and 2 years of ad hoc assistant professor job in Indira Gandhi Institute of Bangalore. From there, 1.5 years back, I moved from Bangalore to Tirupati. I think many of you know that it is a famous for Laddu and as well as Edukondalavadi. Okay, this is what I expected once I came from Bangalore. Just like I will be flying with full of colors, like a superhero. Okay, I'll do all well because I trained well under the guidance of S. Ramesh sir and other team in Indira Gandhi. But unfortunately, it is other way around. Okay, so these are the hurdles, many hurdles and many reset points, just like in snake and ladder game, where you'll be going back to 0 or 1 again to start the game. Okay, but I have taken it as a challenge, and I know that every ending is a new beginning, that for a betterment. Okay, the challenges which I encountered in cities like Tirupati is selection between a job versus own practice or a freelancing. There was a lot of confusion in me what to do. But over a period of time, I tried everything, but I found that it's mix and match which suitable for you. Okay. Other things which I encountered, the challenges in view of money, men, material, and mentality of the doctors and patients. Okay. Many seniors may be knowing the mentality of doctors and patients influence our practice, but for junior colleagues, especially who want to settle in Tier 2 cities like Tirupati, definitely it matters a lot. Okay, coming to one by one, the tough part is choosing between what kind of work. I think my preceding speakers spoke very well about how to choose and what to choose and what are the advantages and disadvantages of those things. But the place which I need to really emphasize on, the place selection is very, very important for your career, because once you start shuffling from one place to other place, we will be in no man's land. So I have decided to start my practice in Tirupati for a particular few reasons, because it's my place near to native place, and I want to take care of my parents. And already existing one pediatric senior surgeon like Betal Mohan sir is there. If any difficulty is there, I thought he will help me, and really he is kind enough. He supported me. And already a government medical college is there. I thought that if any case is there not affordable, I can always refer patient from my clinic to government hospital where the child will get a benefit. And another point which I have chosen by Tirupati is already SWIMS is an institute where it is having a departments like established departments like nuclear medicine and medical oncology and nuclear radiotherapy. I thought any oncological cases, I can get help from them. And another point which made me to choose Tirupati is it is nearby to two cities like Chennai and Bangalore. I thought whenever I face a difficulty, the patient is also will be happy to go to a tier 1 city where he can get help. And I also thought that if any difficulty is there, one of my senior colleagues can easily travel with a flight facility. They can come and help me out in a difficult case if really want to do myself in Tirupati. These are the reasons I have chosen Tirupati. Maybe every individual in this form, the junior specialty, will have their own ideas and own justification of selecting their own places for practice. Okay. Other thing, the corporate job, I have tried it. That they will not let us to do well in corporate job, because they'll calculate how much you are generating and how much you are profitable for them. So I went with a visiting consultant in a corporate hospital, Amara in Tirupati. Then I have tried a job in medical college, private medical college. It utterly flopped because they asked me to join as a unit head of pediatric surgery. From there, the bargain ended with SR in general surgery. Then I left that option. I thought of doing freelancing. That also miserably failed because freelancing wastes your time more, and it will eat away your money as well as time. So then I gave up doing freelancing. Then partnership, again, I tried with maybe not good people. That utterly flopped because partnership involves money. Wherever money. Hello? Sir, is it okay?
Can you? No, you have to be a little faster, Janish.
Yeah. I'll finish it off, sir. So then I came to know that whatever the suits for me is, every junior colleague has to pick it up. Then, hello, sir.
Sudhakar's iPhone needs to be muted.
Can I proceed?
Yeah, please.
A lot of disturbance. Sorry. If anything which need to be taken note of.
Please
continue.
Yeah. Thank you, sir. So then I understood this different matches, just like a multi-slice toppings of a pizza. We need to tailor ourselves. Okay. Hello.
Yasir Ahmad Loan, please mute your mic.
Sir, can I proceed?
Yes.
Yeah. Thank you, sir. Yeah. Then next challenge which I faced is after selecting a place, the men. See, the challenge, this is a very difficult task, getting a good anesthesia with a good anesthesia technician. You may think that anesthesia technician is also important. I'll tell you. I'm not aware that till I came to Tirupati, the difficult intubation can be done with a umbrella metallic sheet which is placed over a feeding tube used as a one of the bougie to put a ET tube. That is the skill in tier 2 cities a technicians will have. So it is always better to have a good anesthesia, pediatric anesthetist with a good technician, and trained nursing staff definitely is important. Now I'm putting my efforts to train few nurses who can help me out. Okay, we'll never get it already established, well-trained nurses in type 2 cities. Then another challenge which I have faced is departmental help from radiology and nuclear medicine. In the beginning of my career, where 1.5 years back, I used to send articles and I used to sit along with the radiologist to what are the things which I need to see and what are the things need to be focused. Now it is improved. They are helping me out. And particularly histopathology, coming to the histopathology, what I faced is getting a good histopathology report, particularly in Hirschsprung disease, very difficult. Okay, then I thought I collaborated with Ushakini madam in St. John's. She's kind enough to help me. I'm sending slides there and I'm getting a good report from there. And reception and PRO, social media manager, these will play very crucial role. Particularly, I have a good receptionist. She is very good, polite, and even in my absence, she will make patient very comfortable and she will take care of. Okay. Next, political and police officials, of course, that is a add-on. So I advise my juniors to start play games safely with a calculated risk to grow. Another challenge, major challenge, which I faced.
Interrupt you. Can you kind of put it across in a minute time? So we're literally running out of time. In a minute time, can you
Sir, I'll
conclude
take
then?
2 more minutes. I'll finish off mine, sir.
Please go. Please.
Because of a lot of disturbance, I could not able to take my flow. Maybe I'll continue. I finished off in 2 minutes. So I'll advise my juniors to keep. I think Venkatesh has told 6 months to 1 year money as a backup for your basic needs. The second thing is you need to take insurance, term insurance, health insurance, professional indemnity, and vehicle insurance, because that acts as a dent in your filling bucket. So keep simple, high, target high. My sincere advice, never commit yourself to operate in unfamiliar environments. This is the one message which I need to give you guys. The junior guys particularly, I had a very miserable experience. Okay, I went to a senior most pediatrician who is having a OT setup. They told me that your laparoscopy can be done there. I went there. I have faced in the middle of surgery, carbon dioxide is over. So then I thought I'll put a sutures on abdominal wall and I can finish off surgery. After putting that one, when I was cutting the appendix, they told me that oxygen is over and nitrous also is over. So then I'm forced to, quickly finish my procedure. I came with the retro technique and I told my anesthetist to extubate. It was nightmare for me. So you prepare yourself and get familiar and procure your own instruments. If it is possible, build your own setup. That is a good thing to go within Tier 2 cities. And another advice, make your own PPT of procedures and self-explanatory pictures and videos so that you can explain to your patients so that the conversion rate will be good. And the mentality of doctors, just like I think the pictures will speak there who can understand Telugu, and the patients, always it will be mix and matches. Okay, so we need to take then and there, we need to go with that. So with this, I need to conclude my thing. The Tier 2 cities always is challenging, but it will be coming to the people who are prepared with mind. The opportunities come to the people who are prepared with mind. So I started with a zero, with no clinic and nobody knowing in the Tirupati. From there to I started my own clinic and I'm doing surgeries now. Also, I have done plenty of laparoscopic surgeries, complex surgeries.
Overshooting.
Okay. So the simple thing which I want to tell you, the secret thing, no, there is no secret ingredient, just you, which can make yourself to fit into that scenario and go ahead. Okay, it's things happening may be delayed, but cannot be denied. This is the message which I want to give. Everybody will run their own pace. So take it on, go. Thank you.
Perfect. Yes, thank you so much, Jagdish. Quickly, we'll have to move on. Please unshare the screen. We'll have to quickly move on to the next presenter. Next presenter is Dr. Ashita K. She's not able to join us in person, so she asked me to present her video instead. Yeah.
Good afternoon, all. First of all, sorry for not being there and sending this video. I'm Ashita. I will just start with telling about my journey. I was born and brought up in Kerala, and then I did my MBBS from Madurai Medical College. I did my direct 6-year pediatric surgery course from Kanji Kamakodi Child Trust Hospital, Chennai. During my course, I completed MRCs, and later I came to Birmingham Children's Hospital and worked as a clinical fellow in pediatric surgery and urology, and then moved to pediatric hepatobiliary and transplant surgery unit. Options in UK can be a short-term, mid-term or long-term. Short-term opportunities are observership or clinical attachments, which helps you to get a taste of what the UK system is. You can come here through traveling fellowships, which are offered by PESI through Dr. Rameshwarnath Minocha Babs PESI Traveling Fellowship, or other IAPS or state fellowships. You can also timing these observerships along with international conferences. Midterm, around 1 to 2 years time period, you want to come here and go back to India. If you want to do that, the best option is medical training initiatives, which helps international medical graduates to come for short term to UK for work. There are trust and royal colleges which offers this MTI training, which gives certificate of sponsorship, which helps for us to get the work visa. And also they will help us in getting GMC registration, which needs to work here. So this is very useful if you want to come here and work in a specialized area in pediatric surgery for a few years and then go back. But if you want to stay back in UK for long term, especially if you want to have a career growth, you have to complete the specialty certification either through CSER pathway or training. But both of this will take at least 4 to 5 years, and you need to work in multiple hospitals. And in CSER pathway, you have to get your abilities certified, your skills and knowledge certified by different consultants. And in training, as you heard in a recent talk by Kalpana ma'am, it's a long pathway here, but we will be able to join higher specialty training as a pediatric surgery training as ST3 level. Still, it is around 5 to 6 years to complete the course. So UK life pros are mainly the work-life balance. That's why people are coming here. And also there are options like less than full-time. That usually full-time is like 40 hours per week is the rota. But you can take LTFT, where the new parents, when they have small children, they can do this so that they will have only 2 to 3 days in a week work. So they can adjust their rota and will be able to look after their child. We can make new friends here. And for children, there are free education and free healthcare system. Also, this system is very good for children with disabilities also. And for our personal improvement, there is always scope. But it comes with some cons like loneliness, because we don't have an extended family around here. And cost of living is high, especially for childcare. And also due to medical legal problems, even though we are doing only limited period of time as work, those period of time is very stressful. And also to add up, there is British weather, where it is raining almost 360 days a year. And also I want to emphasize on these decreasing opportunities, because currently there are a lot of influx of IMGs to UK, and each job opening comes in the website, it get filled up very soon. Heard like there are like 200 to 300 applications per each job vacancy. Overall, there is better division of works, better multidisciplinary approach for each patient, and hence the less burden on individual doctors. But it will vary between trust, and do inquire about the trust before you are joining. These are few sites for further knowledge. NHS jobs and tracks jobs are the sites for looking for jobs. And this Facebook page is very, very, very useful before I am coming here. So thank you so much for this opportunity, and thank you.
So here is Dr. Ashita's talk on these opportunities. So next I would like to invite Dr. Vinupriya, a person who has narrowed down herself only exclusively into pediatric oncology and pediatric surgical oncology, what I mean. So what are the difficulties, and probably what are the what is that she has to say regarding this? Dr. Vinu, are you there?
Interrupt. Can you please allow the sharing? I don't have the option for screen share.
Unmike?
Please check now.
Yeah, sure. Thanks. Is my
Yeah,
screen visible?
but make it is in the presenter mode.
Yeah. Okay, I think it's.
You're audible and visible. Go ahead.
Yeah, thank you. So I've been asked to share my insights on career opportunities. Being pediatric surgical oncology, I don't think I have a vast experience or exposure with regard to this, but I'll really share my insights with this. Is there a need for the expertise? Our life has always been a hurdle race where we first cross the hurdle of med school or MBBS, then we cross the hurdle of becoming surgeons and then qualified pediatric surgeons. In between, we have the burden of family responsibilities and personal responsibilities. Meanwhile, we are trying to become experts in managing work-life balance. So is there a need for this expertise? What is the question? So a brief intro of this, pediatric surgical oncology comprises or probably contributes to 10% of our pediatric surgical practice. And it's a field which is constantly evolving. Always there are new trials, new things happening, change of, there is drastic improvement in outcomes that we are seeing. And the spectrum of complicated cases that we come up with residency is actually minimal. So is there a need for the training? To simplify this, split this question, before you think of going for such an expert training, you should always think of what is a place that you're going to practice in future, whether it's going to be a tier 1 city versus a tier 2, tier 3 city. And what is the case spectrum that you're going to deal with or manage, whether it's going to be a general pediatric surgery predominantly, or it's going to have considerable number of oncological cases as well. Will your expertise make a difference? Like, suppose you're planning for a group practice where individually each person in the group is planning for different subspecialty and you want to work as a team, then definitely it's going to add on to the value. And most important, are you passionate about it? So definitely pediatric surgical oncology is a teamwork, pediatric oncologists, radiologists, radiation oncologists, nuclear medicine pathologists. It's very important to have healthy discussion with them and come to a common protocol or common work, common treatment pathway for a particular child. So how did it impact? It's the timing of the surgery. When you have decided whether to go for upfront surgery or neoadjuvant, it's very important that the child is there in the list. And you know when is the optimal response going to have. It's not like because we are not confident of a surgery or surgical, exercise is going to be complicated. We can't tell them give 1 or 2 cycles of chemotherapy more because you have already attained the optimal response. You're not going to achieve more with any more this thing. So how do you deal with it? And most important, you're going to adhere to your surgical guidelines. What are the questions you may face when it comes to from parents or caregivers perspective? You have 2 different sets of questions that you are going to face based on the education level of the caregivers or their understanding. They might just tell us what is good for the child. Is my child all right? Will he or she lead a normal life? What is the financial involved? Or sometimes you might find the other extreme of questions. Like they might ask you, how many cases have you seen or operated? What were the outcomes? What are the alternatives we have? What are the trials going on in this field? Whom do you suggest to take a second opinion with? And I want to take my child abroad. What are the options you have? So the training gives you considerable exposure to answer these questions from the parents or caregivers. I don't have to emphasize the role of a surgeon in different pediatric tumors, but we already know. So I would tell with such a vast experience of training, extra training, what we'll be able to decide is, you know when not to operate. You always go with an intent to treat individual child. And also when you decide to operate, you know various approaches you have. How do you prepare yourself and the child and the parent and other caregivers and other people in the team for the treatment? What would be the after effects of the surgery, or what would be the complications and how do you deal with it? You can either become an exclusive pediatric surgical oncologist, or you can become a general pediatric surgeon with special interest in pediatric oncology. So what are the advantages of being exclusive pediatric surgeon is you'll be up to date with recent trend And also you can become famous among the pediatric oncologists colleagues, both national and international level. And you have carved a niche, special niche, which will be looked upon by your juniors to follow the path. But what are the challenges? I think in India, it is still in a fetal or infancy state. It is possible only in high volume oncological centers. And when it comes to hands-on, we have less hands-on with pediatric reconstructive procedures. And considerably, there will be general overlap with general pediatric surgeons and adult surgical oncologists as well. If you have to practice general pediatric surgery with pediatric surgical oncology specializations, advantages are definitely a wide range of cases, and you have your pediatric surgery colleagues who will be assisting you for the cases, and you have other pediatric specialties who will be supporting you. But what are the disadvantages would be, it is difficult to be up to date with a small portion of pediatric surgical oncology because you'll be dealing with vast range of cases. And your training may eventually over the years get diluted. And because you have not given up on other general pediatric surgery cases, you might become just an option others for referral because they might just tell she does both or he does both. So even I better choose an experienced surgeon rather than this person. That could be there. And considerable competition is always there from pediatric surgery colleagues because you have not given up on other subspecialties. They might also not give up on pediatric surgical oncology as well. So coming to the opportunities for fellowships in India, we have Tata Memorial Hospital. That's where I did my fellowship from. It's 1 year. And Vijayawada Hospital, SGPGI. And coming to overseas in USA, we have St. Jude's Hospital, which is 2 years fellowship program. And MSKCC, 1 year. And Cincinnati Children's, 1 year. And all the USA options are open only if you are ECFMG certified. So you have to clear your USMLE steps. In Europe, it's not particularly for pediatric surgical oncology. It is more predominantly pediatric surgery with a high volume of oncological cases. Example being Princess Maxima Center and HAD, Barcelona. And KK Women and Children Hospital, Singapore, 1 year option. What we take home message is always share your knowledge, have a healthy discussion with people who have less exposure in the field, and have a healthy discussion with the team and always prioritize the child. I think with consistency, people will understand the importance of such a training, and eventually, I think the referrals will increase. I thank all my mentors who have been a constant guide and support during my journey. Thank you.
Dr. Prabhu, you are in mute. Dr. Prabhu, please unmute yourself.
Oh, sorry. Oh, thank you, Vinu. That was a great insight. I'm sure you'll be getting a lot of questions at the end because you've given insight for the forthcoming juniors that, how to get into pediatric oncology as well. Yeah. And coming to the last speaker, it's been from very long time, all the pediatric surgeons getting into a pediatric liver transplant program. Yes, no. There are no set guidelines as of now. So let us see whether a pediatric surgeon can get into a liver transplant program or not from the person who has struggled the entire life to get there. So let us hear from Dr. Rajan Garg, who is about to speak to us in the same arena. So Dr. Rajan, solve this.
Hi, Dr. Prabhu. Is my slides visible?
Visible, sir. Only thing is you have to make it into. Yeah, perfect, sir. You're visible and audible.
Okay. Thank you. It's my pleasure to give a very short talk on liver transplant surgery. So I don't know how many people would be interested in joining this. It's a very committed specialty in surgical branches. So, but the thing is, it's a very rewarding field, especially for pediatric surgeons, because when the patients of biliary atresia come to us, and then we do Kasai, and then sometime, another 3 or 6 months or a year, 2 years, 5 years, 10 years later, patient lands up into a liver failure, and then we don't have any option. So that is the main reason why I ended up into choosing liver transplant, because I was not able to figure out what to do for these patients once the Kasai fails. So, but it's a very rewarding field, especially for a pediatric surgeon. Same thing stands for hepatoblastoma as well. These are the two main things, diseases we see commonly. But the problem with the slides are not a matter here. Okay, I'll just tell you what is important. And Dr. Prabhu, please remind me when to stop. Then next thing is getting into the liver transplant surgery is a long-term project. It takes minimum 5 years for a person to enter into a fellowship program and then uh, do some parts of the I mean the easier parts of the operation independently. It will take at least 5 years, and that too if the person has done a transplant training from a high volume transplant center. So I think the best time to start is at least 5 years after the pediatric surgery training has finished. People have enough exposure of what pediatric surgery is, and they have gone through the basic surgical procedures, and then they are able to do those procedures independently, and then they are very sure that they can go ahead and then they want to go for liver transplant surgery, because once you enter into liver transplantation, your career totally changes. It's no more as a just only a pediatric surgeon, because once you are into transplant, you can't practice pediatric surgery again, except for the hepatobiliary cases. You can't be doing the general pediatric surgery, neonatal, thoracoscopic, all that is gone. Okay. So when you're very sure that you want to get into only liver, pancreas, only then you get into this super specialty. Otherwise, you don't get into this. But after 5 years, you have some considerable idea that I can go into this specialty. Then the thing is, the problem with pediatric surgeons is that we don't want to do adult operations when we are in the transplant program. That I faced a lot of difficulty because of this, because programs did not want to hire me. They would give me reply like you would not like to do an adult be a part of the adult operation, so that's why we don't want to take you in. But it does not work like this. If you enter a transplant program, there is no program which does only pediatric transplant program. There is only one center in the world, which is in Japan, Tokyo. Okay, that's just because it is a pediatric hospital. Otherwise, there is no program which caters to only pediatric patients. Most of the programs are adult transplant programs. Very few of them are they do good number of pediatric transplants also. Maybe there are 2 or 3 in India, for example. And we have to do as a pediatric surgeon, or once you are here, does not matter whether we are a pediatric surgeon or GI surgery from GI surgery background. We have to do everything. Living donor operations, that will be adults, and cadaveric retrievals also, they would be adults as well. So there is, and we also have to do the recipient operations for liver transplants also. So there is no choice here. If we can't learn transplant like this, we have to go through the adult training and pediatric training as well to reach the end goal. And then if some people are interested in kidney transplants as well, there are no transplant programs which have the combined liver and kidney transplants. But I mean, some transplant centers do, liver transplant centers do have combined kidney transplant going on from the other department. So in combination, we do sometimes transplant kidney transplants also, but then primary hyperoxaluria is one condition. We do combined liver kidney transplant. So there you need some knowledge about kidney transplantation as well. And for obstructive uropathy, nobody does a kidney transplant in India. I mean, I am talking about not the kidney transplant itself, but talking about the bladder management in transplantation. That is a difficult part. I don't know if anyone does it. As per my knowledge, no one does it in India. So for kidney transplantation and liver transplantation in India is different. It's different from that in the UK, because in US, everything comes under one umbrella, transplantation. It's not like this here. Then okay, so this is the timeline. This fellowship starts after at least 5 years of the finishing of pediatric surgery, and then there are 1 or 2 years programs, which are 2-year programs is usually an LTSI fellowship. It's an Indian Association of Liver Transplantation. And then if people have a doubt whether they should go for a fellowship, they can go do an observership before this for a week for a month, for 3 months, whatever time they want to. They should go to choose a center wise. Choosing the center wisely is very important. Otherwise, they might end up losing their interest. Then, yes, sir.
Can you kind of have 30
Yeah,
more
sure.
seconds to kind of
Okay, fine. So basically, there is a long learning curve. That is the message. There is a long learning curve of minimum 3 to 5 years after finishing the fellowship program, and then after you finish everything, then it's difficult. You will get a job in corporate. Central institutes are very difficult to. I mean, there are no transplants going on in central institutes as of now. I think this is a very long topic, but if somebody has any queries or is interested, they can contact me on my email, via email or my phone number. I think that is the better option, because there are too many things to talk about on this topic. This cannot be finished over a talk. If they have personal queries, they can talk to me. That's it. I'm done, Dr. Prabhu.
Yeah, thank you. I think people can note down this number. Please unshare your screen, Dr. Rajan. Thank you, sir. So we have Dr. Vijay Kundal sir and Kishore sir, Kishore Bindani sir and Virendra ma'am. So over to you for any queries for all this, comments and queries to all this.
मुझे दे जाना बच्चे, वहां क्यों रख दिया दूर?
Kishore sir.
Since we are running short of time, can we go to the next session? We can have the discussion later.
Should I speak now?
Okay, sir.
I'll not take much time. I'm listening from the very first session. I'm really delighted, and thanks to Dr. Ramesh and Vikesh and all the young stalwarts of our association to organize this conference, Yuvacon. I hope it will be continued every year. And my message is only, I heard all the speakers, whether you do practice or you go in a government job, everything has got benefits as well as the losses. So one thing I want to say, there's no shortcut in the medical practice, neither financially, neither professionally. You have to give the time, and the initial 8 to 10 years are difficult to settle yourself, whether you're in a private practice or in any institute. Even if you are in an institute, you're getting the fixed amount of money, but your position is always junior. So we have to think this thing before going for any profession, whether we go for a government college, private group practice, or in a 2-tier, 3-tier cities. And my message is only, if you keep your positive attitudes towards your specialty and you have to fix the target, what we have to do, then you are going to be successful definitely. In any way, you cannot be unsuccessful, because it takes the time to become a tree from a plant. So I'll happy, and I'll say again, congratulate to all of you. If you want to ask anything from me, I can answer you. Thank you very much.
Thank you so much, sir. I think Vijay sir they have already messaged. It's whatever they have to convey. And little apologies for the little delay in the program. And I think Viram will take over. The next team will take over the process. Thank you.
That was a wonderful session. Yes, sir. So moving to the next session, which is on a very important aspect of life, which is the work-life balance, which is very important in every profession. Challenges like unpredictable working hours, the emotional burden of dealing critically ill children, and the constant pressure to stay updated with medical advances are some of the unique hurdles we face in maintaining the harmony in life. This makes maintaining a healthy work-life balance not just beneficial, but essential for our well-being and also delivering as effective care to the young patients. So we have our Yuva speakers, Dr. Maitreyi, Dr. Shweta, and Dr. Shravanti, who will be sharing their personal journey, experiences, and also insights. And to expert the session, we have speakers, very famous speakers like Dr. Dasmit sir and Dr. Vaishali ma'am and Dr. Pingali Gopal sir. So I request Dr. Maitreyi to share your screen.
Yes. Recording in progress.
May I request on behalf of the organizers to the speakers, stick to time, because that takes away the discussion time, and we have very good experts with us here, and we would love to hear experts as well.
Yes,
so I request all the speakers to please stick to time.
Sure,
Thank you.
Yes, we'll take care.
Yes.
Thank you, sir. Thank you. Dr. Maitri, you can go ahead with your presentation.
Thank you, Dr. Abhirami. Am I audible?
You're audible.
Yeah.
Please
So good afternoon, everybody. I am Dr. Maitri Save from LTMGH Sion. I joined as assistant professor and doing my bonded service there. Basically, I finished my MCH recently, 6 months ago. So I am very, very new into this. And whatever my talk is with my small experience and whatever I could gather from my peers, I would be talking about mostly overcoming initial struggles in pediatric surgery. So when we talk about work-life balance, that balance is a harmony between what you do at workplace, your personal life, your social life, which is important for everybody. But it is not that easy for doctors or surgeons, because most of people will say keep your work at workplace and your life will be better. But we cannot do that. There is no on and off switch for us, right? So a better surgery, a good outcome will always make you a day, but a complication or loss of life is not going to let you sleep that well that night. So it is not that simple. Secondly, we all have been dealing with lives and emotional burden, dealing with patients for almost 10 to 12 years now. But still, we have never been taught actually how to deal with the impact it causes on us. So in a way, the whole medical field has been suffering because of this. Then there is national statistics which says there is 30 to 40% of medical professionals who have experienced depression at least once in a life, out of which almost 15 to 70% have thought of even ending their life. And personally, I feel that mental health is too important to be left to other professionals. We're educated, we know how important it is. So now, as a new pediatric surgeon like us, what are the main challenges we are going to face? I feel this is an important period where you're making all decisions, all big decisions. You have finished your medical training finally. So now you have to decide which city, which place you're going to settle down, whether it's a big city, a secondary place. You have to consult this with your partner, with your family, because their priorities, those things also have to take into consideration. You have to choose your workplace, the kind of work you're going to do, whether it is government or freelancing, your finances. So this is a period you're going to make many, many decisions which are going to matter a lot in your life. Secondly, what I felt personally is that role changing at workplace, which you have to deal with in this period. You have been as a student, as a resident for so many years now, and now you're no more that, you're a consultant. So you're not busy with all those things. So that's role changing at workplace is something you have to deal with. And thirdly, you have to now establish yourself professionally. You have been in the institute with undercover. So now you have to have your own identity as a professional. So in that, two things I have felt since whatever 5, 6 months I have been into this, that there is not much awareness about our field yet. It is much more needed.
Dr. Maitri, you have 1 more minute. So
Yes,
try to stick to it.
I'll fast one. So basically, there is much more awareness needed, and the demand, supply, and distribution of it is not matching. So we all need to work on it. So for us newbies, for the balance, I think three things are very, very important. First is you should know what you want, where you want to go from here. Personally, professionally, your priorities you have to set up and make your decisions accordingly. Secondly, choosing your workplace is very important. We spend almost 7 to 8 hours at workplace, so that is more than awake time with our family also. So that workplace choosing is important, where you have to consider people you're going to work with, your duty hours, your how much it's going to pay, how much you have to travel, and everything. And thirdly, most important is you have to make your health, physical as well as mental, as your priority. Now, how to go for it? These are the few things I have learned will be good. First is that setting out goals and timelines, professionally, personally, socially, for a day, a week, a month. You should have a goal that I have want to do this in this manner. In that also, you shouldn't be prioritizing your schedule. You should be scheduling your priorities, is what I feel. Secondly, you can always go on to learning new things. Most of us have left our old hobbies after starting medical education. We have been busy for so many years, so you can reconnect with them. This always gives you fulfillment. Third, very important, which has helped me, and I'm sure most of us, that talking to your colleagues and seniors. When you talk to your colleagues, you know that most of us are facing the same issues. Most of us have the same problems. We are struggling the same way, finding our own paths. And seniors, they're always, of course, going to guide you. They're going to be there for you. And then after talking to them, you always realize that it's going to be fine ultimately. So other important thing is you have to keep updating yourself about your field. So it gives you that edge. Again, physical and mental health. So whatever it takes, exercise, meditation, yoga, walking, whatever you can do should be part of your routine. And one more, just a personal thing, that our whole generation should be managing our screen time appropriately. With this, I just want to end the talk with this quote, that purpose is that ultimate concern. All of us intermittently should be asking ourselves that why are we doing this? Why does it matter and why is it important? So all answers of this why would be different for everybody. But yeah, that should satisfy your conscience, and that's what matters. So whatever can get you better sleep at the night should be doing it. So thank you.
That was a wonderful talk, Dr. Maitri. Can you keep
Yeah,
your video
yes,
on?
yes.
I request all the speakers to keep their video on. And the next presenter will be Dr. Shravanti. As you rightly said, Dr. Maitri, managing our screen time is very essential. We advise the children, but even for us, it disturbs our sleep and also our mental health. So next to Dr. Shravanti, kindly start your talk.
Thank you, ma'am. I hope my screen is visible to all.
Yes, you are.
So as you can see, most of my education was in Hyderabad, and later I moved to Chandigarh. And finally now I'm working as assistant professor in Department of Pediatric Surgery at Siddhartha Medical College, Vijayawada. So most of us, I think I speak for many, when we moved out of our hometowns or towards our hometown in view of job opportunities or to be close to our in-laws or some other things. So when we do that, we face three major challenges, that is professional, personal, and mental. Professional challenges is the main important thing is the lack of vacancies available, and the thought of is the only degree enough or should we do any other fellowships, as with so many pediatric surgeons passing out, there is very limited opportunities. I think private practice and its issues have been covered by many of the speakers before, but one issue is that it's a dependent branch and the pediatricians pay us a lot usually. But there even now there is a slight gender inequality, I can say, when it comes to freelancing. The first call goes to a male pediatric surgeon, not the female pediatric surgeon. And institutional practice is my personal experience. When I joined, the department was very new, less than 6 months old. And I was very surprised that even the interns and the surgery PGs did not know what pediatric surgery is and what all we do. So it was very difficult to communicate to them about what we do and teach the nursing officers and technicians about the work, even in OTs. And especially the pediatricians also didn't know the amount of work we do. So every day, go there, tell them what we do, search for cases, get the cases done, and that is trying to establish the department. So not just in private practice, I think even in institutional practice, we have to roam around, bring awareness among the departments. And the other issue is during our peak crucial period, that is in our early 30s or mid 30s, we are roaming around administrative offices, trying to get the equipment for our new departments. And some of us don't even have a senior faculty with us in the new departments available here. So we are actually working for or waiting for a patient in the most crucial period of our life. And another issue is when you move to a new city, you're not a localite there, and the patients do not have the feeling of our own, either based on the caste or religion, especially in two-tier cities or even in smaller towns when there is still strong communal feeling. So there is a language barrier which we have to overcome. And when you're a new surgeon or people assume that you're not very experienced, they may not 100% trust you. So they do doctor shopping initially to confirm the advice you give. So at the end of the day, wherever we are, even in private practice or institution practice, the main thing we miss or we lack is a proper guidance or a lack of a mentor. Though our faculty who taught us during our MCH are just a phone call away, it is not the same as somebody who is there physically with us and guiding us day in and day out. And the major thing is that when we get a difficult case, the initial hesitation or fear that will I be able to do the surgery and get a good outcome out of it? Because when I do a surgery, I'm being compared with senior who's in the around, who has more than 10 years experience or 15 years experience. Another thing is when we move to newer cities, there is a rivalry, professional rivalry. People think that new surgeons are coming, so there will be distribution of patients around us, there will be distribution of money and everything, but it is better to keep it open and with friendly competition. Personal challenge is that we move away from a family.
Dr. Shravanti, one more minute for you. Can you please flash?
Yeah, and there's a major lifestyle shift in the when we move from metropolitan cities to a two-tier cities or smaller towns, and you have to adjust to the new place, weather, and also people. And most of us may not talk about the mental challenges, but there is a constant comparison with ourselves with the contemporaries. Like I've moved from PGI where there are 150 patients in OPD to suddenly 2 patients in OPD, and where we are doing hundreds of surgeries in a month to hardly 10 surgeries in a month. So initial first 6 months was very less, but now at the end of 1 year, we are doing at least 50 to 60 surgeries in a month. So I'm in a better position. So there is a stress of patient care, slow progress in life, feeling that life is not as expected, and feeling of future unemployment also. So what can we do? I think it is better to set goals and priorities and know how do we see ourselves 10 years from now. Based on that, make small goals, strike a balance between academics, practice, money, and family time. Find like-minded colleagues and stay in a steady job instead of job hopping, and develop your team and have a healthy competition. It's better to make opportunities when you don't find one.
Very well said,
Personally,
Dr.
de-stress your-
Shravanti. So we will be moving to our next speaker, Dr. Shweta. So we really need our expert speakers to give their insights also. So let us move to Dr. Shweta's presentation. Dr. Shweta?
ये तुम लोग देखो ये कटिंग एजेस am I on?
Is my screen seen?
Yes, your screen is seen. Can you open your PowerPoint?
Yes.
It's very scary to see.
Is this seen, my PowerPoint presentation?
Yes, Dr. Shweta, you can go ahead.
Yes. Hello everyone, I'm Dr. Shweta. I'm a consultant pediatric surgeon at ESIC Hospital, Hyderabad. Today I'm going to talk the topic is cutting edge, the challenges and triumphs of the surgeon mom. So the journey, I would like to give a brief introduction of how my journey has happened. So when I joined my pediatric surgery as a resident, I was never called by my name. I was always called by, when I was in my first year, I was called a newly wedded PG. When I was in my second year, I was called a pregnant PG. And towards my end of second year, I was a PG with a kid. And in my final year, I was giving my exams with an 8-month bump and another kid with me. So always throughout my residency period, I was pregnant and with kids and everything I was trying to manage. Am I audible?
Yes, you're audible.
Yes. Is my screen also seen?
Yes, Shweta, I can go ahead.
Okay. So initially, when all my my colleagues were trying and getting chances to do hernias, I was struggling with hyperemesis. So I had a long history of going from hyperemesis and getting a chance to operate hernia. And I was really lacking in my residency period with a duration of 6 months. And then when my final year, when we are getting chances to operate all the major surgeries like abdominoperineal, pull-throughs and Duhamel's, I was struggling to change diapers by my kids and a long journey from diaper to Duhamel's. And all my colleagues were proceeding with doing surgeries, taking turns in getting the duty rotations, managing emergency cases. I was going a bit backward, but still I was trying to manage both my residency period as well as my kids I was trying to manage. But the challenges faced were, first thing was time management. I was a new mom for the time, and also the post graduation we do as an MCH is different from the one which we have done in an MSPG, because MCH they already have a pre-notion that they're already past their MS, so they have to know few things. And also the age is also a factor. We might be too naive when we were in MS, but in MCH we had to be mature, and seniors would already think that the people are past and hence let them know everything. And I had to manage my residency period as well as I have to manage my kids. And a newbie mother has a many things to manage, and I was struggling to manage both the jobs. It was an emotional toll for me actually, because both of them were new. Pediatric surgery is new, and pregnancy and postpartum are also new. So I could not take both, but still I was trying. Emotional toll is always there in anyone who are undergoing this period during the residency period. And societal expectations are very high. So the seniors will expect juniors should manage the cases, work up the cases, take them to OT, manage everything. And our working hours were never limited as a resident. They were always extending beyond the time. And
expectations were there at the house also, like she's a mother, she has to take care of the child needs, and profession is less important, and parenting is more important. And moreover, the physical demands, both as a parent, as a pediatric surgeon, are very high. Sorry, ma'am. So
Yeah.
Sewing was that you can't be a surgeon and mom at the same time. But there were many triumphs also with that. Community support. Community support was extended for me, especially. The nurses were very helpful to me. So extended, they were sharing their lunch boxes with me. The faculty were helpful. The colleagues were also taking. I mean, they were ready to make exchanges. So anyone who is planning to make a pregnancy or postpartum during the pediatric surgery should have a community support also, because it was old saying that it takes a village to rear a kid, but now it takes a village for the pregnancy journey. And a supporting partner is all obviously important, because gone are the days when the wife has to get up, cook, prepare everything, and leave the house and go for work. Now everyone is sharing the things, so supporting partners also need adaptability. Adaptability to both as a pediatric surgeon as well as a parent is a little bit better in a surgeon mom probably. And continuous learning is there, but continuous learning as a parent, as a pediatric surgeon, both of them are there, but we have to manage both of them. Finally, I would like to say pregnancy, postpartum, and pediatric surgery were hand in hand. Anyone who are I mean, it is a myth or a stigma getting pregnant during residency period is not. It is a stigma. Don't get pregnancy during residency period. But now with the increased incidence of assisted reproductive technologies, which we are seeing lately, even if you are pregnant during this residency period, we need not worry, because the situations have changed. We might be lacking for 6 months in our career, but finally we are finishing our family, and when the time the child is able to manage independently, we are also able to manage our career independently. So we can, the demands of a challenging career with joys of family life, both can be managed off. And I have built my family with the help of my pediatric surgical family. Thank you.
That's a great presentation. Overcoming motherhood and mom guilt is very difficult, and also we have an additional surgeon guilt also. And over to our expert speakers, Dasmit sir, Vaishali ma'am, and Pingali Gopal sir. Please add your insights.
Should I go ahead?
Yes, please.
First, I would like to congratulate the speakers for the excellent talks they've given. This is a really nice meeting we are having today. And congratulations to all the organizers and the speakers. Regarding the work-life balance, I remember reading a message yesterday on our IAPS WhatsApp group where Dr. Rajesh, I believe, he was mentioning that it's more a matter of work-life integration than a matter of work-life balance. So the trick lies in setting your priorities always, and then trying to balance those priorities. So your work and the rest, because your work is a very important part of your life. It is not separate. It is not a different part. You cannot keep it separate from the rest of your life. It will, all the aspects of your life are always intermingled together. So we have to set that balance according to our priorities. And we have to remember that our priorities are going to change. They will change according to the time, according to our age, according to the circumstances, according to where we are. So that has to be kept in mind, and we cannot expect ourselves to be doing excellent all the time. We have to set the bar according to our abilities, according to the circumstances. And what we need to remember, particularly the young, the budding pediatric surgeons, is you cannot focus on the highs and the lows every day. You need to focus on the average of your performances, and then you need to improve on that average every day so that you keep on improving. That is what we need to remember. We need to accept our abilities, and we need to work on improving our shortcomings so that we can do better and better in our work. That gives us satisfaction, and we can then focus on our personal lives and our hobbies and other things as well. Thank you.
Can we have Pingali Gopal sir and Dasmit sir to give their insights? I think we can take 2 more minutes.
Pingali, are you going ahead? Or should I?
I'll give you the honor. That's me.
Okay. So see what keeps me going. I am into n number of activities. What keeps me going is that I do not mix up activities. I have time allocated for each and every activity. Okay. So for me, I think getting into multiple activities is really the key to success. It acts like a fantastic stress buster. For me, music as a child, as a kid also, music was my passion. Played in the college orchestras and played with Pandit Shiv Kumar Sharma. Playing the tabla with him, learning from him. He was a very good tabalchi. It gave me so much of insight into living. You don't live to just run one profession. Your profession is one part of your life, and as long as you can view it like that, it gives you sufficient time. You have time allocated for your family, for your parents, you for society, for doing charity, for working in your religious place of work, for pursuing your passion. Each and everything should have a time dedicated. It need not be on a daily basis. It can be on a weekly basis or a monthly basis. But paying attention to yourself, to your health, and to the health of everybody around you, not just your patients, is I think the key to a happy living. I totally agree. I think Shravanti was the one who mentioned that you do a good surgery and you are on a high, and one complication and that really puts you down. It ruins your day. That's when you need your passion coming in. If you paint, you go home and one bad case and you just go and paint and it takes away the blues out of your body. I think that's the secret to success. So always run something parallel with your profession, and that keeps a very good balance to your mind. Thank you.
Absolutely. I think I agree with Dasmit on this. And my rule is actually 50% of your time and energy should be toward your professional work, and 40% of your life, I mean, that's my personal way how I go about it, is towards my family and friends. And 10% is absolute me time, where I have to look at my own growth, personal growth, apart from all my profession. Because whatever you're going to achieve in profession, ultimately at the end of the day, nothing really matters in the end. So you're going to do just desireless action. That is, I think, the biggest dharma we can do as regards to the action. But I think cultivate non-medical friends, have an exercise schedule for yourself, cultivate hobbies and passions. And I think your family is equally important as your work. I think that's for me.
Yes, and the pandemic actually brought home the fact to us that there is more to life other than work, isn't it? That family is important, that other things are equally important in life.
Absolutely.
Yes. So I think this end of our session, and then we'll go to the next session, hosted coordinated by Dr. Arun Prasad. Thank you, speakers and expert speakers, for your valuable insight.
Thank you so much. Thank you.
Thank you. Thank you. Thank you, ma'am. Thank you, sir.
Hello, everyone. Hello, everyone. We'll proceed with the next session. It's about health, fitness, and wellness, and fixing our own health. And being a pediatric surgeon, and we all will definitely, being a surgeon in itself, we will definitely need a fitness, and we always prioritize it the last, comparing to our professional career and everything. So I would definitely suggest every one of us to enjoy the upcoming session, which will be a little more lighter than the upcoming previous session. So,
only 50%.
So our speakers are going to be Dr. Mithun, Dr. Padma Karve, and myself. And our expert speakers are Dr. Manjusha Sailukar and Dr. Rajneesh Pudumbale and Dr. Srinivas Rao. So we'll start. May I ask Dr. Mithun to go ahead and start the session?
Hi, good afternoon, everyone. Thanks for the opportunity. I'll be briefly sharing about my fitness journey. So initially, I started my running at the age of 12, 13 years when I wanted to become next Sachin Tendulkar, but unfortunately it didn't happen. So I started off running, and majorly that was the major fitness part of my thing. Then during MBBS days, I actively played and represented university in hockey and cricket, where running was again the part. So that continued till my PG days in NH. Then once, although I was overweight, but I could do all the activities and I was quite flexible. But once I moved to Surat and started working as a independent consultant, where the caseload was high. So I started suffering severe neck pain, trapezitis, and even I had tingling sensation in my hands when I was having a huge caseload, especially laparoscopy. Then I gained weight also around 12-13 kgs in my first year. So it came to a point where I had cervical, some disc bulge and all. So then I decided I had to do something, because running I did for 20 years, but I never lost weight with running. I was just maintaining the weight. So I did few things. I cut down my sugar. Like next 3 months, then I never had any sugar. Then I joined a power yoga class, and slowly with diet I joined a dietary advice, and where I followed it strictly for next 3-4 months. Then I could lose about 15 kgs. Then my fitness immediately improved. Like there was a sudden change, more than 20s. Now I feel I'm more fitter, where I was only running. Now with the combination of yoga and running, I'm able to concentrate more, perform surgeries without any pain, and work for more hours. So, and what I realized in this last 2 years is diet constituents of 18%. Then the fitness is solely the running, swimming, that is only 20%. Diet is extremely important. I cut down on carbs. Like I started millet based food thanks to my spouse who started preparing that. But that really helps. It keeps your stomach full and helps in weight challenge also. So I had a nutritionist also. I took help of her also. So it's a good to have invest in those things. So I was able, now I'm free of any neck pain. I had a severe neck pain where the neurosurgeon told if it doesn't subside, then you might have to undergo a surgery also. So now I'm continuing that. So that's the basic journey of my fitness. So what my advice is, like when whoever starts off even with half or 1 kilometer run also is a very good. Don't look at like I have to do 5-10K at one day. And stretching before any exercise is extremely important, because you will have hamstring or quadriceps tear or sprain. So stretching is extremely important. Start with slowly and come up. And along with running, you can do simple, no need to go to gym, some floor exercise, weight training exercise at a home or a garden, anything that really helps. That will make your body also toned. So for starters, start off with slowly and then go up. Don't go suddenly, because your body muscles are not used to it. So yeah, that's my brief journey. Yes. Thank you.
Thank you, Dr. Mithun. We'll take the questions at the end of it, and we'll proceed to the next session by Dr. Padma Kave, our ever young Yuvacon, and she has quite a lot of things to share with us. And I'll be sharing your screen. And can you make me a co-host, please?
Hello.
Yeah, you are co-host.
Can you hear me?
Sorry, just a minute. No, I need my laptop also to be.
Can you tell me the user ID?
Yes.
Am I audible?
Yes, ma'am, you're audible.
Yeah.
Sir,
can
you see my video on that? Huh?
Yeah, Dr. Arun, please tell me your username. The one that needs permission.
I'll
start
you'll be able to
talking.
see my video in that other one.
Yeah, I'll start talking.
Yes, ma'am, please.
Yeah, I'm Dr. Padma Karve from Pune, and I will become 65 years in October now. I started private practice in 93. My daughter was then just about 1.5 years old. Now in childhood, we had an excellent childhood because we never had any landline phones, TVs, screens, cell phones. So we were playing all the time. I was never into sports actively, but a lot into dance, music, and reading. When you start studying for your pre-medical, medical, MBBS, complete karke, MS, MCH, I think we are pretty active because we are working and walking day and night. After starting private practice, I started swimming with my daughter when she was 3 years old. And that started my fitness journey. I became an excellent swimmer. My daughter went on to even do competitive swimming. I started walking daily because I found it was very relaxing. As you can see, the short-term gains of any physical activity which boosts your heart rate and makes you sweat, it makes you feel better, it controls your appetite, and it improves your sleep. So that was great, and it helped me a lot with both home management, child management, and professional, of course. It increases your stamina and endurance, and that is a great help because we as pediatric surgeons are running around major cases with sometimes. Can you hear me or no?
Yes, ma'am, we can hear you.
Yeah, it's okay. The pictures and the talk are nothing much like, it's okay. Then I took up cycling besides walking. Then I realized with some friends that we are walking pretty fast, both uphill and downhill. We are lucky in Pune because we are surrounded by the Sahyadri hills and mountains in all directions. So anytime you want to go out, you just have a short drive and you can start climbing hills. We started jogging, which I landed up running so many marathons that by that I started running at the age of 39. By age of 44, I had run my first half marathon. And now that I've completed 64, I think I've done more than 25 half marathons, 2 full marathons. The first was to celebrate my 50th birthday. The second to celebrate my 51st birthday. In the meanwhile, the trekking was going on very well. I started trekking in Sahyadris over the last 25 years. Later, I started trekking in the Himalayas. I've done more than 10 or 12 very high altitude treks and about 10,000 many innumerable ones. All these fitness activities, I realized, are making me a much calmer, happier, and balanced person, both in personal and professional life. As you all are doctors, you know that physical fitness is great because it gives you mental strength, emotional strength, besides making you physically fit. It keeps away a lot of chronic diseases like cardiac, hypertension, diabetes 2, depression, dementia. I think even some types of cancer, I've heard stroke. It builds muscle strength and bone strength. So I think all of us should commit some time in our daily routine. You have to fit in half an hour to 1 hour for our own personal exercise. That exercise I would advise should be aerobic or cardio because those are the endurance building exercises. Anaerobic short bursts of speed, bursts of jumping are good, especially for younger people. But as you get older, you want to have more stamina, endurance, and physical fitness, like I said. So walking daily or maybe little running, cycling, swimming, even dancing, they all are excellent for your health. And now, after completing 65, I'm doing a very difficult high altitude trek in the Himalayas. I'm going for the Bali Pass trek in October end. And all this makes you realize you're exposed to nature. Nature, let me tell you, is a power by itself. It's beautiful. You're exposed to the vegetation, the trees, the shrubs, the birds, the beasts. And then you realize it is also very furious and very vicious and scary. And once you go for a trek or a run in the jungle or in the hills and mountains, it brings you down to the ground and you realize actually we are nothing much in the larger plan of things. And I think it helps to keep you humble. Maybe this is a way of a meditation when you're exposed to physical challenges and nature. But like I said, we should exercise, at least walk half an hour to 1 hour, maybe 5 to 6 times a week, and give yourself at least 1 hour to do something which you enjoy, read, sing, listen to music, dance maybe, or just even lie down and have 1 hour's deep sleep. That's good enough. But be committed, because I firmly believe unless you take care of yourself, I don't think we can take care of others around us, our loved ones, or even our professional patients or our staff. So be very careful that you're physically active right till the end. That will take care of all types of health: physical, mental, emotional, social, and spiritual. Thank you very much, all of you. And thank you for the organizers to give me this opportunity. Thank you.
Thank you, ma'am. Thank you so much. Yeah, that was a very inspiring talk, ma'am. And we had quite a lot of nice pictures and quite an adventure seeking, and you have tried quite a lot of nice activities.
You realize one thing in all these pictures, we are not actually posing for those pictures with a smile. When
Absolutely,
we go there, we always have smiles on our face. That's the joy of even physical challenges.
That's really great to hear, ma'am. Thank you so much. Next, I'll be continuing the next show. Yeah, hi. So I am Dr. Arun Prasad, and I am from Chennai, and I did my pediatric surgery training from ICH Chennai, and followed by a fellowship in pediatric in Ramchandra Medical College. And I am a Yuva surgeon practicing currently in Chennai itself in a corporate hospital. So the main goal is just to improve ourselves, and every single day, we just have to be better than the day before. That is the only thing that I really I always have it in my mind. And I like to run mostly. I have done a few marathons and a few other small runs. And so the main thing that I would like to share with you guys today is to what is the crucial thing, how crucial it is to prioritize our own well-being, so that we can provide optimal care for our patients, so which can definitely hinder our progression of career itself. And we have to do a work-life balance, which we just saw in the last session. And of course, after all earning all the money, then we should be fit enough to enjoy that. So we just live only once. So that is even more important than anything else. So I would like to focus on all these 4 areas for the young people. This is what I would like to follow: regular exercise and proper mindful eating, a good sleep, and keeping a good proper mental health. Activities wise, people can choose their own depending on their own body type and their interests, and what works for them. Some people like running, some like cycling, some will have back issues and knee issues, which they can go for swimming, which is a very good activity. Sometimes we may not be it might be accessible, so we have to choose which is working for us. And at the last, playing with our kids and taking care of the kids itself is actually quite an endurance building activity, I would say, in my personal personal day-to-day activities. So I would definitely suggest people to go ahead with a do and half an hour session at least a day, any type of activity, whichever you like. And it doesn't matter whether it's a weight training or whatever it is. If you're particularly a person who likes to go to gyms, or that is the only option that you have, please opt for core strengthening sessions, particularly people who have neck pain, back pain, and knee joint and areas. Core strengthening sessions and muscle building is definitely will be helpful for us. Weight training is an optional with the personal interest. People who like to do bodybuilding and to show off the muscles, they can definitely go ahead and do it. To last long, to keep things running for a longer duration, you just have to. I would like to suggest that we have to make it a little more fun. Keep giving yourself some fitness challenges, and there are a lot of other apps. You just can use that. Use 8,000 steps a day, so much of distance running, cycling, everything, and you can form a group, and you can just have some fun competition with your buddies. so that you can, for that you will do something more extra. You can push yourself a little more extra. So you can run, exercise, do as a yoga as a group. It will keeps you motivated, and it you will not fall off from the radar. Your peers will definitely help you bring back. And the fun of being with the peers is the most important underrated thing. That will definitely bring you back. That's the only thing that worked for me really well. And you can don't bore yourself with a single activity. If possible, keep trying different other activities too, so that it keeps you fun. And if you are not able to do it one day, please don't be hard on yourself. Definitely, it's another day. Definitely, you can get up the next day and definitely can go ahead and do it. And these are one of my few gangs. Definitely, these are my running buddies. And having a big gang definitely helps you. If you are a beginner, try to join some neighborhood club in the initial days, because the main important thing is that we'll pick up a lot of injuries when we do it ourselves. I had that issue when I did my untrained run, and I did had a stress fracture in my thighs, and then I had to take a long break, and then I had to bounce back with after proper training from my club and activities. And find out which works for you. Try different things. Which excites you the most will be the one which you will usually passionately follow. And please try to be consistent, and that is definitely is going to dedication will be the one thing which goes for long duration. What the situation, the schedule I try to follow is over the past 2-3 months was like 3 to 4 days of running per week, and 2 days of core strengthening, and we can mix on another day for other activities, and definitely on mandatory break for a week is definitely needed. And so then one day at a time, definitely focus on one day at a time, and compare yourself with only on the previous day, not with others. Consistency is the key, and do enjoy life to the fullest with a fitter and healthy life. Thank you, everyone.
Excellent presentation.
Yeah.
Do we have anything? Any speaker? More speaker?
Nothing. No, that's all. We all three are there, and I would like to open it for our experts to give our opinion, and I would like to invite Dr. Manjusha ma'am to give some of her opinion on this.
Excellent presentation by all, and it is really inspiring from Padma madam as well as Dr. Mithun and Dr. Arun. They have covered most of the points in the motivation, the fitness. Madam, I would like to ask you 2 questions. How to stay motivated in this fitness journey?
It's very simple. Be disciplined and make it a habit. Exercise has to be a part of your daily routine, just as you eat and drink. You go for your work. Exercise has to be one of those things. So you get so used to it that if you don't do it for 3 or 4 days, I miss it. And I go running the 4th day.
Yeah,
it
basically
has to become an habit.
Yeah.
It has to become an habit.
And for the beginners, you have any advice?
Beginners start walking. Walking is still one of the best exercises ever. Gradually increase your speed so you become very fast walkers. Always remember that whatever exercise you're doing, whether you're walking or running, just simple dancing with your tab in front of you, you have to sweat a little bit. Your heart rate has to go up, because otherwise there is no benefit. You can't just stroll around. You have to walk, push yourself, and you'll see the improvement. And all the young women, it's very important because you get a glow. And I don't feel 65. That's the benefit.
You don't look either.
Absolutely.
Oh,
You don't look either.
Absolutely.
So you are the outstanding speaker of Yuvacon, ma'am. As per age, you are not Yuva, but you are the most Yuva person by heart.
Recording in progress.
So you have been included as the speaker here.
So basically, for the beginners, you have to start slow, stay committed, and listen to your body.
Yeah.
And you have to set your goals, whether you want to decrease the weight, or whether you want to just feel happy, or whether you want to relieve your stress.
See, Manju, when you are doing these physical things, I think becoming slim, looking smart, carrying yourself tall, and that attitude, because you meet people, you become more social, you make more friends, and you are so fit and happy that that's a, I would say, बक्षीस येते. म्हणजे you become fit and you look good. Okay, so the benefits are different.
Yes, yes. And as
Vikesh and Srinivas, can you tell us how you allot time? How you buy time for this?
Yeah, for me, 3 points from my side. Thanks the IAPS for involving us. The first thing is the career of any pediatric surgeon growth starts very late by 45 years of age or something like that. So when your career peaks at 50, 55 years, your skeleton and joints should not give away, and you should not shy away because of the shoulder pains and neck pains from doing any long surgeries. So it is important for the young surgeons to maintain a good, healthy skeleton, very strong skeleton, to prepare themselves for a long career at beyond 50 years of age and all that. Point number 2 is 3 areas of our skeleton needs to be strengthened or improved. The first thing is the shoulder girdle, which can be strengthened with the help of weights and all that. The second thing is the pelvic girdle, which become weak, and then you will have disc prolapse and back pains and prolonged surgery while doing standing position and all that. So the shoulder girdle must be strengthened with the help of weights. The pelvic girdle must be strengthened with the help of running, squatting, things like that. The third important thing is the cardio. The cardio exercises are only cardio things are improved only with running and jogging. So my schedule is we do 3 days of jogging. I do nearly 150 kilometers per month. That is the schedule. And I do 3 days of weightlifting or some kind of muscle strengthening and 1 day rest. That is a normal schedule if I don't have a long OT list in the hospital. The third point I would like to mention is these muscle strengthening, the running and jogging. These things are not done to improve our looks, to look like Salman Khan or a person like that. It is done to improve our stamina. It will improve the focus, and it will improve our patience while performing very long surgeries, standing and doing some long laparoscopic surgeries and all that. So it is very important for the young surgeons to maintain a healthy, strong skeleton for them to have a long career in the operating team, in the operating room. So that is my advice to young surgeons.
Thank you, sir. We'd like to have a few more words from Dr. Rajneesh too. Rajneesh, sir. Dr. Rajneesh, is he here?
Can't
Yeah.
hear.
Rajneesh sir, please unmute yourself. Rajneesh sir, we cannot hear you. Can you unmute yourself, please?
Sorry, yes, sir. Now you're unmuted.
Yeah.
Yes, sir.
There's some issue with his audio, I think.
No. I think he had put headphones on Bluetooth.
We have a very good group in the IAPS fitness group, where we keep seeing all these marathon runners posting their runs. There are marathon runners, mega marathon runners, giant runners who runs for 100 kilometers. They run for 120 kilometers, things like that. Very, very inspiring, ma'am. First time I'm interacting with you directly, Dr. Padma Karve. We keep talking and we seeing your data and all that in the IAPS fitness group. Very inspiring and very, very touching.
Rajneesh is a very, very good runner, and he couldn't be heard, but he's organizing many marathons, I suppose. He was my colleague when I was doing MCA.
Consistency is the key. So you have to be consistent and then stick to your time. And core strengthening, shoulder strengthening. I mean, we are laparoscopic surgeons, so it's very essential. I think Vikesh is someone who will stop his phone and then he won't talk to me when he's exercising. So he's very fitness freak. I have a second, So like that, you should be very strict with yourself and your colleagues when you are doing exercise. That is very important.
He can just start with pillar to pillar.
I think I have succeeded in unmuting myself.
Yes.
Am I audible now?
Yes, yes, sir.
Yeah, thank you. Thank you, Manjusha. Sorry for interrupting. Uh, uh, Bad on my part to be not so tech savvy, but that was some wonderful presentations, and Arun and Padma Madam and Mithun, they've given us a very good overview of how fitness should be. A few takeaways, I think, if I would like to summarize all the three: diet, very important. You can't be well without having a balanced diet. Each to his own. You have to look after your requirements and take a help of a dietitian and fix what is good for you. Second, core strengthening is, I think, one of the key essentials to being fit, because and cardio, people lot of times just fit. They will concentrate only on one thing, which is maybe running or cardio, but no, your core is most essential. It binds everything together. And so everybody should be focusing on their core strength. The third thing, which I think no everybody missed, is use of gadgets in fitness. I mean, you will have a host of gadgets at your disposal to record your fitness. So how important or not important is that? So as far as gadgets are concerned, they are useful. So as you advance in your age, don't overdo. Wear a heart rate monitor. Don't go overboard with your cardio or with your heart rate. If you are having anything ill feeling any time in your workouts, just stop. Get a regular health checkup before you are going into any kind of endurance activity, especially long distance running or cycling. And especially as you advance in your age, you must have your regular health checkups. Everybody will tell you, Are, you are running 5K, 10K, you are marathoner, you don't need a health checkup. But no, that's not the way to be. Before you embark on a fitness regime, you must have your health checkup done, so that because everything said and done, your longevity is as important as your fitness. So that's very important. And one last thing is, always include your family. I mean, have your friends, run buddies, everything, but unless you include your family in your fitness regime, it is not going to work really well. Because in the long term, if your spouse is there with you as your running partner or as your fitness partner, you have to have the same kind of diet at home. If you have to follow hours in your fitness regime, it's better to take your family along and let them also be a part of the fitness journey with everybody. So with that, I think I will congratulate Vikesh and the entire Yuvacon team to be bringing out such wonderful topics for everybody. Thank you.
Thank you, sir. Thank you so much. Over to Dr. Abhirambi for the next session. Thank you.
Thanks, everyone. Thank you. Bye.
Thank you.
Dr. Ajay, please take over.
Yeah. Good evening, everyone. What an inspiring session it was. And quickly, we will move to the next topic. And we will be talking about pioneer as a pediatric surgeon, or pioneering as a private practitioner in different cities. And as a speaker, we have Rahul Dev, Dr. Anis, and Dr. Shishir, and myself also. And for experts, we have Dr. VVS Chandrasekharan sir, Dr. Amar Shah sir, and Dr. Devendra Tade sir. I'd like to call Dr. Anis to talk about pioneering as a private practitioner. Dr.
Good afternoon, everybody. Can you hear me?
Please share it. Yeah, we can hear you.
Okay.
Kindly share your screen.
Yeah, share it. Can you see?
No, it's not visible. Yeah.
A very good afternoon to everybody. Thank you to the speakers for giving this opportunity for talking about pioneering private practice. I'm Dr. Anis Ratani. I have cleared my MCH in 2018 from BJ Medical College, Ahmedabad. I had practice for 1 year in a corporate hospital from 18 to 19, and afterwards I was
क्या
there.
नाम है तुम्हारी लड़की?
Afterwards, I had my practice in the. Can you hear me?
Yeah, yeah.
Yeah. So while starting the practice, it is always a difficult thing to decide. Okay, should I start my practice or no? So it all depends on your location. Everybody of us fear, should I go to my tier 2, tier 3 cities, or should I settle in a tier 1? So what happens, you always know your area's geography, how many pediatric surgeons are available in your geography, how much is the area which is uncovered, and the level of MCS training will always teach you what amount of risk you can take, how much you are trained well enough. Because after completing your MCS training, you will have the confidence to operate, but you have the confidence to operate under the guidance or under the vision of some surgeons or other seniors or colleagues. So when you go out to private practice, you should know your limitations. Okay, this is so much I can do it alone. For this, I need some other consultants, and for this, I will call somebody who's very much special, who's doing special cases like advanced laparoscopy or advanced reconstruction. So, and also you have to see what is your partner doing? Many of us will be having a doctor spouse, so you have to look about that also. Is she, one of you should be in a fixed salary, one of you should be taking risk. Because if you both are there in the fixed salary, there will be a difficult part to have that much economic growth. So what all you need to have? So location or area wise, we can say area. First of all, if it is difficult to buy out a big area, because maximum, if I had started my practice with a small setup, I had set up in around 1400 square feet of area. So in that I had a OPD, operation theater. Then I had a waiting room. Then I had a couple of special room and one general ward, because we were not taking very high risk patients, like doing all the daycare cases, or some cases we'll be operating in our setup and we'll be shifting it to the pediatrician for the PICU, or we'll be shifting it to the NICU setups. Or if required, we'll be going to their setups to operate. First of all, during your MCS training, you start looking about staff. Staff is you don't need to have a qualified ANM, GNM, BSc, MSc nurses. Look about youngsters whom you can train. If I am from Gujarat, I am doing my residency in Gujarat, in Ahmedabad. So I know I am going to settle down in the same place. So try to find out a person who can assist you with the cases. See, getting staff today in a practice is very expensive. So to pay them, you should have some person you can pay them less, but you can get more work. For thing, this happened to me. I had trained one person during my residency who was helping me with all the small chores and all. Will be cleaning my instruments, washing. Then he came down to be my assistant in my private hospital also. So from that we began. So now our journey both together is 6 years, 7 years. So that also becomes a big good bond. So I don't need any other staff to be handling. So I can teach him to put a Vigo, you can do all the small stuff. Next thing is instrumentation. Invest maximum in your instruments. It is like when you are going to start a practice, you go full blow with your instruments, with a cystoscope, with a laparoscope, with a bronchoscope. Because once you get a reference from a doctor, and when you tell them, yeah, I don't have a bronchoscope, I don't have a cystoscope, then the doctor will always think, yeah, he is not having that much of instrumentation or backup, so the referral will decrease. So never deny any patient. So if not denying that, you should have all your instruments, a hyposphere setup or your laparoscope setup, even if refurbished also, but buy it and keep it so that you can use it. And have a tie-up with other faculties. General surgeons are our friends, because when they will be
Dr.
having
Anis, we
many
have
cases,
1 minute more. So we'll quickly wrap up.
Don't try to be a ghost surgeon. Ghost surgeon is no, okay, when you'll be operating and the patient will not be knowing, okay, who's going to operate that. So always talk to the patients, have a good rapport with the patient, because it is like investing in your patients is going to get you more surgeries afterwards. So that's why I always tell, okay, bank balance is not always a criteria for a good surgeon, because Nawazuddin Siddiqui is a better actor than Salman Khan, but not in the matter of the bank balance. So always try to be Nawaz in a long term. If you have a good surgery, good rapport with the patients, then it will be a better outcome in a long term. You're not playing a T20 match in a private setup. So many troubleshooting are like selection of cases in private. Uh, till one limit you can take the risk. So after that, you should not be taking all the cases for the private practice. So only thing which you can digest, you can manage, that only risk you can take. You cannot take a child with having a 3 gram hemoglobin with a perforation and you know it's going to have a catastrophic intraoperative outcome. So risk taking should be always be like clarified to you how much risk I want to take, and be true to your patient. Explain all the risk of anesthesia, complications, and everything to the patients. If you are true to the patients, then even if complication happens, you will be able to handle easily. And you always know you are a doctor, not a Rajnikant. So don't have a fight with the relatives. Something goes wrong. Try to keep them explaining them, because things are going to go wrong in private practice. It is not like always it's going to go it your way. So always you keep a senior doctor in a loop. You have a colleague in a loop. When you have a finding a difficult case, then keep 2 doctors to operate. So that when you're having 2 surgeons operating on one case, it is like 2 minds are acting on that. So once you are getting blocked, the other person will help you to come out of it. And even if there is a medical legal complications, if 2 doctors are involved in a case, there are less chances of you getting penalized or all the stuff. And follow the government norms like area wise, the fire safety wise, the property tax, the professional tax, whatever, you keep it up to date. Because right now what's happening in the fire safety, we had a big fire in Rajkot, and that's why every doctors are now getting notice for the NOC for fire safety. So always patient safety is always your priority. Be true to your patients, and if you are taking your patients in their first priority other than money, then it will be good for you. If you are keeping money as a priority, you'll have a short T20 run will be good, but it will not be a long term good for you. After some time, everybody will realize this hospital or this setup is not having good results. So always be true to your patients and follow the norms. So always keep
Thank you, Doctor.
10 years vision.
Yeah.
Yeah. So vision is like marketing. जो दिखता है वो बिकता है. Be a part of local associations, Indian medical associations, your local surgeon association, local GP association, and always keep on developing a secondary income. Whatever you earn, 20% you invest. That I had started during my residency. From my residency, I was saving money. So I saved money. When I passed out, I could buy my instruments from my saved money from my residency. That is what every time when we work, we keep on saving. So always the secondary income is always better to support you, because sometimes the practice will not run. Like during COVID time, all the private practice had stopped. So that time you need something to support you. So keep evaluating yourself in which part I'm good. I'm good in thoracoscopy, I'm good in reconstructive surgery, I'm good in laparoscopic surgery. So जो आपका best है, you keep on refining the edge. So you become like ninja sword. So ऐसा नहीं कि you should not be jack of all and master of none. You just be a master of one and jack of all. Okay. Thank you. That's all.
Thank
from
you,
my
Dr.
side.
Anis. That was such a nice talk. I'd like to invite Dr. Shishir Yadav, sir.
Yeah. Dr. Ajay, am I audible?
Yeah.
Yeah.
Can you share your screen?
Yeah. Just a minute.
We'll stick to the time because we are already late.
Yeah. I'll keep it very short. Yeah. I'll keep it very short. Yeah. Am I audible right now?
Yeah, you are audible.
Yeah. First of all, very good evening to everybody. I would like to thank Dr. Ramesh Babu, sir, President IAPS, and Dr. Vikesh Agarwal, sir, Secretary General IAPS, for bringing us all pediatric surgeons at this platform. So I'll just introduce myself. I'm Dr. Shishir Yadav, presently practicing in Sangli, Maharashtra. It's a district capital city in state of Maharashtra, and it's situated at the border of Karnataka and Maharashtra. So it was basically started by my father, Dr. Sudhakar Zado, who is also a director of this hospital and is recently retired from his practice. And I've taken over this hospital since past 2 years. So he started this practice in 1990 with a 10-bedded hospital. So I'm just giving an overview how we have, over the years, we have expanded just to come to my key takeaway message, what I want to give to all these Yuva pediatric surgeons. Just a minute. So we started in 1990 with a 10-bedded hospital, and we used to serve only to daycare surgeries. In 1997, we expanded to 35 beds. In 2011 to 50 beds, and 2024 to 100 beds. And right now we are a DNB pediatric surgery running hospital with a panel of over 20 pediatric healthcare specialists. So we have a panel of 6 pediatric surgeons right now. And also we have neurosurgeon and pediatric orthopedic surgery along with neonatology and pediatrics practiced here. So we are running all health schemes from Karnataka and Maharashtra government and also private health schemes and catered to over 12,000 free patients over the past 10 years under this government health insurance schemes. So I'll keep it very short. I want to just give a take-home message to all the young Yuva pediatric surgeons. So stay young, start young and start small. So you need to start basically with a 10-bedded hospital. You can start with daycare procedures. They will, like surgical conditions like incision and drainage, hernia, hydrocele, undescended testes. They will form a major part of your practice. So you can start it from day one right now after you have passed your MCH pediatric surgery. And you can start practicing neonatal surgeries or other supra-major or major surgeries at a nearby government hospital or any corporate hospital which is nearby as compared to tier 2, tier 3 cities. So with daycare practice at your private institute, it will give you financial stability. And with the supra-major and major surgeries done at a nearby healthcare center will give you a dominance in your pediatric setup and also help you getting glamorous in your own field. Second, awareness is very necessary right now. So I keep meeting pediatricians, general practitioners in tier 2, tier 3 cities as all the general practitioners are spread quite deep root into the villages. Attending regular meetings with pediatricians, surgical societies, and even gynecological meetings has helped me a lot over the past 2 years. And also, I keep taking general diagnostic camps, which are run by government as well as by our own hospital on monthly basis, carried out at different schools and taluka levels, which helps in screening of all pediatric crowd for any surgical condition which goes undiagnosed. And the last, so we should always keep economic factor aside. You cannot compare corporate charges with tier 2 and tier 3 cities. The patient here are going to be of lower socioeconomic status. Majority of my patients is a farming.
Thank you, Dr. Shishir. I would like to. Okay, thank you so much.
Okay.
Dr. Rahul will continue on this topic.
Yeah, sure.
Dr. Rahul.
I'll just unshare.
I hope my screen is visible to all.
Yeah, just make it full screen.
Yeah, just a minute. Yeah. So to start with the pioneering as a private practitioner, it's such a difficult topic for a pediatric surgeon nowadays. I am Dr. Rahul Sharma. I did my training of DNB pediatric surgery from Lilavati Hospital. Then I worked in a government setup in GMC Goa. Now I'm back to my home city, Agra. So we almost gone through all the things since afternoon, but I'll just revise these things. So what are the advantages of a private practice? You have to have flexibility, your earning potential, and autonomy. As a private practitioner, you have the freedom to set up your own schedule, choose your own patient, and tailor your services to meet their unique needs. About the earning potential, by eliminating the constraints of healthcare system, you can maximize your earning potential, keep a large share of revenue you generate, and autonomy. The private practice allow you to make your own decision of your career, the way you want to do practice without having answer to any administrator. So when you say a private practice to a new pediatric surgeons, what you are going to face are the challenges. So how you are going to deal with the challenges, and what are challenges one pediatric surgeon or a private practitioner will face? So these are the four important things. First is financial uncertainty. So leaving the stability of a salaried position to start your own practice, it can be financially risky, especially during the early years. So you have to be sound how you are going to manage this financial uncertainty. You need to groom yourself. One need to groom yourself, and you need to know how you are going to manage your cash flow. You need to know about basic budgeting. You nowadays there are some venture capitalists are there, investors are there. So instead of being a pediatrics only a pediatric surgeon, now you have to be a medpreneur or a dogpreneur, like an entrepreneur. So you can secure startup capital for your critical challenges what you're going to face. Another thing is regulatory hurdles. So you have to navigate through the complex wave of licensing, insurance, compliance requirement. Nowadays, there are many startups are there which can take you all these regulatory hurdles. So you have to have a sound knowledge about that also. Another very important thing is marketing and networking. Now is the era in which we all are socially connected. We are connected by a phone, by social media, or we are just a minute away from each of us. So you have to build a patient base with strong marketing and networking skills. You have to develop yourself as a brand. You have to reach out to your potential referral sources, and you have to effectively promote yourself as a brand. Then only you will be able to tackle
Dr.
the
Rahul, we have got
challenges.
1 minute only.
So
we'll make it
what
fast.
all things you require to establish a thriving practice? You have to first have a strategic vision where you need to see what are the unique value propositions you have. You have to have a robust business plans where you have financial projections, operative strategies, how to approach the market, and what are the target you are going to make. And another thing is to build an exceptional team. You have to have dedicated team including some of the medical professionals and the administrative support staff that will share your commitment to the excellence. Their expertise will be very important. These are the regulatory and legal consideration you have to know about. These are the things that we as a pediatric surgeons are very good, like personalized care, active listening from the parents, and transparent communication. But I think as a pediatric surgeon or as a doctor, we are lacking in leveraging technology and innovation. So I think we have to work on technology. You have to go through EMR records nowadays, telemedicines. You have to know about the digital imaging. You have to streamline the workflows. And if you have robots, technology, then you can go for robotic surgery. The least important thing I would like to say here is about maintaining work-life balance. If you are a pediatric surgeon and going into a private practice and initial years, so these are the words that I find out.
Dr. Rahul, we are out of time.
Yeah,
I
just
have
a
to
minute.
interrupt it.
Just a minute, doctor.
Yeah, you can carry on. Dr. Rahul?
Yes.
Just carry on. You have
Yeah.
just one more slide.
So the work-life balance, it's not about if you want to be a good private practitioner, if you want to have a large sum of patients, if you want to have some 100, 200 bedded hospital, then you have to work hard. You have to think about the target, you have to think about what you want to achieve. That is the thing. And to last my thing, I would like to say, you have to embrace the spirit of innovation that will drive your success. You have to have a zeal that will drive your success in private practice. So with these words, I would like to thank you. You can connect me on my
Thank you,
WhatsApp
Dr.
or this
Rahul.
Gmail.
Thank you, Dr. Rahul. Much has been talked about these topics, and I'd like to just summarize the things on continuing with this topic. I'm doing private practice in a tier 3 cities in Muzaffarpur, Bihar. So I was very much confused after doing my MS General Surgery and after while doing residency, whether should I go for MCH. And I thought pediatric surgery is a safe option because not much pediatric surgeons were around in this region, and the competition was less, and I could do much advanced works. But even after doing MCH, the confusion was persisting where to start. Then I decided to settle in my hometown because it has got referrals from other districts of Bihar nearby, from Nepal also, and the medical college here don't have any surgical facilities, pediatric surgical facilities. So I thought this will be a safer option. I'd just like to summarize why private practice, why to start your career as a private practitioner. The advantage of private practice, of course, it gives you a social recognition and a respectable income, and it has a great growth potential. And of course, if you are living in a tier 3, tier 2 cities, it gives a better saving. And you have also flexibility in your patient care and treatment options. You can give them personalized approach, and extended consultation can be given. Flexible scheduling can be done because most of the time both parents are working, so you can do evening OPD. And of course, if you are doing a private practice, you are doing your work on your own. There is a reduced bureaucracy. And there is a lot of potential for community growth, like you generate occupation. If you are doing private practice in your own hometown, it gives you a cultural competency. And of course, you can support public health initiatives and create awareness, which is very essential. But we have to anticipate few challenges, like for starting any private practice, we have got limited resources and facilities, especially if you are the first generation doctors, like untrained staff, poor management team, instruments, and then you have financial constraints because most of us will be having family by this time, and we will be getting competition from established healthcare facilities. Most of the like super specialties, those who were working in cities, they either referring or doing my cases also. Like starting, I made my strategy. I was getting patients, neonate, children, adolescent. Most of the patients were taken by initially by general surgeon, minimal invasive surgeon, neurosurgeon. What I used to get was only neonates. But I started and I kept doing neonates. I kept few risky cases also. But after some time, after building a strong referral network with local physician and hospitals, and I started getting cases from the children and adolescent age group also. So what will be the success for a strategy? Strategy is to build a strong referral network and always keep on embracing new advances and implementing cost-effective yet high-quality healthcare solution. What I am doing is we are giving cases on, means like we are doing practice on bulk volume cases. We are the highest the cost that is the patient is getting is 15,000 only, but we are doing more than 6-7 cases per day usually. And we have to engage community people also, and we keep doing education programs so that awareness will be there. Finally, for last 1.5 years, I am running Department of Pediatric Surgery in Kejriwal Hospital at Muzaffarpur, which is the first dedicated pediatric surgical center of this region with 20 bed facilities and with more than 75% bed occupancy. We have done 6,000 OPDs in last 1.5 years with 100 surgical cases in last 1.5 years with low cost and high volume strategy. What is my vision and mission? We have to reach more numbers so that this bulk volume business model can work, and we have to keep introducing newer advances. I have started keeping minimal invasive cases on weekends. We have to get NGO cooperation and different faculty collaboration. And at the end, by 2030, we have to make this center as the largest regional center for pediatric surgery. Thank you, Yuvacon. Now, I'd like to take the talk to the experts so that they can give us some insight about these topics. Dr. Amar sir, Dr. VVS Chandrasekharan sir, and Dr. Devendra Tayade sir.
So I'd like to congratulate IAPS and the entire EC team for this excellent meeting. It's really a good insight for one and all. I mean, I'm also in private practice for almost 20 plus years. The only thing that I would like to suggest the new beginners who want to start their private practice, that it is not a complete no. You need a bit of courage and you need a bit of planning before you start private practice. The things about private practice are the king of your castles. So in a way it is good, but in a way you have to take all the responsibilities on your own head. Right from staff management, right from logistics, right from legal formalities, right from licenses and everything. I mean, at the end of the day, everything, I mean, even though you may have people who are going to look after it, but at the end of the day, everything is your own responsibility. And you have to very well know that, because if anything goes wrong, then at the end of the day, you would be the one who will be answerable. From the medical point of view, I would suggest to keep a 80-20 balance. In your initial days of practice, 80% of your income would be coming from simpler cases, and these cases are going to give you only 20% of stress. Okay, and the remaining 20% of your, and the remaining 20% of your income will be coming from complicated cases, but it will give you 80% stress. So you have to balance out your life in such a way that you get maximum amount of income and minimum amount of stress. So have the case selections very wisely in your initial phase. In the initial phase, you may think that, acha, mere paas itna complicated case aa gaya. So people are thinking that I am great or I am very efficient, but that may not be the case. A shrewd practicing pediatric surgeon may have silently negotiated the case towards you, because he would not want to have that headache. So it's not something that you need to be proud of, but you need to be shrewd enough to select your cases in the initial part of practice. The other thing which is important is to see how you invest your logistics. You do not have to invest your entire amount in getting top of the notch equipments. Okay, if you see your colleague who is practicing in a corporate hospital posting laparoscopic videos on a 4K stored system, and you think that I am a practicing private pediatric surgeon and I should also buy a 4K stored system, then that is not what you should be doing, because then you should calculate how much are your patients going to pay you if you do a laparoscopic appendicectomy on a 4K system, or you do a laparoscopic appendicectomy on a HD system. So that is how you should plan your logistics as well. So that is my little bit of whatever you may consider advice or just my experience. VVS.
Thank you, sir. VVS, sir.
Yeah, very good evening. These are very interesting sessions. I have been a private practitioner for about 23 years now. Initially, it was not out of choice, but out of force. There were no job available in government service. So, I think private practice is very good in certain ways. For example, I'm one guy who hates sticking to times. If you ask me to come at 9 o'clock, somehow my mind never allows me to come at 9 o'clock. And I can't just sit and while away my time just because I'm in a hospital. I have to stay till 5 o'clock. I cannot do that. So for me, it works extremely well. I can set my timings, and this I've done from the word go. It's not that if you are a junior, you cannot set your timings. Yes, you need to be flexible, but at the same time, you can, kind of bargain your timings a little bit. Second thing, in private practice, it gives me the opportunity to do what I like to do to the patient. I mean, if I'm in service, there are senior people in the department who are senior to me, so I would probably have to listen to them. And, maybe I may not like it all the time. They may not like it all the time. So, but, in private practice, at least I can do what I think is right for the patient. But you need to remember what Amar has said, that you need to be careful when you choose your patients, and don't try to be, somebody said you're not Rajnikant. Yeah. So you're not Rajnikant or Pavan Kalyan. You cannot do a lot of these major procedures just because the patient has come to you in private practice. You need to be careful. The other important thing is, if you're into private practice, you have to do a lot of regular stuff, but don't limit yourself to the regular stuff. For example, I tell all my juniors, everybody fights for hernia, hydrocele, circumcision, interception, and appendicectomy. It doesn't work that way. It doesn't. There's the number of doctors, pediatric surgeons being produced are much more in proportion to the number of patients being produced. So it's not possible. So you have to find a niche. You have to find a niche for yourself. You have to find it very early in your career. You develop an interest in a particular subspecialty. You may do only a small number of those cases initially, but as you go on and on, try to read more about that condition. Try to do things differently from others. So the moment there was a talk once, one senior pediatrician told me that, sir, it seems even when you do a circumcision, you do it differently from others. I never knew what differently I was doing, but that was the feeling that people got. This was very early in my career. This was not 20 years after my career. It was in the first 5 to 10 years of my career. So basically, do things differently. I mean, differently, not in the sense of, doing something wrongly, but, you make your mark. And the other very important thing is be honest, be ethical. I mean, that has really paid off for me, because then whenever a real second opinion is required, a lot of doctors used to take my opinion, whether surgery required or not required, because they probably knew that if this guy says surgery is required, then probably it is required. So don't do unnecessary operations. It is the unnecessary operations when you go into complications, that is when you cannot justify. So be ethical, be honest. Cases will come slowly. It's not a cakewalk. None of us have, none of us have started doing this kind of work very early in our career. So it's a very, very gradual build-up of private practice. And then my advice, of course, is try to be in the academic side also. Do not try to, say that academics is only for people who don't have practice. No, even if you have practice, even if you are surgically busy, you have to spare some time for it, because that is what actually marks you out of the crowd. If you want to be successful in private practice, you have to be different from the crowd, remember it. And then this is an ongoing process. Suppose you start doing a laparoscopic procedure, which no other surgeon in that area is doing. Within few years, people will learn. So you have to advance to the next level laparoscopic procedure, or you have to advance to something else. So you cannot say that, okay, I was the pioneer in this procedure, so nobody else can do it. No, your colleagues are also learners. They will also do it. You may be a pioneer, but you will never remain the only person who is doing the procedure, which is very good. We want everybody to do all the procedures comfortably, but at the same time, to be a special person, or to be a person who is different from others, you have to keep on evolving yourself. There is no end to this. I think if you can, and then of course patience and perseverance. If you are this, then I think you should be able to do very well in your private practice. And as somebody said, if initially you have to invest a bit of money in equipment, please do it. In 2003, I mean, I probably will be telling this somewhere else on a bigger platform. In 2003, I had the dilemma of buying, taking a bank loan and buying a laparoscope and cystoscope bronchoscope set versus a house, a 3-bedroom flat. I was getting the same, for the same money as the equipment, I was getting a 3-bedroom flat in the heart of Hyderabad. That time the rate was 1,000 per square feet. So luckily my wife was also very, supportive. So I took the loan at 18% interest, personal loan. Hello. And I bought the equipment. So let me stop here. But basically, this is a very nice session. And I congratulate all the speakers, and I wish all the best to all the youngsters in this Yuvacon. Thank you.
Dr. Devendra sir.
Yeah, nice talk presentation by the presenters and the expert also, and they've given a good idea of how to and start the practice and how to maintain the practice, private practice. I would like to say that private practice is a long-term game, and you have to first decide where you have to start the practice and with what armamentarium and qualification or additional qualification you want to start the practice. Because once you start the practice, it's difficult to leave the practice and get settled somewhere else and then again rejoin. So first you decide what you want to do and then start. Be consistent, be up to date of the current medical treatments and for the pediatric surgery, and be supportive to your patients, and never say bad mouth or comment wrongly about your colleagues and other surgeons also. And we make your presence felt to all the, even the OT staff and anesthetic. They are the more for the persons who will advertise your skills and your expertise, and be consistent with whatever you're doing and gain knowledge whatever you can get. That's the thing I have to say.
Thank you, sir. And we are already late behind schedule. I would like to hand over to Dr. Vinayak, my friend, for next topic.
Thank you so much, Ajay sir. I think it's a delight to host this particular session. So my session is going to be on social media, and this is not going to be a conventional social media presentation where we are going to be talking about just how you can market yourself, but it's going to be a little more deep dive, and we're going to be talking about how we can use social media to create an impact. So we have 4 excellent speakers. We have Dr. J.S. Kishore, Dr. Swapnil, Dr. Hussain Kotawala, and Dr. Abhirami. And we have 3 fantastic experts who are themselves experts in the art of social media, Dr. Ravi Kanodia sir, Dr. Kansha sir, and Dr. Sagar Javale sir. So I think it's going to be a pretty interesting session. So Dr. J.S. Kishore, sir, you can start your session. I will stop sharing. Dr. Kishore, sir? Yeah.
Yeah, I'm able to see this on screen.
Yes.
Are you able to hear me?
Yes, sir, we are able to hear you.
Okay, good evening, everyone. I'm Dr. J.S. Kishore. I'm a practicing pediatric surgeon from Vijayawada. So I will be talking on mastering the art of social media from strategy to content creation. The idea is to give the thought process behind any marketing, then we'll look specifically into digital marketing. So we'll start with a small example.
You can put your presentation in mode, presentation mode, sir.
Yeah, so who do you think we'll start with a small example. So who do you think are the competitors for this particular brand? I think the real competition for that brand is this. If you apply it to our lives, it's something like this. We are all pediatric surgeons on one side. Maybe we are different in our skill sets and personalities, but the true competition is not between us. It is between us and the other surgeons who are operating countries. When we focus our marketing in this area, we are going to increase our numbers. We are going to get more numbers. So take home message is always promote pediatric surgery first, then promote yourself, then promote your company or the corporate you work for. Now, before going to social media, we need to do some groundwork. Now, groundwork is important for 2 reasons. The first reason is your digital media marketing will get you cases in long-term basis, but you need cases on everyday basis to survive and sustain. For that, we need groundwork. Second thing is when you start your digital media marketing, after doing groundwork, you take off at a different level. So groundwork is very important. So what do you have for groundwork? Develop reasonable skill. Without reasonable skill, we are not going anywhere. No marketing is going to help you without reasonable skill. So what do you mean by reasonable skill? We need to operate all the basic cases without much complications. Then we need to have communication skills and PR skills. We need to go out, meet people, greet people, attend parties, functions, marriages. We cannot sit at a corner and be quiet and expect patients to come to us. Then you meet all your referral doctors in person. That is how they send cases to you. Then you give them regular feedback to the patients. You conduct talks, CMEs, teach whenever possible, publish articles in newspaper, give TV interviews, and do all this stuff. Then you identify cohorts of people like relatives, schoolmates, college mates, and try to address them in your marketing content. So before we take up the digital marketing, you need to know which social media handle will work best for you based on your location and population demographics. If you're in a city, you have many options, but when you are in smaller towns, the options are limited. The standard options we use are YouTube, Facebook, Insta, WhatsApp, Google search and reviews, website, and Twitter. For me, I think YouTube, Facebook, and Google reviews has worked very well. Another important thing is you may hire a professional for digital marketing, or you may do it by yourself. In whichever way you do, no one is going to guarantee any returns. That means if I invest 20,000 per month, how many patients am I going to get? If I invest 2 hours per day, how many patients am I going to get? No one can tell. So all those people who see your post or who like your post are not going to convert into your patients, but they will remember you as an option when the need arises. So social media can only help people find you on the digital media when they're looking for you. So how does social media help? It helps you create a brand which will fetch you results in long term. Second thing, it will give an opportunity for you to speak for your specialty. If you ask adult surgeon, he will tell pediatric surgeon does only hernia, hydrocele, and circumcision. But we know we do a lot of complicated stuff. So we get to speak about our own specialty. Then we may go beyond referral doctors and we may have walk-in patients looking at our social media posts. Then we may collaborate and we may find opportunities. Suppose there's an NGO or there's a philanthropist who is watching your work on social media, he may come to you and collaborate for advanced work. So when you start creating social media content, or always identify the target audience, parents or is it general public or is it pediatricians or health workers. Then choose the language based on your population demographics. Whatever kind of marketing you do, people will ultimately come back to Google and they will look into Google reviews and see how patients have written about you. So always have a Google page or create a website for yourself and ask your patients to start writing reviews. If you can create a small logo or brand name, you can do it just as I did in the name of Safe Hands Pediatric Surgery. Then all the social media handles, you display them on your website or Google page or make QR codes and display on your visiting card. These are the different types of contents you can post, blogs and articles, newsletters. You can provide some downloadable resources with your branding. And we have this general post on festivals and special days. Of course, they don't give much traction nowadays because now everyone is doing that. Then you can have patient testimonials. You can have bulk marketing in the form of email marketing, SMS, WhatsApp broadcast. Then you can have videos. Then you can have infographics and live sessions on YouTube. Coming to the videos, always keep them short and simple. If they are addressed to the healthcare professionals, you may have to give little more technical details. So 3 to 5 minutes is good for them. For other general public, I think 1 minute is max because hardly they'll watch for more than 30 seconds. In all the videos, try to record them with good resolution. Use a good mic to record your audio. Use a room where you have good lighting and always wear an apron or scrubs so that it attracts viewers' attention. And if you can edit by yourself, that is good, or you can hire someone to edit your videos also. And when presenting the content, be ethical. If it's your work, if you are taking someone else's work, please give credit to them. Be transparent about your source of information. Give credible information and give relevant information. And while writing the keywords, you always write keywords because it will help people to find you on Google. It is otherwise called search engine optimization. You can present patient testimonials with their consent, or you can hide their faces for privacy and present. Then be creative.
I think our time is up. We can wrap it up right now. Yes, sir.
Yeah. So use creativity to present the thing, and always emphasize on values, empathy, compassion, and make the patient hero of your story. If you present a plain fact, people may not listen. So always present a story around the thing, and always like and follow fellow pediatric surgeons. It will get you more followers and views. You can invest on boosting your posts. Then have a digital media calendar to give you a schedule. So be consistent, be creative, and engage the viewers. Thank you. Jai Pediatric Surgery.
Thank you so much, sir. I think that was a very, very interesting session. So next we have Dr. Swapnil, and it's going to be a pretty interesting topic because he's going to be talking about how social media can create an impact in the rural or the tier 2 practice. So We can start, Dr. Swapnil, sir.
Yeah, am I audible?
Yes, sir.
Yeah, good evening, everyone. I am Dr. Swapnil. I'm working in a Tier 2 city called Belgavi. So, how will social media help for surgeons? First, what you want, what are you expecting from a social media? Are you wanting a patient engagement, or are you planning for education, or educating others, or professional networking, or a brand building? Because there are different types of platforms to engage those. Already said by Jugal Kishore, like in Facebook, you have a very broad audience where you can tell patient stories or the health tip. Even Instagram, you can post your visual contents, which many people are doing, and it will help for larger audience. LinkedIn, you have a professional networking, and Twitter and YouTube for educational videos. How did I begin my journey in a small Tier 2 city where I came immediately after finishing my pediatric surgery residency on PGI? First of all, whenever you join some new institute, let the people in and around city whom you know that you are there. You are there, you are done so and so degree, you're finished, and what are your skills and what you can do. Because many a times people around you, your own family and friends will not be aware what kind of doctor you are. So it's very important for even them to know what are your capacities and what you can do. There it begins. So once you have your own circle, then slowly start your practice with doing the routine cases, then gradually attempt the cases which you all learned from your teachers at your institute. And there might be already a practicing pediatric surgeons in your locality. There might be a urologist. There might be other people who are already doing a pediatric practice. But if you are doing certain, learn certain skills which stay apart, see that they are told to the people, or they are people around you are aware about those skills which you are doing. For even a hospital where more than 5,000 people are working, many of them may not know you do exist. And these kind of cases, when you're doing, people will start noticing you. For that, I would like to thank my teachers who have taught me, like Ravi Konar sir is one of the moderator, where I have not got any extra laparoscopic training from anywhere. I could assist sir and learn these things. Every small step you take will help you in progressing more and more. So even if you're not doing some rare or difficult cases, but a routine cases which you do day to day, all pediatric surgeons do. Even those cases, if there are some difficult narrative, till I would like to tell you that even when we update a case like CDS, when antenatally diagnosed, many of the obstetricians in periphery give only option is abortion or a medical termination. When a patient taking infertility treatment for a long time and they come to you, see that public knows this, put it in the media so that they're aware that such challenging cases are done by pediatric surgeons, and even these babies have a good outcome. Even many of them think that all these cases are just more and more morbidity and mortality. The narration, how you plan in the social media also gives a lot of importance, how the viewers see it and how they respond. We got many of inquiries on the social media after putting up such cases. Then you should know whichever area you are staying in a Tier 2 city, that which is the one of the broader social media platform which has been followed by many people, by 50,000 to 1 lakh, and see that, identify that media. Then see that whichever very rare case or whichever case you do where people are not aware that even pediatric surgeons are capable of doing these cases, like we did a hepatectomy. It was very surprising that I got inquiries from many of the general surgeons who thought that even a pediatric surgeons don't do onco work. So such cases, you need to see that it is put up in your local media, for local largest social media which is there in and around your city. And it's always better to have your own Google business page, because many a times when patients come to you, they talk to you, they try to search on Google. Nowadays it's very common that they search about you. It's better that even they have some information about you, what kind of cases you do, what kind of challenging cases you do, what kind of routine cases you do. They are aware about those cases. Also, it's better to have a website. Still, in Tier 2 cities, there is not much that people search you on a website, read about income, but still once they come to you, they will go back and search for sure before getting operated from you. It's always better, not only social media, to put up matter into the local languages, into the print media, and further they can be used again for your social media. People like many people still in rural areas, Tier 3 cities or smaller villages, still don't have Android phones or other things. They also still read newspapers, and they will be aware about what all things are going around you. And always tie up with your local associations, pediatric associations or surgical or IMAs. This is a routine thing which have been being done by the ages, but now the trends are changing. There were 20 to 30 people who are attending your talk, but remember, when they are shared into the groups and other things, there are many people who are observing that your work is being noticed now and then in your city. And whenever our association is celebrating awareness week, see that you make either a video content out of it or in a blog, write a blog about it, and see that it gets into the social media to increase awareness about your own branch, not about the others. There are many things that many people are not aware what the pediatric surgeons are capable of and what all cases they are doing in and around. With this, I would just sum up that be real, whatever cases you can do, whatever you are capable, whatever you are doing at your best, try to put only those into social media. Don't try to fake things and in the social media, because they don't last long. Your outcomes, your surgical outcomes, your basic skills will always be known today or tomorrow by your patients. Still, in a tier 2 city, I would believe that it's a word of mouth, it's the patient to patient.
Sir, I think we'll have to end the session.
Maximum, this is the last slide, that till we get is a more 50% of cases from the word of mouth, 30% from the hospitals you are attached or working around, less than 20% from the social media. With this, I would like to say thank you for attention.
Thank you so much, sir. That was very interesting, especially about your use of print media and the use of conferences to promote your work. Next, we have a very, very interesting talk by our star champion, whose videos we all love and see, Dr. Hussain Kotawala. He's going to be talking about how to use social media in the urban practice. So I'll be sharing the screen for him as he's traveling.
Good evening, everyone. This is Dr. Hussain Kotawala from Mumbai. So already many things has been talked by my previous two speakers regarding the social media. So I would just highlight how to optimize our social media for the urban surgical practice. As Dr. Swapnil said, the patient comes with the preparation, right? The patient wants to know you, like the nation wants to know. Same thing applies to our industry also. The patient wants to know you, whether you are eligible, what degree you hold, how many patients you have operated, what kind of surgeries you are doing. So patient research a lot about you from your colleague, from your old patient, from your staff. So maintaining a good this on the social media is very important. Now regarding choosing the platforms, you have the multiple platforms which we have already talked about, like the Google, Facebook, Instagram. Now as per the Facebook or the Instagram, if you see the particular social media platform, we can't just post and expect that people will like it, people will comment on it, or people will give you the best views on it. So by posting, whenever you post something on the Facebook, try to collaborate with your colleagues. You can hashtag them, you can add the location of your hospital, and you can share in your particular groups. And similarly on the Instagram, you can collaborate with your general surgery or the urology colleagues whom you want to showcase your cases. And second thing, in the creating an engaging content. What is creating the engaging content? People relate, people expect you to make videos or show the things which are relatable to them. So educational post for our simple hernia, hydrocele, for the UDT, but the circumcision, either it be the religious circumcision or for the phimosis or anything. People love to see the such educational videos. If you see, none of the pediatric surgeons have such a huge social media value like our counterpart. For example, Mr. Imran from Surat and Mr. Parik from the Cheers Mumbai. They have a lot of the followers because they post a lot of educational videos. And we are also posting, but we post more of the surgical videos. Many of them are the red flag by the social media sites. So posting the educational videos is the more important, and your patients testimonials and your success stories, you can take their consent and post the success stories which they had gone through, and how the pediatric surgery and our team has helped them coming out and giving the best result. Second, another thing is a visual content strategy, VCS. Now jo dikhta hai wo dikhta hai, like Dr. Anish said. And in this your any on the daily basis, if you don't have the huge content to post, you can just post a selfie post surgery with your colleagues, with your anesthesia team, praising the anesthesia team or your staff or the location of your hospital. You can market anything, your hospital, your anesthetists and your staff. It doesn't depend that uh, the only the surgeon is working. It shows the whole team is working in a unit, and that gives you the credit at the end. And next, going to next slide is a professional networking and a development. In the professional networking, you have the multiple Facebook groups, even on the Google, you have the multiple groups on the LinkedIn. You can join that groups. You can showcase your work over there. So the other specialty should know. Previously, when I started my practice, people used to ask what exactly people operate. Are you the hepatobiliary surgeon, or you are the pediatric urology surgeon, or you are a thoracoscopic surgeon? So slowly, as you keep on the working, as we advance from the advanced laparoscopy to robotic, now people start recognizing you. They will call, even the adult will call you for their cases in where their minute or reconstructive work is required. And last thing, the tracking and measuring your social media success. Uh, Always, you can't just keep on posting and posting, and you don't know what the people demand is. Always, you have the Facebook insight, your Instagram insight is that your website traffic. All this you have to keep on the monitoring so that you can post the things which is working more. And for the final thoughts, I would like to say the effective social media optimization require consistency, authenticity, and responsiveness. And to end my talk, a simple example I will give you of the film industry. As you know, there are the big stars, Amitabh Bachchan, or Rajesh Khanna, or whosoever. They are like our the senior surgeons who have developed their names with their lot of hard work, contacting many people, operating on the very complicated cases. But to start now, our current generation want the fast success. They want to earn the money fast. No, up to some extent, it's not true, but you can make it possible. You can market yourself properly, and you can give the good results. You can collaborate with your seniors. You can work with them. You can take their help at all the steps. So the social media is the key nowadays. If you're not on the social media and you are thinking that you will become a millionaire in the few years, then it's a very difficult job. So developing a practice and to earn the money, the social media optimization and posting the good videos and reaching to your patient directly is the key. Thank you.
Thank you so much, sir. I think that was a very, very enlightening talk. And we saw very different aspects of social media from sir. And sir's videos are pretty famous as well. So we have a very interesting talk by Dr. Abhirami. And she's going to be talking about how to use social media to create impact and how to create awareness using social media and how to promote pediatric surgery on a whole. So I think we're all waiting for this talk. Ma'am, you can start.
Yeah, am I audible? Can I start?
Absolutely, ma'am.
Yeah. So I'll be talking about digital outreach, especially to create awareness about pediatric surgery. So I'm Dr. Abhirami Kritika. I'm a pediatric surgeon working in Chennai, Rainbow Children's Hospital. Social media has become a part of a day of a lot of young people and few of the senior people's life. So it is like a relaxation or some knowledge gaining also. So why not use the media to create awareness about pediatric surgery? Because when I was a general surgeon, I didn't know that pediatric surgery has so much of urological work, even though I had 1 month rotation in pediatric surgery. So I think it is our duty to create awareness in the most trending places like Instagram. We once had Orkut, but now Instagram is a little trending. And it is like the contents are created by the users for the users. So, and it is, if the person is able to use the media well, then they can post and use the media well. So what are the benefits of the digital outreach? Is wider reach, and it is cost-effective communication. Initially, while handling Instagram, I hired the help of social media manager. Then later, I learned from her, and I started doing it by myself. It also helps us to keep us updated, so that we have to keep posting on the current recent advances or something happened in the news and all those things. And it's very interesting to have live question and answer session with the followers, where the parents ask their concerns. Though most of them are like pediatrics, still pediatric surgery is being a little a part of pediatrics in the mind of the patients and a global audience. So I wanted to take this opportunity to tell that through Instagram, we also have audience apart from the borders. Like I once had a German mom asking me about a soft tissue tumor in a 7-day-old infant. Then she was going to oncosurgeon. Then I also told her about the importance of pediatric surgery in that. And then she went and met Dr. Yudor. He's a well-known pediatric surgeon. And also the responsibility. So when we scroll, when we see some myths going on in a viral mode, we feel like it is our responsibility to create awareness about the myth and to break it. And also to the underserved areas, even anywhere, the rural areas are also, people are using the social media. So it can be used. And also telementoring, it's very useful, especially YouTube videos of surgeons operating when we have to do something which have not seen while practicing alone in individual practice. Then we can use this telementoring as a YouTube videos to see and to operate. And I wanted to tell about this SEO, which is very, very essential for younger pediatric surgeons, which is visibility. When we start practice, either in a institution or a corporate hospital, visibility is very, very important, because it is very difficult for us to go and tell people that I'm here, I do this, I do that. So instead of that, if we have a social media visibility, even Google has this SEO, which if you keep yourself active in the social media, then the Google gives you a good SEO. And addressing misinformation, there are so many myths going on in a lot of social media with a lot of responses. Then we can break it with our presence in the social media. And about ethical considerations, yes, we do have to have a patient confidentiality, and then hide their faces and not reveal too much about your personal things. Even when we discuss about rarer cases, it is very essential that we don't tell the name or the project the face of the child in the media. Challenges are cyberbullying does happen. When the video goes viral, I take this opportunity to share my experience. When I posted a video on circumcision, there is a Western group of people who are anti-circumcision people who started bullying me with like hundreds of comments in the Instagram video, and suddenly I got shocked, and then I came to know that there is a community like this, and I told them that it is about UTI, but still they didn't accept. So I have to remove all the comments and all those things. And language is a little barrier to reach the rural areas, but still with subtitles and all those things, we can do a little awareness with the social media. And about the future trends and innovation, with so much of AI incoming, we can use this AI chatbots for the patients, which will be very useful, where we can just formulate it, and it gives the instant reply to the same type of queries asked. And telemedicine and telecommunication, we can educate and inform the medical students and other parents and grandparents through this, so that we can break the barriers and boundaries through this. So I think social media can be a very good tool to take pediatric surgery to another level and create more awareness. Thank you. Thank you for the opportunity to talk on this.
Thank you so much, ma'am. I think we have had 4 excellent speakers who have covered very different aspects of social media. And what I must really commend is that when we started off this topic, there was a lot of doubt that a lot of topics are going to overlap. And I'm very glad that that didn't happen. So now I wish to invite our experts, Dr. Ravi sir, Dr. Sagar sir, and Dr. Kansha sir, to give their expert comments, please.
Thank you. Thank you, Vinayak. So all these speakers delivered excellent, and whatever content they covered, they comprehensively covered all the aspects of social media. I really liked Dr. Srinivasa saying that if you have the power of social media in your hand, you should promote pediatric surgery first, and then yourself, and then your hospital. So that's a wonderful statement, which will really benefit not just that person, but the entire community of pediatric surgery. Now, this social media tool, which has been there for the last 10, 15 years now, and now actually it is a very, very powerful tool. It is actually something like a B2C model, where you are looking for your patients, and you know that you have set up your center somewhere and you're looking for patients, but the patient doesn't have a methodology to discover you. So this is the place where the social media will help you to connect with the patient, and it is really a powerful tool now. What I understood is that these parents, when they search on Google and when they look on Facebook or Instagram or the other apps, they're actually trying to screen. They know that what needs to be done. Either they are using it for a learning. Suppose if there is a parent who has got an undescended testis child, he will first look at what is an undescended testis and what all can be done, and then he will look for the surgeon. So once he finds a surgeon or a cluster of surgeons on social media, he will read the review of that surgeon, and then after that, he will look for some word of mouth for that particular 2 or 3 shortlisted surgeons, and then at the end he will finalize one particular surgeon based on the reputation of that surgeon. So what I mean to say is that your core skill and your actual reputation in your field cannot replace anything else. It cannot happen that you use all the tools of social media and all the patients are going to come to you. You have to be competent in your core surgical skill, where you have done a good job, a good word of mouth from your previous patients, and then they are referring the patients to you directly. A few words of caution that I would like to say is that whenever you are posting your content on the social media, please do take parents and patients' consent whenever you are showing the face of that patient, and avoid showing any kind of genitalia. If you have done a hypospadias repair or an undescended testis repair, I would totally avoid, because that is something which a parent may not consent to. Although in India, parents are a little ignorant about all these things, but in the bigger cities, the awareness is quite large now, and then it can backfire on you. So always protect the patient identity. I would always advise against giving any kind of advice on WhatsApp. Now it's a very common method where the parents are just going to, or somebody else is going to shoot some PDF reports onto your phone, and then they will show the x-rays like this, and then they will ask for an advice. So this is another social media tool which may go against you by giving, sort of a short run advice on all those things. So try not to do that. What we have been doing on social media is to connect with our peers at the institute level, not with the patient level. So whatever videos that we have made, they are meant for the education of the pediatric surgery community and not the parents. So I get a lot of questions on the channel that I have an undescended testis or hypospadias, what to do. So I would answer them that this is not a parent education site. So if you have to do that, you have to set up a different system where you deal it accordingly with the means of pamphlets and patient leaflet brochures and other things which IAPS has made. So once again, I congratulate all the speakers, excellent presentations. And this is really an important topic in the current era on how to handle the social media and the various tools of social media.
Thank you so much, sir, especially for your insightful comments on patient privacy. I think many of us are guilty of making that one particular mistake where we post a lot of information without actually taking consent. Dr. Kant sir and Dr. Sagar sir, any final comments? We have to wrap up the session within the next 1 minute.
Can you hear me?
Oh, yes, sir, we can.
Okay, thank you so much, everyone. It's been a rocking day and a rocking conference. There are two things, as Ravi sir also said. On social media, there is presence and there is promotion. The largest chunk of patients in your practice are going to come from pediatricians in the early practice. So one must focus on that, take part in academic meetings as someone had presented, and try and give even at least one case presentation should always be there on your pen drive when you attend any meeting, so that if there is a space, then you just say, can I present one case? And that gets you a good access to showcase what you can do. Even if it's a hernia, if you did something different, or in neonates, you get a lot of sliding hernia. It's a good starting point for discussion. So you should do that. But once you get a referral, like everyone has been saying, it's very likely that the parents are going to Google you or search or look for you. So you need presence. So you need a website, a domain name, which is super cheap. And it could even be almost for free. And you need to keep that going. Don't need to do any updates. Even if there's some static page and somebody can review on Google, that's almost free of cost. So this much minimum effort is required for presence. And then promotion, I think we heard very amazing talks by the masters of the game, like Hussein and Swapnil, who obviously have mastered it to a different level and with a different level of energy. But it's a double-edged sword, so one must always be careful that try and avoid direct patient interactions, as Dr. Ravi said again, because then you need to have a different kind of setup for that. Thank you.
Thank you so much, sir. I think, again, great comments by Dr. Sir. Next, we will be ending the session right now, and I'm going to hand over the mic to Alish. Alish is a very good friend of mine, and it's going to be a session on finance. So over to you, Alish.
Before we move on to the next session, may I have the permission of Tanmay to give a short comment on social media?
Please, sir,
One thing which got missed out. Yes. I discussed with Tanmay also this point that as we are pediatric surgeon and our pediatric surgical problems are not so common. So to build your social media circle or followership, you need to talk about common problems of the children, like child is not eating properly, whatever, like COVID came, so you have to talk about COVID, or some influenza came, so you have to talk about common problems like foreign body ingestion, like safety, like toys hazards, and all these things. So if you follow Abhirami, she keeps doing that, and she has a huge followership, like Tanmay also does. So this is also equally important. So just focusing on pediatric surgery is not going to, gather a lot of followership. So in between, keep on doing these things as well. Thank you.
Sir, sorry to interrupt. I fully agree that foreign body thing is a hit with everybody. Pediatricians, general public, everything. So I think I give a lot of foreign body talks. I think that's really important.
Yeah. Please move on to the next session.
Good evening, everyone. It's past 5 and yet seeing more than 120 participants still active on and really give me immense pleasure. I'm Dr. Alish, a secondary MCH resident at Sion Hospital. We have spoken regarding many topics since morning regarding pediatric surgery, regarding private practice, regarding awareness. But I feel at the residency level, the topic which is least spoken is money management. We have understood in timeline that we may be well versed with recent advances, latest techniques, but when it comes to money management, financial literacy, we are really lagging behind. And to speak about this topic, we have with us Dr. Tanmay Motiwala, who is an alumni of AIIMS Jodhpur and currently practicing in Raipur. He has an immense interest in financial education and has spoken at innumerable places, both at online and offline places, regarding financial literacy among doctors. To moderate this session, we have Dr. Rasiksha Sir, who is a senior pediatric surgeon at SRCC Hospital, also the editor-in-chief at JIAPS, who has got his interest in finances. Also, we have got Dr. Rajesh Gupta Sir, a senior pediatric surgeon at SN Medical College, Agra, who is a full-time clinician but has got his interest in part-time stock market. And also Dr. Basant Kumar Sir, senior professor at SGPGI Lucknow, who also shares his common interest in finances. Over to Dr. Tanmay Motiwala to continue this session.
Yeah. Thank you, Alish, for the warm introduction. Is my screen visible?
Yes, it is.
So, of all the things that we have talked about, money is something that concerns us, every one of us. And initially, what happens is while we are sorry.
I request others to please stay mute so that we can carry forward with the session and we stay in time.
So the problem that arises while starting the investing journey is we often don't know where we tend to lose money. And this is where if such kind of mishap happens with us, the problem that happens is एक बार पैसा डूब गया तो we never get the confidence to start investing again, and we'll look at the things that are common loopholes for all of us where we tend to lose money. Yeah. So when you look at this thing, the first and the foremost important thing where we lose money is not investing at all. Now, someone may laugh on this thing, that how can this thing be a mistake? But let me tell you this thing, that inflation is something that is around 4 to 6% on an average. And if we are keeping our entire money in our savings account, this is not going to fetch us anything at all. So if you look, the interest rate that we are getting on our saving account is around 3.5 to 4%. Even while doing a FD, we are getting around 6 to 7%. So if you are having, say, an inflation of around 6%, and if we are generating a return of 6%, then probably our money is never going to grow at all. And all we have to do is we have to keep working our entire life. And being smart is where you put you put your money to work, so that it keeps on growing at least at the rate at which our GDP is growing, which is by investing in index funds. You get somewhere around 12 to 14%. You don't need to track, even if you are busy doing your practice. Even if you're not able to track, even in for a year, even then, this is a good tool to have. The second place where most people fail is this opportunity, or this option comes in because, lots of people, what they do is, they start investing late in their life, let's say in late 40s or in 50s or somewhere like that phase. And when you start investing late, you want quick money. And when you want quick money, this is the option that you end in. And let me show you a disclaimer that comes with futures and options. It says that 9 out of, then this is from SEBI, okay, this is the regulatory body dealing with this. 9 out of 10 individual traders in equity and futures and option make losses. Why do you think that you are the only person among the 10, when you are not a professional person, you will make a gain out of it? On an average, loss makers registered net trading loss close to 50,000. This is what the data is from SEBI. Over and above the net trading losses, even those who are making money, they pay 30% tax on this, if considering you are in the 30% tax slab. And these are the kind of taxes that you have to pay. Now, when I talk to this ki future and option mat karo, so there are so many people who would come on me and say that this is not justified. We have made so much money. XYZ person posted a screenshot making tens of lakh or 20s of lakh. Trust me, it is a professional thing. For someone who is not professional, please do not venture into future and options. Another thing which is very important for someone who is into early stage, like a Yuva pediatric surgeon, is while we are very aspirational, we see other of our colleagues having good amount of salaries, and they're investing a lot of things and buying luxury cars, or spending a lot on holidays and everything. We tend to go out of pocket by doing EMIs. Now, the initial is the phase wherein we should focus more on SIPs rather than EMIs. So if our money is going into SIPs by regularly, so you don't have to do anything. You just have to start a process. This thing doesn't even need monitoring on a particular date from your account. This thing will get deducted every month. And I'll give you a hack wherein, if you are putting in 15,000 rupees per month, which I am sure many of you may be able to spare this amount of money, and you are able to generate somewhere around 15% return for 15 years, this will become 1 CR. So it's called as a rule of 15,000 for 15 years at 15% will generate you 1 CR. And I'm sure 1 CR may be a corpus, which may be a dream for a lot of people, may not be able to achieve at all. Another important thing, which lots of people fail to understand, being in the medical fraternity, we feel that, okay, we will get covered for our health and our hospital will take care, or we have someone to back up, our friends or other colleagues are there. But more often than not, if God forbid some situation comes in where, the expense is so high that it wipes away your entire capital. Suppose you have started investing, but in the initial stage of the investing, you are stuck with some kind of illness, then this is the money that you will have to pull in out of from the investment, maybe even have to book losses. So it is important that we have health insurance or term insurance. We have had very in-depth sessions on this on the social media platform, almost an hour session on these topics as well. So if anyone wants, I can share the talk on that with the details. The other thing that is important is trading using margins or leverage. In fact, I would say trading, again, there are people who may be doing good at it. I'm not talking about them who have excelled it, who have spent time to learn it, are still able to manage out time between their hectic duties during the day, during the market hours to trade. But I'll say for most people trading using margins or leverage, you can wipe away your entire capital. I have had a radiologist friend of mine in AIIMS Jodhpur who had a loss of 10 lakh in a single day. Imagine the kind of loss and how much it would have taken to cover those things up. Other important thing is, if we are not, say we are talking about how to buy instruments, how to buy a laparoscopy set, how to go about, setting up a private practice or those things. We are doing so much research into it. But if we are putting our hard-earned money, we don't understand stocks. Why do you want to venture into stocks? And then other problem is not just stocks. We take tips from someone, we invest based on the tips, and then we expect ki hum 10 bagger, 20 bagger, 50 bagger bana lenge. This tips, I always say this in my talks, that tips is for someone who doesn't have their own insight. So wo tips वैसे ही काम करते हैं, they won't make you anything. Now, this slide, I think, is one of the most important slide. We were having a debate on this on our WhatsApp group yesterday as well. So what happens is, as you spend some time in the market, say a 10-year or a 15-year, you start gaining some confidence out of it, and then you think कि market को हम time करना चालू कर देंगे. We'll try and find the peaks, we'll try and find the bottoms, be it at the index level or at the level of your stock, a particular stock. Now, what we think, we'll sell the entire thing, and then when there is a correction right at the bottom, we'll buy it. Trust me, anyone who says to do this is totally lying to you, and these things don't work in the practical setup. So this was the data that was released by Zerodha recently. And if you can see, if you are what is the impact of missing the best days in the market? So there was a correction in the market on 4th of June. There was a recovery on 5th of June and 6th of June. So if you miss those kind of days where you are able to generate some kind of returns, then see here you are able to generate around 15.7% return, and then it just your corpus halves. It was around 18 lakhs, and then now it becomes 9 lakh. So it is important for most people who are non-professional to stay invested throughout the course and not to buy and sell too frequently. You have to, master the inactivity rather than doing lots of things on and off. Now, this example is from ET Prime. They had shared this case study, and I want this to be shared among all of you. This is one of the case wherein, what happens is, we feel in the initial stages of our investing journey कि अगर कोई 10 रुपए का स्टॉक खरीदेंगे तो वो 100 रुपए हो जाएगा या 1000 रुपए हो जाएगा, तो we'll make a 100 bagger or a 1000 bagger or a 10 bagger, anything like that, and we feel कि 10 रुपए के में हम quantity ज्यादा buy कर लेंगे. And what happens? So this was one of the penny stocks by the name of Manpasand Beverages. You see, here was the IPO listing around 400 rupees. Within a short span of time, it has gone till 1000. Everyone was having fun. And you see, there is a steep decline. Now, anyone who is not following the annual reports of the company may feel that there is something wrong, and probably it's my mistake. And every time I invest, I make losses. Now, I'll give you the reason what happened here. So if you can see this news, what it says is, there were fake invoices that
we have to go a little faster.
Yeah.
We have to go a little faster.
Yeah. So if you see here, they had formed 38 bogus companies, and it amounted to almost 188 crores of fake sales. So if you see, there are so many fake sales that were shown, and for someone who is, say, full-time pediatric surgeon and just doing investing by choice, they may not be able to know this how they are manipulating the balance sheet. So the lesson is, it is very easy to manipulate penny stocks. Buying in any stock that is less than 1000 crore market cap, it needs extensive amount of research. You will have to read annual reports. If you are not doing even the quarterly reports, please spend time reading annual reports at least. The last part that I wanted to cover was buying at any price doesn't work. And in very short, I'll cover the concept of PE ratio. So what PE ratio means is, if it's a PE, the value is 20, it means that to earn 1 rupee, you will need to invest 20 rupees in particular stock. A PE ratio means, in a very layman language, this is the meaning. Now, what is the definition is, it says as PE ratio is equal to price upon earnings. So now if we have to see what are the factors that are affecting price of a stock, then there are two factors. One is PE and the other is earnings. Now let us see how multi-baggers are found, or what happens when the price discovery happens. So this is the price of a stock here. And now suppose you are picking up some company which is a blue chip company, it is known to everyone. So what happens is, this is P also represents the sentiment of the market. Now when everyone knows it, it would be around 80 or 100 PE or something like that. And what you will be getting from the stock is just the earnings growth. So stock is growing, profits at the company is growing, profits is 20%, you will get a 20% growth. Company is growing at 25%, you will get a 25% growth. But what happens for most of the people when they try to hunt popular companies is, this is the case that will happen. The last scenario wherein, you are picking a stock which is already known to everyone. It has peaked out the earnings and all. Now, what will happen in this stock is, it will go derating, because at some point of the other, the earnings will fall, the margins have been maxed out. Now, if the earnings are falling, the sentiment will also fall, and then you will book a major loss, because PE is also falling there and the earning is also falling. On the contrary, what happens is, if you are picking up some name, like I'll show you here. So we are using this concept here. So if you see, for each of the sector, again, this is not a recommendation to buy today. We do this analysis every month in our group as well. So if you see mean PE here, now if you see the PE currently of Nifty Bank, it is around 15 and this is around 19. So there is a chance of PE re-rating here, and we can see that there is a expected growth of around 27%. Similarly, in automobile sector, what we can see, the current PE is around 24. The historical mean PE of this particular sector has been around 33. So we see an upside of around 39%. So the idea is to understand that you don't buy everything very expensive. So only when you understand that there is a low sentiment there, this is where the contra investing is done, and this is where you can get multi-bagger kind of returns. So how multi-baggers are found? Unidentified names, great business where earning growth is very high. Since not many people have found it, the PE would be low. So you will get a PE growth as well, and the earning growth as well. And this is where 10 bagger or 100 bagger kind of stocks do come in. Also, you can find some stocks wherein there is a derating, and this is the last slide here. So, wealth erosion happens when you go on famous names without any earnings, or they are at already trading in their peak margins. So you'll buy there and then there will be derating. For most people, this is the thing. This is the slide that will explain, this is the meme wherein, you can see, relax Peter, it is just a small cut with a scalpel. You need not be nervous. And he says, no, my name is not Peter. So जिसको सर्जरी करनी नहीं आती है, आप मत करो वो चीज. Similarly, if you don't understand stocks, mutual fund सही है, बिल्कुल सही है, and this is where you need to be in. Yeah, thank you.
Thank you, Tanmay. I would like our senior moderators to please give their feedback. Also, I received one question in the chat stating that considering the salary discrepancy that the MC resident gets from Delhi to Bombay, let's say a Bombay person is getting 60,000-70,000 salary in hand, how should he plan his investment? Rasik sir?
Can I start?
Yes, sir, please.
Do you hear me? I mean, first of all, I would like to congratulate Tanmay, Vikesh, Dr. Ramesh Babu and entire IAPS con central body. इतना शानदार ये arrangement करने के लिए youngsters के लिए. And secondly, I am highly impressed by the crispness with which it is presented. Time का सबने adhere किया और मुझे उम्मीद नहीं थी. Every session has been started and bang on time. टाइम पर शुरू हुआ, टाइम पर खत्म हुआ. तन्मय ने ऑलमोस्ट बेसिक एस्पेक्ट सारे कवर किए. मैं स्टॉक मार्केट में 20 साल से हूँ और 15 साल से मैं न्यूज बेस्ड इन्वेस्टिंग, 15 साल तक मैं न्यूज बेस्ड टिप्स बेस्ड इन्वेस्टिंग करता रहा. बट ईश्वर ने मेरे अंदर एक चीज बहुत ठूस के भरी थी, वो थी पेशेंस. पेशेंस मेरे में बहुत था कि कितना भी मार्केट गिर जाए मेरे को बेचना नहीं होता था, रखना था और खरीद लेता था मैं. तो 15 साल तक तो मेरी गाड़ी ऐसे चलती रही. फिर पिछले 5 साल से कोविड से थोड़ा पहले आई स्टार्टेड डेवलपिंग इंटरेस्ट, क्योंकि पीडियाट्रिक सर्जरी में हम लोग को बहुत फ्री टाइम मिलता है, बहुत टाइम मिलता है हम लोग को. तो हमने पढ़ना शुरू कर दिया. तो फॉर द पास्ट 5 years आई एम डूइंग इन्फॉर्म्ड इन्वेस्टमेंट्स and I have been lucky that for the past 3 years I have been in contact with Tanmay and इसके वीडियोस मैंने देखे, इसके साथ मेरा इंटरेक्शन रहा, तो थोड़ा सा फंडामेंटल्स के बारे में सीखना शुरू किया. एंड जो मेरे को जो समझ में आता है, जो मेरा एक्सपीरियंस है कि सबसे इम्पोर्टेंट चीज, द मोस्ट इम्पोर्टेंट थिंग फॉर ग्रोइंग वेल्थ why investing is controlling your emotions. एक बहुत अच्छी किताब है, उसका ऑथर का मैं नाम भूल गया, साइकोलॉजी ऑफ मनी, वो सबको पढ़नी चाहिए, सारे यंगस्टर्स को पढ़नी चाहिए। बहुत 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 जरूरी किताब है वो। हमारा जो आगे का भविष्य जो भी किसी भी फील्ड में, वो हमारे इमोशंस कंट्रोल करते हैं। सिमिलरली इन स्टॉक मार्केट, अभी 4 जून को क्या हुआ, मार्केट क्रैश हुई, आई एम प्रीटी श्योर large number of people must have run away. They have sold everything and run away. What happened next? In 3 days, market not only recovered, but it also scaled past its previous high. So by doing masterly inactivity, that entire loss of 4th June was compensated, and it was even better. My portfolio is at a lifetime high. Secondly, time in the market is more important than timing. ये बिल्कुल फैक्ट है, और तन्मय ने भी इस बात को कहा और मैं भी यही बात मानता हूँ। एक छोटा सा एग्जांपल मैं देना चाहूंगा। 2005 या 2006 के आसपास मैंने 8,000 रुपए के टोरेंट फार्मा के शेयर्स लिए थे, 200 शेयर लिए थे, 40 रुपए का एक शेयर था। आज उसकी कीमत आप जानेंगे, 24 लाख रुपए है वो, 24 लैक्स। उसमें कई बोनस मिले, स्प्लिट मिले, और आज वो टोटल बात 8,000 रुपए मेरे 24 लाख रुपए में कन्वर्ट हो गए। मैंने कुछ नहीं किया, बस साल में 1 या 2 बार बस मैं देख लेता था मार्केट में ये कंपनी की परफॉर्मेंस कैसी है, ठीक है ना, और उसका आउटलुक कैसा है। जब तक कंपनी जिंदा है मैं उस शेयर के साथ रहूंगा। हर साल मुझे अच्छा खासा डिविडेंड भी वो दे देता है। सेम थिंग विद रिलायंस, सेम थिंग विद ITC, L&T, SBI, HDFC बैंक, ICICI बैंक। इन चीजों को हम अपनी रोजमर्रा की जिंदगी में रोज रोज देखते हैं। हम अपने आसपास, हम बैंक जाते हैं, ठीक है, रिलायंस के प्रोडक्ट हम यूज करते हैं, उसके पेट्रोल पंप्स हैं, पेट्रोल हम इस्तेमाल कर रहे हैं, ITC का हम आटा खाते हैं। और मेरा एक बहुत पुराना कोट है, जो मेरा ओरिजिनल कोट है, आई डोंट नो।
Rajesh sir, sorry to interrupt you. Few people are not comfortable with Hindi, so could you please? Yeah, because we have a mixed audience.
Sorry, I forgot.
Sorry to interrupt you, sir.
So there is a quote which I frequently use in many discussions, that dawa, daru, atta and data means medicine, alcohol, आपका this FMCG, that is consumer goods, and data, that is internet and all these things. These are the 4 things which are essential for our survival these days and future also. There will hardly be any chance of recession in these 4 things. So if one tend to select stocks out of these segments, उसको कभी loss नहीं होगा. You will never face a loss. So I just made a summary of 9 points which I want to state here. Emotions, we need to control them, and we need not have any FOMO. Second is patience. We need to practice it. And the best way to exercise patience is investing via means of systematic investment plans, that is monthly, weekly, bi-monthly, depending upon everybody's aptitude. Then knowledge, we must study, we must learn when to buy, what to buy, and when to sell. That is important. We should always avoid greed. It's better to be fearful rather than euphoric, because maximum losses occurs when one is under euphoria and buys things at the high when others are booking profit. So Warren Buffett has also has given a famous quote: buy when others are fearful and sell when others are euphoric. Then stay away from futures and options. 90% lose money, as Sanway pointed out. I have never invested, never even tried future and options once, even once, because I know the odds are stacked against me, and I have got only 5 to 10% chance of making money, but unlimited chances of losing money. Then diversification is very important. There should be a fine balance between equities, debt, gold, and property. All these 4 things are important, so that one can hedge, each one can hedge against each other. So, for example, if one is having adequate investment in equity as well as in gold and debt, the debt and gold can hedge you out against equity when the market falls, and vice versa. And the time spent in the market is inversely proportional to the loss. More the time you spend in the market, lesser your chances of loss becomes. One example of this I just want to say is, I purchased BSE. BSE is a stock of Bombay Stock Exchange. That I purchased that stock at around 300 or 400 rupees. It went up to 1200 rupees. Then it fell down again to almost 350 levels. I persisted with it. I knew if India's stock market has to grow hardly 3 or 4% people in the stock market, and this number is going to increase gradually. So BSE as a stock has to perform sometimes sooner or later. As a result, I persisted with it. In fact, I added more to it at 350 or 380. So look at the stock where it is. It is at 2,700 rupees now. So patience and perseverance pays. Obviously, you have to invest in fundamentally sound stocks, and you have to keep on evaluating the companies at a regular interval. Thank you.
Thank you, sir. I would like Rasik Shah, sir, to please speak towards.
Yeah, thank you, Alice. Thank you, Vikesh, and everyone to organize this wonderful conference for the young budding pediatric surgeons. Now, why this session is important? Because we are not taught about investment finances during our medical college. So most of us, when we are passed out, we have no clue where we should be investing. This is what Tanmay and Rajesh or I'll speak. It is just a primer. You can't come to any conclusion from that. So what happens once you start your private practice? The other sessions, whatever were organized, they will give you some money in your hand in the initial phase. Now, if you invest this money wisely, then you will become wealthy, or you will have enough when you want to retire. So the investment is very important. Now, there are many ways of investing, starting from bank, FDs to PPF to debt fund to equity. Now, each one has its own advantages, disadvantages, which all of us have to know. Now, it is very difficult for anyone to understand all this in a short time. It needs a lot of efforts to learn about each investment, its advantages as well as disadvantages. The only way I think is to learn is start doing the things. Now, if I have to tell you, when I started practice in 98, I had no money. In 2000, there was some money which I invested in mutual fund. I had no clue what is mutual fund. Now that mutual fund, which was what you call is NAV at that time, was 10 rupees, and it is around 480, 490 rupees at present. So it has multiplied 49 times. The money invested was a small amount, but it has multiplied 49 times. So this is the practical experience each and every one of you will have to go through. There is no easy way to learn. Dr. Tanmay, Dr. Rajesh, or many other people will teach you, but the final learning will happen when you start investing in anything, whether it is mutual fund or direct stocks. If you had read that quote, before you invest, investigate. Now, when I say this, when Tanmay said that people lost money in 1% beverages, and there are many other stocks where people have lost money, at least I have lost completely, means in 3 stocks without this, in past, let's say before 2008-9, there was no social media available. The information to get about any company was not easy. So many investments were at without any investigation or without any studies. So the stock which I invested, there were 2 stocks which were told to me by one of our colleagues who was investing heavily at that time, one of the anesthetists at our hospital. So he told me 2 stocks, Crest Animation, and one other one was Rajesh Export. So I invested in Crest Animation, which became 150 to 1 rupee right now, or it is off market right now. The Rajesh Export multiplied, and probably it has become multi-bagger since then. So this was in 2005. But today we have opportunity to study each and every stocks, and of course it's not always easy by reading what is written in the online in the platforms which are available. It gives you a rough idea, but many times you will get carried away and your stocks may become zero or penny stock. So I have gone through that multiple times, that the stocks have become like penny from 150 to 0 or 1 or 2 rupees. But unless you go through this process of investment, we will not learn. If you are lucky, if you study well, if you are guided well, you may not get into this kind of problems. So investigate before you invest. That is very important. And what we say, there are two ways of investment. One is long term and the second is short term. When you are entering in a stock market, it is better that you invest in a small amount, something which you are ready to lose. You don't want to put your all hard earned money in one stock, which is a small, again, the Tanmay did say that if it is less than 1,000 crore market cap, you don't want to enter in such a stock. The best way to enter today for the newcomers would be A group shares, and again, invest in SIP mode, systematic investment plan. Means you invest maybe 5,000 rupees or 5 stocks of Reliance every month, something like that, where you are not investing lump sum amount, but small amount consistently, and that will help you definitely. And when you are doing this, when you invest, even if you're 1 rupee, you start studying about that particular stock and you will study even the stock market ups and downs. The another thing which Rajesh told, which is very important, it is not important to time the market when you want to enter. No, that is not important. In the initial phase, it is important how long you remain in the market. And once you remain for more than few years, you will definitely make enough profit out of it. It will give you enough confidence in investment and stock market. Ultimately, what we want to reach to, that we want to reach to financial security. And for me, it means what? It means that my major income should come from passive sources and not from my active practice. Once I reach to that level, then I am financially secure. Then when I see my patients, I don't look at the patient to earn money from them, but I want to give them a good quality life. That is what is my end point. That the patient has come to me, I want to give them quality life. I don't look at that this is patient from whom I learn 10,000 or 1 lakh or 5 lakh, but this will happen when your more than 80-90% of the income comes from passive sources and not from your active private practice. I hope that all of you, some of you may be regularly investing, some of you will start investing. So study and invest, and we hope that every one of us reach to the financial security as quickly as possible. With that, I'll stop my talk. If there are any questions in the chat box, we can take care of that. Alice, are you going to ask the questions, or how it is going to be?
Sir, we will go ahead as we are actually falling short of time.
Okay,
I would like to ask the last moderator, Dr. Basant sir, if he's online, to please give his last few comments. I think he's probably not online. I would like to please go ahead with the session. I would like to hand over the stage to Dr. Krishna Rao for the next upcoming session. Thank you. Thank you, everyone.
Thank you.
Hello, very good evening, everyone. From morning, we had a fantastic session. Now I have got one more session with the communication skills for a pediatric surgeon. I will be sharing my screen. We have got 3 speakers. The first one is Dr. Saida Banu. Am I audible?
मीटिंग तो चल रही है. ऐसी छोटी सी conference है. Youngster.
Our first speaker is Dr. Saida Banu. She is pediatric surgeon at ESA Medical College, Rajajinagar, Bangalore. The second speaker will be me, and the third speaker is Dr. Salim. He is an assistant professor in Government Medical College, Jammu. We have got three experts today. Professor Arvind Sinha, sir is HOD and at AIMS, Jodhpur, and Dr. HPS Miglani, sir, consultant pediatric surgeon at Amritsar, and Dr. Lakshmi Sundar madam is a consultant pediatric surgeon at Chennai. I will hand over to Dr. Saida madam to start.
Yeah, thank you, Dr. Krishna. Can you just let me screen my, share my screen? Yeah. Is my screen visible?
Yes, it's visible. Full screen.
It's visible.
Yeah, one moment. Yeah. Good evening, everyone. I'm Dr. Saida Siddika Banu. So at the very outset, before beginning my presentation, I would just like to narrate one small incident which happened during the first day of my general surgery residency. So we were operating the entire night, emergencies, and next day we had to continue with elective surgery. So at 4 a.m., my boss asked me to convince the nursing staff as well as the anesthesia staff to give us one more case at 4 a.m. But obviously they denied. They said, you can cancel one of your electives and start with your emergency the next day. But to my surprise, when my senior asked, they agreed. So I was like clueless. It was my first day. Then my boss called me and he said, during these 3 years of your general surgery residency, you will learn how to communicate in the first 6 months. You will take 2.5 years to learn when to communicate. And it will take you probably a lifetime to learn when. So confident. And as we all know, that especially for us in the healthcare industry, communication skills are very important. We all think that scalpel is our biggest weapon or biggest sword, but our tongue is also equally important because it makes and breaks the relationship which we share, either with our patients, with the parents, with our colleagues, the nursing staff, students, family members, or whatever. So communication is a skill or it is an art with which we are not born with. It is something which has to be learned daily, not only just once. So unfortunately, when we were doing our graduation, this was not included in the curriculum. But in Western countries, communication skills are considered to be a core competency, and they're included in their program, teaching program. And now NMC also has included ATCOM in the undergraduate teaching program, which comprises of attitude, ethics, and communication. So I'm sure during our practice, at least once we have heard this phrase, that Dr. Sahab, आपसे बात करके आधी बीमारी तो ठीक हो गई. So what is this they're talking about? This is about what sort of trust, what sort of relationship you build with your patient. Not only with your patient, with anybody you're interacting with. So that is what boils down to the topic of our discussion, which is communication and skills. Now, with the revolution in the healthcare industry, there has been an evolution in the patient-doctor relationship as well. So from a paternalistic attitude or a model wherein doctor used to decide what has to be done, the doctor-patient relationship has shifted towards a more patient-centric approach, wherein the patient is equally involved in the decision-making, equally informed about the various procedures that might be there, the various options, and the patient also is responsible for taking the decisions equally with the doctor. Now, this is where there is importance of communication which comes into picture. So an effective two-way communication helps in establishing trust, helps in reducing the patient anxiety. We can provide emotional support to our patients. It helps in building a rapport, enhances the patient compliance. Ethical problems are reduced marginally. There are improved clinical outcomes and reduced medical and surgical errors. And also there is enhanced patient and doctor satisfaction. Now, what are the challenges which we pediatric surgeons face? When we compare ourselves to our colleagues with other subjects, they have to have only a two-point communication wherein they are dealing with the patient directly. But when it comes to a pediatric surgeons, we have a three-point communication where a third party is involved when it comes to explaining, when it comes to decision-making. So it makes the communication very challenging for us, the pediatric surgeons especially. So to summarize this, suboptimal communication is the root cause for the majority of severe adverse effects, and good communication reduces job stress and it enhances the satisfaction not only for us, for our patients, for our colleagues and everybody. So now what are the strategies for effective communication? First thing is identifying the target audience. We need to identify who are the people whom we are interacting with. One is the patient, whether we are dealing with an infant, whether we are dealing with a child, whether we are dealing with an adolescent. Because age-appropriate language has to be used. We need to smile at the patient, we need to interact with them, play with them a little. So we can use tools, we can use toys, we can use different tricks to engage them. Because even the thought of coming to a hospital itself makes the patient very anxious. The child starts crying, the parents are anxious. So it is a very bad environment in which you take history, and it also affects the compliance because the patient would not want to come back to you. Then you identify whether you're talking to the parents, whether you're talking to the bystanders, caregivers, guardians, whether they are your nursing staff, technicians, colleagues, or sometimes us being the expert witness in the court of law. So you need to know with whom are you interacting. Second thing is setting up this scene or stage. This doesn't mean lights, camera, and action. It's not about shooting. It's not about a movie scene. What I mean by setting up a stage is that always try to be calm and composed. Try to be well-dressed, well-kept, because first impression is the last impression, as they say. You might be knowing, you might be very well at your surgeries, you might be very well at your subject, but if you are unkept, if you do not know how to communicate effectively, people will not come up to know that skill level of yours. They'll not know the knowledge you have. So always be calm, composed, well-dressed, presentable. And what makes the biggest difference in your effective communication is the tone of your voice. So when I say tonality of voice makes difference, this means that the meaning people get from you comes less from what you say than from how you say it. So this makes a very big difference. And always smile. As soon as the patient enters with the attenders, greet them, smile at the child first. If you smile at the child, show a little love, the parent's smile will follow soon after. They'll be at ease. Introduce yourself, introduce somebody who may be present in the room along with you. So create an atmosphere wherein, it's very conducive. Your body language, facial expressions, everything matters. So most of the times what will happen, we would be so overstressed or exhausted, we would have had a long surgery, and then this patient comes exactly the moment you're going to leave the hospital. So you're very irritated. So do not let those emotions come on your face. Next thing is setting up the agenda. Before speaking, align your thoughts and decide what you want to speak. Now, this is very important. It has to be individualized on the subject with whom we are communicating. Sometimes we'll have a very well-educated IT professional who knows, who would have Googled multiple things before coming. He'll just shoot questions at you. So sometimes it is good or easy to explain to them. Sometimes you'll have a very low socioeconomic status ka patient, wherein you do not know, no matter how much you're trying to explain to them, they're not understanding. So you have to tailor make your communication levels. You have to make use of non-verbal gestures. You have to make use of drawings, and you have to come down to their level in order for them to understand what you're going to speak. Just shooting your knowledge in front of them is not going to work at all. Then you have to remove the barriers of communication. Now, what are the barriers of communication? Sometimes you might have a Bengali speaking patient or a Malayali speaking patient or a foreigner. You do not know the language. You cannot say, I will not see the patient. So at that time, at least with your non-verbal, just 1 minute. With non-verbal you can remove the barriers. So always be a good listener. Do not interrupt. Do not put direct questions to the patients. Use the phrases like, go on, I can understand, or tell me more about this. And always define the duration of your communication. Like here, I have exceeded my time and these people are prompting me to stop. So always, be careful. Do not exceed the time. If you have to convey, be crisp. If you have to educate, be simple. Give enough time to each family and each patient. So the take-home message is that when somebody asks us, what is the most common procedure that you do? We say circumcision, we say hernia, lap appendix, this, that, and all. But no, communication is probably the most common procedure done in the field of medicine, which all of us has to remember. Now, don't worry about being clear, worry about understood. When a patient is happy, you're happy. And one last thing I would like to say is that communicate, document what you're communicating, communicate the documentation, and preserve the documentation. So now to talk more about the documentation, we have Dr. Krishna Rao, who will take us further. Over to you, Dr. Krishna, and thank you very much for your patient listening. And sorry for exceeding time.
Thank you, ma'am. It was a very nice presentation. Please stop your screen, ma'am.
Can we move on with the next talk, or are we about to speak something?
Good evening, everyone. I will be giving a small talk on the written communication. Ma'am already gave about the oral communication, how it is important. And now whatever ma'am told, like whatever we are told, we should document it. So documentation is very important. So as soon as the patient comes in OPD, there should be a documentation in the OPD or in the casualty. The patient information booklet should be provided in the patient's own language, and first counseling has to be done at the first visit. And later on, the pediatric surgical team will assess and do slideshow. Okay. And at admission, the pediatric surgical ward, the first in ward, then parental continuation of counseling will happen. And in the next, subsequently, the communication and documentation will happen in the preoperative room, post-operatively, and any additional sessions are deemed necessary. Most of the time in the pediatric surgical field, the parents will be anxious and apprehensive and about the health of their children. A standardized, reproducible, and meticulous parental counseling is helpful for both the parents and the treating doctors. Instances of criminal and medical legal litigations also reduce markedly if proper documentation is made. The parents and elderly may react unpredictably to any morbidity or complication or mortality. So, medical legal aspects, the courts consider every cut or scalpel or every stab or injection, anything can be medical legal issues. Even if the treatment was performed perfectly from a medical point of view, if inadequate information has been given or lack of information, written consent might be the sole basis for any damage or compensation or suffering in the court of law. The informed consent consists of a type of surgical intervention and any options given to the patient with the success or failure, which is explained to the patients, whether it is a high-risk surgery or a low-risk surgery, or procedure chosen by what is the procedure chosen by the parents or guardian, and details of the relevant risk involved before and during surgery. Everything should be documented. And after this explaining, both the doctor and the patient both should sign on the consent form. There are some multiple consent forms available in the world. The most important surgical consent form is WHO surgical checklist. If WHO surgical checklist is followed and the meticulous consent is documented for the surgery, and most of the time we can avoid the medical legal issues. Now I will hand over the next Dr. Salim sir. Proceed next. Dr. Salim sir, unmute yourself and start sharing.
Unmute yourself, please. We can't hear you.
Now I can unmute. Just sorry, just for a second.
Yeah, we can hear you now. Now share your screen.
I can't see my slide.
It was visible to us while you were
Is
done.
it visible now?
No.
No.
Let me do it again. Sorry. Is it visible now?
Yes. Make it full screen.
Yeah, I done it. Am I audible?
Yes.
Yeah, so thank you so much, Saida and Krishna. They have made the job so easy for me. So what I'm going to share is a very small experience. Like I'm Dr. Salim Nazki. I finished my MCH in 2019 from a very reputed and under the very able teachers at PGH Chandigarh. Worked in a rural area in the tier 3 setup, and then went to UK for 2 years. So a very mixed experience of working in all this setup. So I would say, how are we different from the West? All of us know a communication is sending and receiving messages through verbal or non-verbal methods. Yes, always a two-way. Thoughts, opinions, and ideas between the two or more individuals with the purpose of building and understanding. So understanding has to be in a positive way most of the time.
So make your full screen, sir.
is you're not
Sorry?
on you're not on
Full screen, sir.
yeah,
Make it
okay.
full screen.
I have done it. Oh, I have done it a full screen. Is it? Can you see it?
No, your
I
slides
think
were
you
not
need to
moving
click
too early.
enable editing first.
I'm not editing anything here.
No, you
Click
need
that.
to you need to click that enable editing. Then only you can.
Maybe. Sorry for that. Is it fine now?
No, now your screen is lost.
Oh no.
You need to share again. Enable editing.
I think there is some communication gap here.
Yeah,
Yes.
now you
is
do
it visible?
Slide share.
Is it visible now?
1 second. It's not visible.
It's not going to full screen. It's
Is
okay.
it visible like this?
Yeah,
Yeah,
that's
it's
okay.
visible.
You
Yeah,
can
you
just
make the
go.
box.
Can I proceed with this?
Yeah, keep going
Yeah,
down
yeah,
the
you-
slides one by one. Yeah.
Is it moving now?
Yeah,
Let him
just
move
move.
in.
Please go ahead.
So sorry for that. I don't know what's happening with that. Maybe I'm very bad at this. So I'm using my wife's laptop. Sorry for that. It doesn't give me access to everything. So sending and receive. So let's go ahead. So what is it visible right now? Like India versus West?
Yes, it's visible.
Yeah,
Yes,
thank you.
very much.
So what is different between India and West? How are we different from them? The first and the very important thing I learned even before going to UK was say no to hierarchy. I remember writing an email to my TPD, training program director, writing an email to him with a special mention of dear sir, and he replied a very long email back, why you should not call me a sir. So I little bit of felt embarrassed, but at the same time it was very good to know that everybody was equal. What the mail told me, you are not inferior, I'm no superior to you. So everybody in UK was treated same, be it nurse, be it a person working in a hospital to clean it. The doctor is no god as it is here. So what the Apple giant said, Steve Jobs, if you want to hire a great people and have them stay, you have to be run by ideas, not by hierarchy. So what is the difference? In India, we follow, very sorry to say, most of us do. We follow a hierarchical system here, where a doctor is a boss. A bossy doctor is an authority, more directive, making decisions and informing patients about the course of treatment. And we know the
parents do know most of the things right now. We just saw like an hour before about the social media, parents knowing everything. We pretend parents know best, but not always. Patients follow the advice without questioning here. Limited patient involvement is seen here. So as compared to that, in West, they follow agilitarian centered protocol, where it is more of patient centered care. A patient's preferences and values are considered in decision making. It's a collaborative communication, encouraging the patient to ask questions, participate in their treatment planning, pre and post operative involvement. I remember we used to spend 10 minutes pre operatively and 10 minutes post operatively with the patient and their parents. I would say that we have very less time here, but if not 10 minutes, do it for 2 minutes. You will see a very big smile on the face of the parent. Informed consent, Krishna said it's very important. They have a very high emphasis on the consent, explaining very honestly the risks and benefits and also before agreeing to the treatment. So important for you to have an effective communication is assess what the patient already knows, assess what the patient wants to know from you, be very empathetic. Honestly speaking, when somebody asks me what you learned when you came back from UK, my answer is I had the communication most, because I had learned my 95% of skills of surgery in PGI, but communication I learned more from UK. Very sorry to say, yes, they have a very good skills. Then slow down when you speak to them. Keep a very simple words. Avoid using jargons. Tell the truth. There is nothing like you should not speak to the parents. Be hopeful. Even if you're speaking to a parent with TA, give them a hope, but tell them the truth. Watch the visual clues, what they want to ask, what they don't know, and be prepared for the reaction and your answers. So, what my take home message will be: a very well prepared your patient should be there to clarify your communication, what you actually want to say. Appropriate communication channel like face to face, email, Instagram, Facebook, whatever you want to say. Give an appropriate information, respect the time, clear the consents of messaging, be an active listener. It's a very important part of your communication. Documentation, very important. You might have said a very wonderful words, but nobody is going to stay for that, nobody remembers, but what you have written, everybody knows that. Maintain a professionalism and professional demeanor. Your feedback is very important. Even when I check my Google feedbacks as a practitioner, most of them say that he's a good person rather than a good surgeon. I don't feel bad. I take it as a compliment. Continuous improvement is most important in each case. So make sure your communication is effective, efficient, provide quality care for your patient is more important. Thank you so much.
Wonderful.
Thank you, sir. Dr. Sir, it was very nice presentation.
Thank you so much.
And even Dr. Saida madam also did very well in communication skills. Now I hand over to experts. I can see Dr. Harprakash Singh, sir. Sir, please give your comments, sir.
Well, to begin with Dr. Saida Banu's talk, it was so crisp and clear. What took me, about in my practice to learn, and she has summed up in 5 to 7 minutes in such a nice manner that it left me speechless. That I was amazed actually. My God, she did everything. I mean, the tone of the doctor talking to the patient, if she can understand that, even if it goes one grade higher, why did you get this? The patient just vanishes after your consultation. He doesn't come back to you. So you have to control your communication in a very, very effective way. And coming to Dr. Krishna Rao's written communications and booklets and all those things, everything, in practice costs money. And patients also don't have that aptitude or time or maybe the education to go through written things. You can put a standee or two about some common conditions in your clinic. You can put booklets also. But most important thing is how you talk to the patient, how you explain to him the condition. And from my end, I can say the way I talk is in their own language. I greet the patient with a polite smile. I wish the patient Sat Sri Akal to the small boy, and he feels important that this doctor is calling me G. I apply G after pronouncing his name, and that is what make eye contact with the small child if he is school going, something like that, so that he also understands that I am trying to talk to him. And regarding consent for surgery, of course there are printed consents in all the corporate hospitals. 4-page, 5-page pre-printed consents are available, and everybody is following that. That's a legal thing basically, which NABH thrusts upon you that you must follow this. But when I take up a patient for surgery, everything is printed on the file undoubtedly, but I ask the patient to please read it and then write it again for me in simple language, just a half a page or a 1-page consent, which is written by the patient himself or his father or the mother or the attendant who's there, that I am undergoing this, want my son to undergo this surgery, and I am allowing Dr. Milani the surgery. He has explained to me all the good effects and bad effects, and he has explained to me the cost of the surgery, and he has explained to me the hospital stay and the likely complications. And I understand the risks that are there, but I am undergoing it with my free will. So that solves a lot of problems. I have in fact never had a opportunity to face wrath of the patients because of this consent. I'll take half a minute, because it's important. One patient came to quarrel with me because his meningomyelocele baby was not walking, and the mother came and shouted at me that, why didn't you tell me before? I took out the file, showed it to her that this is your husband's handwriting. I had explained to you that the child is paraplegic. Still, he wanted surgery for the back lesion, and that settled the issue. So that's important that it is written in the patient's handwriting. And yes, as Dr. Salim Nazki pointed, be a good human being first. You will be a good surgeon. You have the skills, but being a good human being is of paramount importance. Thank you very much. I would request the other chairpersons to please contribute.
Sir, is there? Dr. Arvind Sinha, sir, please.
Yeah. Okay. So I think very well covered by Dr. Saida, Dr. Krishna and Salim. Just want to expand a little bit. Communication skill is important for patient communication, communicating with the patient, but it is also extremely important how you communicate with your colleagues and how you communicate in a professional setting, let's say giving a lecture or basically disseminating knowledge. So those are important communication. If you just do a thought experiment, let's say in your own hospital, who's the good doctor that you identify a good pediatrician or good nephrologist? It's either by way of mouth, a word of mouth, that is, you've heard that he's a good person or she's a good person, or that the person talks to you well, has talked to you intelligently, has talked to you in a proper manner. So, right, so even how you might be the most intelligent, most capable person, but how do you communicate it to your colleagues is by way of how you communicate. If you communicate effectively, they will think that yes, you are equal to the task of what you have to, you're being entrusted upon, right? So that is the important thing. It's a soft skill, which I think everyone needs to work on. And I think continuous improvement in communication skills is absolutely essential. I think each of us should keep working on improving our communication skill, not only with the patient, but also with our colleagues and during our presentations. I think that's my 2 cents.
Thank you, sir. Ma'am, Lakshmi ma'am, for your final comments.
Thank you. I think it was a very interesting session because we had some different viewpoints expressed on communication. And so we realized it's a very important topic for us. So what I wanted to stress is again what Saida said, that communication happens at 2 levels always. One is what we say, and that's the verbal communication. And the bigger communication happens in a non-verbal way. So it's important that we are presenting ourselves in a confident way. So if you're talking to the parents, you have to show that confidence. You have to show that you're on their side and you're trying to do the best for their child. So that non-verbal communication is something that we just have to learn with time. And we should not forget the importance of non-verbal communication at all times. Second thing is, as I think Dr. Miglani was stressing, particularly with adolescent patients or children who are a little older, please make it a point to try and talk to them directly. So particularly if I've got a child who comes to me with constipation or with incontinence, rather than just telling the parents that you increase the fruit and fiber in the diet, I actually talk to the child and I tell them that this is what you need to do. And you give them clear ideas what they want to achieve. So rather than saying you want 4 portions of fruit and veg in the diet, you tell them, you want to give them so much of veg you need to eat. So you need to eat that 2 times a day. You tell them in a language that that child is going to understand. So that's another thing. And I think what Dr. Sinha was saying, I think it's particularly important that we think about communication not only to the patient or the parent, but also to the other members of your fraternity, and not only in your day-to-day communications with pediatric specialties or others, but also it's, for example, I'm the consultant sitting at home. The PG is trying to communicate to me about a case that they have seen in the emergency. So I think before you do that, just after you've seen the patient, take 2 minutes, sit down, collect your thoughts. If necessary, if you're a very junior person, sit and write it down and maybe practice talking it once, because it needs to sound clear at the other end. Based on what you're saying, what the PG is saying in the hospital, I have to make an image of the patient sitting at home. So, that communication needs to happen in an appropriate way. And obviously communicating in a meeting to a group of people like this is another different aspect. And I think one of the problems that particularly Indians have is that we tend to talk very fast. So as was already said by Salim, it's very important to visibly slow down in what you're saying rather than trying to talk too fast. And finally, I wanted to say is communication is especially important, to be honest, when you have a complication. Okay. I mean, sorry, before that, the consent, we've talked about written consent and handwritten consent, especially for high risk procedures. And there is also this system of video consenting. So you have the whole thing recorded on a video. So if you're particularly doing high risk cases, where you're likely to have complications and problems, I think you should consider to have a video recording of that consent. And I think the final thing I wanted to say was about consent, communication with complications. Not everything goes according to our plan and problems do happen. And my feedback, and one of the things that I've always maintained throughout my practice is I'm very honest with my communication. So I come out of theater, I say, okay, this didn't go well. This was a very difficult case, and it was not as easy as I thought it was going to be. And we are likely to have problems with that. And I've had a patient, for example, when we had gone in for a laparoscopic nephrectomy, and we ended up injuring the ascending colon. So I actually have to convert that to an open surgery and do a resection and anastomosis of that colon. But I came out and I was honest with them. I talked to the parents and they did not file a case. There was no problems. They said, as long as we feel that you are with my patient, you've done the best that is possible for the child. That's all matters. And that has been the case time and again, repeatedly, every time we've had patients with really bad complications, like you have a fecal fistula. You've got to be there for the patient and you've got to make them feel that you're there with them and you're taking them through that process of the complication and you're available to them to discuss about problems and reiterate things again and again. Many people will not remember what you've said once. So saying it again and again, repeating it is very important. Thank you very much for the opportunity.
Thank you, ma'am. Now we'll end this session. I will hand over to Tanmay for the mentoring sessions. Thank you, everyone.
Thank you. And while we're talking about the recording part, it just reminded me there are some apps that come in right now. They provide a video recording of consultations which can be stored in the cloud. So I think that's a alternative that one can look at. I recently came across, so I thought to share it. And again, great session. And now we move on to the second phase of the today's conference. So we had so much energy from the young speakers. Now it is time for some mentoring sessions for the Yuva pediatric surgeons. And in this set of series, we have one very important topic, which is we are bound to face this as soon as we come into practice, and the problems become more so when we don't have any expert who can help us with this. So we have this session on legal safety and indemnity. The speaker is Dr. Nilesh Tag, and we have our experts in Dr. Anil Dubey sir, and we have Bikasha Tripathi sir as well. And all our experts and our speakers have multiple hats, so they do have their expertise in legal as well. So over to you, Nilesh sir, for the presentation.
Am I audible and my slides are visible?
Yes, sir, please.
Okay. Good evening, everyone. I am Dr. Nilesh Tam. I am a pediatric surgeon working at the ENM Children's Hospital, Surat, Gujarat. So I will be talking about legal safety and the medical negligence. Basically, this is a very huge topic. If you want to speak very briefly on this topic, you need at least 2 hours to explain to the audience. But I would try to cover it, as much as possible within 10 to 15 minutes. Whatever the slides I'm sharing in these presentations, basically I have taken it from our law classes taken by our law professors. So I'm really thankful to especially the Professor Dhania and Professor Singh, our law professors. So the consent has been discussed about by the previous speakers. Basically, who is a person who is adult and has sound mind knows what should be done to his body, and if you are doing something to his body without his or her consent, then it would be held liable as medical negligence. So we need to be very careful regarding taking the consent. So that basically there are three types of the consent. Whenever the patient comes to our OPD to get treated, that would be considered as implied consent. And we are examining the patients or giving some injection to the patients where we don't take written consent, but it is an express oral consent from the patient side. That would be called as oral consent. And the most important thing is written informed consent, which was discussed by the previous speakers. But I would like to emphasize a few more things in the consent part. The number one, that the patient's diagnosis should be mentioned in the consent form in a proper way. There should not be anything missing in the diagnosis. Number one. Number two, the procedure that we are going to perform on the patients, it should be properly mentioned. Like, it should not be half of the total title, like exploit laparotomy. No, it should be properly mentioned, exploit laparotomy with colostomy or any other procedure. So half of the procedure, if you mentioned in the consent form and we are doing something else on the patient's body, then it would be held it would be held negligent. The third important thing is the risk factors or the complications part. We need to be very specific. We need to mention two main things. One is the general complications like bleeding, infections, or wound adhesions. And the more important thing is the specific complications, like the complication related to the specific procedure. For example, if somebody is doing surgery at the spinal, near the spinal nerves, then there would be chance of damaging those nerves and getting paralysis post surgery. So these complications should be explained to the patients as well as the family. And if you don't explain to these things to the patient and complications happen, then we would be held liable, negligent in the eyes of the court of law. And the fourth important thing is the alternative procedures. We need to put alternative procedure in the consent form. It is not like that we will only mention the robotic pyeloplasty. We'll have to explain about the open pyeloplasty. We'll have to explain about the laparoscopic pyeloplasty and the robotic pyeloplasty. And all three options should be there in the consent form. It is not just blanket robotic pyeloplasty. So patient has right to know each and every alternative procedure. So all these four things should be there in the consent form. Because of this adequate information, now patient will have a better balanced, will be able to take the balanced decision whether which procedure the patient wants to select out of all these procedures. So the adequate information should be there in the consent form, and anything is missing in the consent form will be held liable negligent. Exception to this consent is when the patient is not in consent to give the not in the condition to give the consent, or when there is life-threatening conditions where we can fight with the procedure. And if we are negligent, there could be a civil liability or the criminal liability. Now, the medical negligence under the civil law, there are basically three important things, three important essential elements. One thing is that there should be a duty of care, means from the doctors towards the patients, and there should be a breach in the duty and resulted into the subsequently damage to the patients. And if there are any breach in the duty, then we would be held liable for medical negligence. See, we'll have to understand, court or the law, they does not want us to be highly skilled or highly knowledgeable. They just want us to be reasonable, skilled and knowledge. They ask us to give the reasonable standard of the care to the patients. So we should not be worried too much about of giving the highly skilled or knowledge surgery to the patients. So this is in the eyes of court of law, and if there is negligence, then we will have to pay the compensation in the civil law. And in the medical negligence come under the criminal law, there would be punishment, in terms of imprisonment or fine. The important thing is this rashness. The court defines the rashness in the surgery. What is rashness? That you would see in the further slides. Now, after knowing about the consent and the counseling part, we would see few judgment cases that have decided, that are considered a landmark in the eyes of court of law. The first thing is IMA versus VP Santa. Before 1996, we would not there under the Consumer Protection Act. As per the CPA, there is a proper definition of consumer and the services. But in our medical field, we do come under CPA Act, because what happens in contract, there will be two party and there will be a consideration from either side. Like in our field, a doctor is giving treatment to the patient. Patient is providing fee to the doctor. So there is a consideration from either side. So if the patient is not happy or is getting some complications, then the patient has right to file a suit against the doctor in the consumer protection. So yes, we do fall under the Consumer Protection Act, and we are service provider and the patient is a consumer. But at government hospitals or the trust hospitals or the nursing homes, where the hospital is giving treatment free of cost to the patients, so there is a one-way communication. Means the doctor is providing treatment to the patient, but patient is not paying anything to the doctor. So those hospitals and the doctors would not come under the Consumer Protection Act. So now, after knowing the legal relationship between the doctor and patients, there is also a relationship between the hospital and the patient. Because see here, something if an employee does something wrong to the patient and he or she is held liable negligent, then the hospital would also will have to face the negligence part, because there is a vicarious liability. There is a master servant relationship between the hospital and the employee. So if the employee is negligent, then the hospital will also have to pay the compensation. So to know more about the consent and the hospital or doctor relationship, we'll have another a landmark case, that is Samira Kohli versus Prabha Majinda. So the patient is 44 years, old patient. She had some bleeding irregularities, and she consulted gynecologist, and ultrasound was performed, found to have some uterine fibroid. And the gynecologist said that, we would go ahead with the laparoscopic procedure, diagnostic lab procedure, and the consent was taken for that procedure. And during the lab, the gynecologist found that, the pelvic organs, they don't look good. So better to, take them out. So one of the assistant of the gynecologist went to the patient's mother and explained about the removal of, the pelvic organs. And then the consent was taken. And later the hysterectomy and the self-finger oophorectomy was performed. Once the patients, came, and in the post-operative period, patient came to know about the such procedures, later she filed a suit case against the doctor that, without her consent, her pelvic organs were removed. So what is wrong in this case? Is the gynecologist liable, negligent in this case or not? So there are two more important things in this case. The first thing is that the consent was taken for diagnostic lab only, not for any other procedure. The second thing is that patient is adult and sound mind, and can give her consent from her behalf. So why the consent was taken from the mother? So what the court said in this case, the consent should be real and valid, and it should be voluntary, and the adequate information should be provided to the doctor. Like what we discussed in the informed consent. Patient has right to know about what the procedure is going to be performed on him or her. Here, only diagnostic lab was explained to the patient and not the organ removal procedure. So it was lacking the adequate information as per the court. And the other thing is that in the defense, what the gynecologist said, she said that this procedure would save the considerable time and expense to the patient, and would relieve the patients from pain and suffering in the future. So actually the gynecologist had good faith towards the patients, but see, we'll have to understand the court doesn't believe in faith or in feelings. They just only believe in legal documents and the evidence. So we'll have to be very careful. We'll have to keep away our feelings from our clinical practice. We'll have to be very cautious about the consent and the counseling part. So at the end, the court held the gynecological liable for this the organ removal procedure, and he was still had to pay compensation to the patients, except when there is a life-threatening condition. When we are performing one procedure for which we have taken the consent from the patient, and some life-threatening conditioning happening during the procedure, then we can go ahead with the procedure without taking consent. But otherwise, we'll have to take the consent from patient. We can we'll have to abandon the procedure, and the patient will come out from the anesthesia, and we'll explain the second procedure to the patient, and then we'll go ahead with the second procedure in the future. So this will have to believe without giving proper information to the patient. We cannot do any kind of surgery, or we will be held negligent.
A minute, sir.
Now, this is the the second case from the US. Actually, the patient was suffering from ruptured disc and visited neurosurgeon who was advised to go get the laminectomy. Laminectomy was done, and then patient had some paralysis and the bladder bowel incontinence. What here the patient, and then the suit was filed against the doctor. Here the patient said that the doctor in the pre-surgery counseling said there will be only weakness without any kind of paralysis. And he did the positive counseling to the patients without telling anything about the complications parts, just to retain the patients. But the court said that the adequate information was not provided to the patients, especially the complications of the procedure. So again, the doctor was held liable. So we'll have to explain each and everything, all the material risk or the specific complication related to that particular procedure to the patients. And if you are not providing that, then you would be held liable negligent. Now, this is also a very important judgment case, especially for the young pediatric surgeons who are working at a small nursing homes in the freelance practice. Like in this case, the Dr. Srivastav went to perform gallbladder surgery at hospital where there was it was less infrastructure and equipped, no facility for oxygen or blood transfusion, life-saving drugs were not available, only 2 staff nurses of 28 bed hospitals. So, when we are performing surgery at those hospitals which are not fully equipped and performing the surgery and some complication happens, then court would hold us liable for negligence, because we should not perform surgeries at such places which are not medically equipped. So all the young pediatric surgeons, because nowadays what happens in the private practice, the general practitioners or the pediatricians have opened their own operation theater setup, and they ask the pediatric surgeon to go over there and perform the surgery. And we usually go there and perform the surgery. But if anything goes wrong in such small setup, then we would be held liable negligent. So we should stay away from such kind of working atmosphere. Now in this case, this is also one of the important cases.
Can we conclude, sir? I know but we have lots of questions in the chat box also for you.
Okay.
So I know it's a very big topic, but then short
Can
of
I take this one judgment case if allowed, or should I stop?
I think we are already out of time, sir. We can have questions. So we can arrange a separate talk on this, because there are so many people who would want to love to, discuss more things in detail. So we can have the expert comments on this thing. First, I'll go to Anil sir. If sir, you want to add something to the discussion?
Yes, thank you, Dr. Tanmay, for giving me an opportunity in this very new and innovative type of conference with a lateral thinking. So first, Nilesh has covered a lot of things with a very good case like Samira Kohli. It's really a case where the consent has been defined very well. And consent is nowadays not considered as a mere, it's not a mere piece of paper signed by doctor and patient. It is actually a process. And it starts when the patient comes to you and you start explaining to the procedure and the pros and cons and the alternative methods. These are all the things comes in under consent. Of course, the signed paper is one document which helps you in the court of law, but you consider the consent as a process. So that is what is most important. Second, the scope of consent is very well covered in Samira Kohli's case. And there's no place for blanket consent. Have you heard that blanket consent means written over there that the patient so and so can be operated on by doctor so and so, without writing the things that we can explain everything to the patient, that patient can die by this and that. So this is not the things. You have to be very specific about the doctor who is operating, about the procedure, what is being done, and about the possible complication. That is what is the informed consent. So, and there is nothing like death on table consent, DOT consent. When I was doing MS, it was quite prevalent, take the DOT consent and take the patient. But there is nothing like DOT consent. You can take the high risk consent, explaining each and everything. So that is there. And as far as negligence, civil negligence and gross negligence is concerned, civil negligence, definitely patient can file a suit to any doctor. No doctor is immune. Even a doctor who has done the first cadaveric heart transplant face the civil negligence against him. So it is a part and parcel of our professional life. But of course, the criminal negligence has to be avoided. It is nothing but a gross negligence. Gross negligence means, for example, if I have to do the right amputation, right lower limb amputation, I'm doing the left lower limb amputation. Such type of gross negligence has to be avoided, because then the case is between the doctor and the state, not between the patient and the doctor. And you have to face the criminal remedies. So that has to be avoided. And indemnity part is not covered. So in brief, everyone should have an indemnity insurance, because no one, as I said, it is patient's right to file a case against a doctor. And similarly, a patient and doctor should have an indemnity according to the gentry of the patient, as well as the type of surgery and the area he belongs. Suppose I am in a town which is not a capital town. So usually patient may go up to the state, the district forum. So district forum is having up to the 2 crores type of things. And then beyond 2 crores, 20 lakhs. And beyond 20 lakhs to 2 crores is a state forum. So if you are residing in a state capital, definitely you should think in that way also, to have an insurance of some assured like that. So this is all about from me. Thank you. Any question I can answer if anybody has.
Thank you so much, sir, for summarizing it. We can have some inputs from Bikasha sir as well. Sir, you want to add a few points?
Yes, it is a very well presented discussion by Dr. Nilesh. He has left a few aspects. One is about assent for those children who are below the age of consent, which we are operating main care source. So we have to take assent on those cases. And also indemnities are Dr. Anil has already told. And it is a must for corporate and private hospitals, but in government setup, they don't tell us to do indemnity. But for our security and safety, we should do indemnity, looking our patient area and other things. Thank you.
Thank you so much. And this is something I know the time was very less. Nilesh sir has already told me before the session as well. So I think we can arrange a separate session, a detailed one, quite, so that all the Yuva pediatric surgeons can learn from these things and have adequate time to ask the questions and get it answered from sir and Anil sir, yeah, and Vikas sir, yeah. Yeah, Nilesh sir, please.
Basically, there are very important judgment cases in the court of law, which decide the future cases. Like for example, Samira Kohli versus Prabha Manchanda, and there are so many cases, So we need to know all those cases, and that would define us our clinical practice. I mean, we need to be very cases. So there are around 8 to 10, judgment cases. But anyway, we can take it. Some other time. Yeah, but the surgeon should not all those cases.
Yes. Thank you so much. Thank you so much, all the panelists, for this session. Now we'll head over to the next session. Another session which is, I think, very, very important for all the residents who are passing out, because the first thing that they need is when they apply the job is to have a very good CV, and it is on the basis of CV only that we get judged. And we have our speaker in Dr. Prabodh Goyal sir. And in the chat box, Vikesh sir has shared his CV. And I think I don't need to give any further introduction after that, because anyone who can open it, he'll get an idea about it. So welcome, sir, for this. And we have the experts for this session as Sumitra Biswas sir and KL Venkatesh sir. So over to Prabodh sir for the talk.
Thank you, Dr. Tanmay. I'll share my screen. So can somebody confirm that my screen is visible?
Yes, sir.
Thank you. First of all, I'd like to thank the experts for this session, and special thanks to the President, Dr. Ramesh Babu, and our Secretary, Dr. Vikesh Agrawal, for giving me this opportunity. I'll be talking on making an impressive resume. So working as Additional Professor of Pediatric Surgery in AIIMS, New Delhi, but coincidentally, I'm presenting this talk while I'm sitting in the heart of this temple of learning, that's the Oxford University in London. So although I'm here for a vacation, but then yes, I thought that we must know this. I thought I'll start with a resume of the Oxford University. So there is no clear date on the foundation of this university, but then there are evidences which say that teaching existed in primitive forms as early as 1096. So this university has been around for a significant time. Then another record which says that it was in this university. And then, of course, we all are aware that during the COVID crisis, they came up with the Oxford AstraZeneca vaccine. So why do we need a resume? So a general answer would be to present our qualifications, experience, and skills in a concise and professional manner. And when we talk specific to the medical field, we want to highlight our specialized skills, our experience, and our achievements, which are relevant in context. So coming to the extremely relevant aspects, I'll be dividing my presentation into 4 major parts. One is a general discussion, which is the most important part of this presentation. I'll give you a sample template. We'll be talking about some tips and tricks. And finally, I'll give a list of some resources which will be helpful. So coming to the most important part, the general discussion. See, anybody's achievements is like, I have a lot of balls in my kitty. But when I'm presenting in my CV, not every ball is for everyone. So I have the right to decide what I want to reveal. And this decision changes with every occasion. So the point is, when you're presenting your CV, it is not something which is absolute. The content of the resume will change for every occasion that you're using it for. Now, a good resume is like a female dress. It should be long enough to cover what is important, but yet small enough to maintain interest. So there are things in the CV that you want to reveal discreetly. There are things in your life which you may not want to reveal in your CV. And there might be achievements which you just want to hint at very humbly. So these are different situations. Just I could think of 5, like I am applying for a teaching job. I need a resume which will be different from which I do when I'm going into private practice. Similarly, the CV for grant writing is different. Then there might be different forums. For example, I'm a chairperson in a conference and the organizer will ask for a paragraph, or maybe I want to showcase myself on the media, like we had a dedicated session on Facebook or LinkedIn, etc. So having understood this, we come to the basic conclusion that there is nothing like a perfect CV, and there are more than one ways of doing the same thing. So it has to be customized to the situations. Now, there are a lot of templates available in literature from Udemy, from Coursera, from LinkedIn, but frankly speaking, none of them are actually very dedicated to type of CV that we pediatric surgeons need. So when I was creating my CV, I thought that I should make it on my own rather than going for a template, thinking it would inspire creativity. It would challenge the status quo which is available on these template sites. And yes, I get solutions which are customized to my requirements. So what do I want in my CV? First thing is my CV should be such when I present it to somebody, it should boost my confidence. I should have a feel good that yes, I am being adequately represented in these 5 or 6 pages. Secondly, it should present the right perspectives about myself. If I'm applying for a government job, it should talk about my achievements, about my research. But if I'm going to private practice, it should talk differently. If I'm sitting as a chairperson, it should talk differently. If I'm applying for a grant to ICMR, then the perspectives might be slightly different. So my CV should portray the right perspective. And of course, I should fit into the group. So I should be, that CV should make me look perfect for that particular position for which I'm applying. Now, this is the general discussion. Now coming to the template part. So see, these are the basic headings which are required in a classical CV. We'll just go through one by one. So a good CV should have a header. So this is just an example of how I have defined my CV. It gives the name, your degrees, your affiliation, basically, your contact details. One may like to add his photograph or not, depending your own will, but then it gives the facial recognition if you put a photograph in your CV. And then you can choose to add your nationality if you're applying on a forum which is beyond the country. Then if somebody may like to add prominent achievements and accomplishments as part of header, while others may want to include them as a part of summary of your CV. So this is how somebody may like to do it, claiming that he's a pediatric surgeon who focuses on pediatric urology and particularly hypospadiology, giving a summary of affiliation, summary of fellowships, summary of research achievements, summary of patents or innovations, then summary of your different types of experiences, which could be academic experience, clinical experience, administrative experience, or editorial experience. Then you need to highlight your education. So see, this is how I have done it. So I'm declaring that I did MBBS from King George's Medical University, which is situated in Lucknow, India. This was the time duration. And then I felt proud in mentioning that I was a gold medalist in my MBBS. So, but it can be dynamic. See, ultimately, it has to portray your candidature in a nice manner. So this is just a zoom picture of the previous slide. Then second is your experience. So you need to mention a job title in a particular institution with dates of employment, and maybe you may like to add your key roles and responsibilities. Now here I have tried to add the logo of the institute, just trying to make it a little more interactive. This is a zoomed version of the prior slide. Then next thing is that it should showcase your skills. You might want to declare that you're a pediatric surgeon, and in the huge umbrella, you're doing pediatric urology, and maybe you focus on certain particular aspects like hypospadiology. Then besides being a pediatric surgeon, you may like to tell that you have a special interest in epidemiology and biostatistics. Maybe you like to do a lot of systematic reviews and meta-analysis. Somebody may like to showcase his technical skill, that I do a lot of laparoscopic surgery or I do robotic surgery and so on and so forth. Somebody may like to present his soft skills like communication and leadership or administrative skills, editorial qualities, organizational skills, etc. So this is, I made several years back when all I had was academic experience and experience with a lot of courses. So that is why focus is largely on some online courses, some offline courses, one-day courses, certificate courses like that. Then gradually, as I kept on getting more and more editorial responsibilities, so this was built up. I have used the logo of the journal whenever available to make it a little more interactive. Here I've highlighted the administrative responsibilities as my capabilities, and then I have summarized them into within the Department of Pediatric Surgery, within my parent institution, and at the national level. They're just parts, screenshots taken from my CV. Then you might want to declare your board certifications, your medical licenses, and then if somebody has done something like a pediatric advanced life support or a basic life support, something like that. So here I have declared this as a second part where if I have a screenshot here, yes, I have given a list of the fellowship, for example, fellowship of the International College of Surgeons, and so on and so forth. Finally, you want to tell your patents and innovations. See, most of us may not have patent, but then whenever we are reporting a case report or we are doing an original study, you come across some findings which might be novel or different from those reported in literature. So I had filed for one patent, so I have written it in my CV. And then you might have innovations, you can give a list of those. Publications, of course, that is the most important aspect in any medical professional's life. I think currently the scenario is such that in many situations, this is the sole criteria for selecting people, which may not be right, but then it is what it is. So you may like to give a brief overview of your publications in your CV first, because the list of publications might be long and nobody or a lot of people might not be patient enough to go through all of them. If you go to Google Scholar, it gives you a nice representation of your achievements. It tells you how many publications you have. It will give you your total citations. See, it tells I have 14,855 citations. It also summarizes H index and I-10 index. This is a nice visualization for your CV. And trust me, if you look at a Google Scholar profile, it will always be better than you would have thought of so far. It also gives you your publications in a descending order of your citation. So if you just take a screenshot of the first 5 or 6 publications, it's a very good representation of visualization for your CV. So my first paper has been cited in all 5,400 times. So it gives a very good impression in your CV. And then, of course, you can give a list of publications. You might want to give it an ascending order or descending order. Then including a professional membership is another good idea. So see, I've written I'm a life member and fellow of Indian Association of Pediatric Surgeons. I've included the logo of IAPS to make it more interactive. Then you might want to talk about your research accomplishments separately. So the thesis that you do during a post-graduation super specialization is one research accomplishment. The research grants that you get from different funding agencies is another research accomplishment. Then the thesis and dissertations done by MCH students or MD residents under your supervision, either as a chief guide or as a co-guide, again, that is your research accomplishment. Then you may want to include one section on the awards and honor that you have. I have divided them into professional awards. Then I subclassified them into animation is not working, I'm sorry. So then I classified them into the award that I got as a postgraduate and a graduate. Then these are these are certificates of commitment or solidarity. And okay. So this was a problem with the animation, I'm sorry. This is a certificates of commitment and solidarity. So it's up to you, whatever awards you have got, the number, you may like to stratify them so that overall it gives an impressive appearance. Then something which we need when we are applying out of country is professional references. Within the country, this is also important, but not that much. Outside, it's very, very important. Generally, they say include 2 or 3 references and you should include a name and title. But this is something which is again double-edged. So you should be wise about the politics of professional references. You can read this article. This is very, very interesting, available on LinkedIn. Then I've included my experience with community work, how I've been catering to the rural population, involvement with NGOs, involvement in such bodies which are functioning for the cause of the country, and so on and so forth. Now, the third section is about tips and tricks. Here on, I'll go very fast. So one thing is that the formatting of resume is important. It should be such easy to read, easy to comprehend, and not looking very complex or perplexing. Then you have to tailor your resume to the position for which you are applying. Of course, that's very true. Ensure that there are no typos or grammatical errors. ensure it's not very lengthy, and avoid including information which is irrelevant to the reader. Then, of course, a good resume is a balance of humility and confidence. So while you have the mandate of being humble, at the same time, you have to show confidence as well. See, one very important aspect is your resume should speak about you, but it should not speak more than you. So more often than not, you submit your resume and it acts as your license to be called for an interview. Now, don't make a resume which speaks so loudly that the expectation on the other side of the table are very, very high. And when you actually appear for the interview, you're not able to speak that far. That's why I said the resume should speak about you, but it should not speak more than you. Finally, a controversial aspect, should you mention your limitations in your resume? Theoretically, yes, it should be done. Practically, so you see, I got a resume on LinkedIn. So this guy has written, I initially struggled with public speaking, but overcame this through continuous practice. And now I excel in leading large team meetings and presentations. So he has mentioned his limitation in a way that it gives a positive effect on the CV. I read it somewhere. The person wrote, I have an obsession to be highly focused on completing tasks well ahead of deadlines, sometimes to the point of overworking. So see, he's telling his limitation that I am overworking. So that's a good idea that you can tell your limitations, and while you're telling your limitations, you're adding one more star to your column. It's important to review and revise your CV regularly, have a feedback from your peers, and stay current. So my CV was in 2022. I've not been able to update it, which is not right. Now, the point is when you start updating your CV, you tend to forget small achievements. So I generally follow that I make a folder in my Google Drive every year, and whatever I achieve, just keep on adding one line to that folder. So whenever you get time to update it, you don't miss out on small things. So this was advised to me once upon a time by Dr. Vikesh Agrawal, and I've been following it, and it works very handy. Then sharing. It's good to share your CV as a PDF file and not as a Word format, because when the operating system changes, when the software changes, the formatting changes. So PDF, technically portable document format, prevent this loss of formatting, and it's good to share in PDF format. I suggest all of us should have at least 3 resumes, one written in a paragraph, one written in a page, and one detailed resume, because many times you get a request, please submit a one-page resume. Sometimes a conference organizer will say, please give me a paragraph about yourself. And that day you'll be too busy to organize it. So whenever making a CV, just make 2 other versions, one in one page and the other running just into a paragraph. Coming to the last section of it, that is resources. So nowadays we are blessed to have AI tools like ChatGPT and Bing. So whatever you're entering your CV, if you enter those lines into ChatGPT, it can help you improvise your language. You have AI resume maker, you can just enter the content and it will draft the entire resume for you. I was searching for Udemy just yesterday. So see, it says that it has 2,352 courses on how to organize your resume, of which 209 are free and don't require any payment. I found this nice course on Coursera. In fact, I enrolled myself as well yesterday only. So it says how to write a resume. It's a project-centered course. Then LinkedIn also offers the advice to write a medical resume. Then the American Medical Association has its own online course. So just in case you're interested, you can choose either or maybe more of these. But at the end of the day, I'll summarize, it's an innovative exercise and you have to, there's no perfect template for you. And whatever way you can project or present yourself appropriately, that is the ideal template. Thank you very much.
Thank you so much for such an enlightening talk, sir, and covered well on time. And I'm sure lots of young folks must have got inspired to have a CV like yours. And thank you for simplifying everything. So, sir, we'll take a few quick comments from the experts as well. Sumitra, sir, you want to add something to the discussion? And then
I think Prabhu has covered everything in resume preparation. At the end of the day, you will be judged by your work and how much you have contributed to pediatric surgery and how many people you have encouraged to take up pediatric surgery. All those things ultimately matter. So very, very nice, very detailed discussion he has done. I have nothing to speak about that.
Thank you,
Thank
sir.
you.
Thank you, sir. Venkatesh, sir, you want to add something?
Yeah. Proud to have you, Prabodh, as a pediatric surgeon at our community. If I just went through your 34-page resume, just downloaded. I think I personally recommend you for any award you deserve from all of us, IAPS. Such a fantastic man. You're thing. Tanmay, not a few points. As Prabodh sir ideally put, you should have a CV of, say, paragraph. He says 1 page. You can add on 1 more page, 2 pages, fine. The curriculum vitae, the literal meaning itself, it's a course of career or course of life itself. And he has put right from his word to till today. And I just want to add on, some management and leadership evidences, what he has achieved as a chief of anything. He said he has worked for NGOs, his department, now he is international. Whatever that, he has to put his management and leadership, which the most of the, say, Western or Indian also know. It's become, the world is so small now. Everything is international. We are okay. Everybody is reachable. And thing is, we have to highlight, say, last 5 years activities. People look at the management level or the people who go through your curriculum vitae will see the recent activities they just see. So just stress on the last 5 years activities. As sir said, be honest, be truthful. And for that 34 pages, we can create, as sir said, LinkedIn or some HTTPS. You can have your website of your own. So just click on Prabodh, all the 34 pages. I think it's a limited edition, I suppose. He has edited too much to the curriculum vitae itself. It says comprehensive, and his comprehensive CV is 34 pages. And okay, multiple CVs, as Prabodh sir said. Hats off to you, sir. Proud to have you again. Thank you. That's all, Tanmay. Yeah.
Thank you, sir. Thank you, Prabodh sir. Thank you, Sumitra sir, and thank you, Venkatesh sir. Now we'll move on to the next session, which is on one of the very important topics. I think has to be the session for the day, which is on surgical leadership. And for this session, we have our speaker as Anirudh Deshpande sir, and for the session we have experts as Shilpa ma'am, and we have Pavai ma'am and Sushmita Bhatnagar ma'am. I welcome you all for this session, and over to Anirudh sir for the talks.
Thank you. Thank you very much. Can you hear me?
Perfectly audible, sir. Yeah.
Perfect. Let me share my screen. Now, before I start, can I thank Dr. Ramesh Babu and Vikesh for inviting me, and also congratulate them on this wonderful idea of Yuvacon. It is really a very good, powerful idea. I also would like to congratulate Prabodh for a very, very good talk. I was listening to it, and I have to say I learned a lot too. Very nice talk. Vikesh asked me to talk on this topic, which I did speak on this topic in Jabalpur when I was visiting Vikesh and his department. And I think it is a topic that is now becoming close to my heart, but it's still evolving. So this is more like a discussion from how I see it. And the reason I'm speaking to this is because I believe it's really important for all young surgeons to be aware of the leadership demands, the leadership potential that lies in them, and most importantly, what benefits it can have to you as a surgeon. So a little bit about me. I started off in KEM Hospital, Mumbai, and now I'm an accidental leader. I'm currently the head of pediatric surgery in the largest children's hospital in Australia, and also have a research footprint in the University of Sydney. I'm very grateful to where I have come. It was definitely not a planned journey, in all honesty. Like I said, I'm a very accidental surgical leader, but I would like you to not follow a very random and accidental path. Today, I lead 2 teams which have 50 members. And when I define leadership, it is about people who you take with you, but you are not paid by you. Okay, so if somebody is in a position that you are paying, then he's an employee. No, it doesn't really have to follow the leadership tenets to follow you. So this is the subtle difference between leadership and power. And I want to share with you how growing and evolving as a leader has helped me to make you think about how it can help you. So what I'm going to cover today is how I see the definition of surgical leadership. What are the benefits of learning this sort of abstract stuff for a young surgeon? And 3 or 4 things that we can actually do to gain benefits by practicing surgical leadership in whichever way we practice, whether it's private practice, institutional practice, research heavy practice, or purely technical excellence practice. There is a big difference that we need to understand between managers and leaders, and it's not very commonly discriminated when we loosely use the words. So managers are very good at getting the jobs done, whereas leaders are always going to tell you that you did a job very well, but it was not required to be done. A bit like Sheldon Cooper in the Big Bang Theory. So leaders are the people who will tell you you are in the wrong jungle. And traditionally, leadership is a little bit more powerful than management, although both are equally required for success. So most of you might think this is an interesting talk, but that's not for me. I'm never going to become a leader. But I'll tell you, you will all be leaders. The health systems have become so complex that the way we work as surgeons has changed significantly in the last 30 or 40 years. We are now a small part of this very complicated dynamic called the hospital. And we may think we are solo players and alone managers, but leadership may no longer be a choice, and I'll explain in a minute. The other side of this coin is that if you really leverage the leadership skills well, it can help you grow your practice, public practice, academic practice, private practice, whatever it is. It can make your practice more satisfying. You can have people who are happy around you, and it can also contribute to making a meaningful impact on a much wider scale if that's what you choose to do. So the reason I give you those 3 or 4 benefits is because there are different types of leadership, and the benefits you are likely to get out of it depends on which of these domains you invest heavily in. The simple one is the clinical and personal leadership. So this is the leadership we all practice as surgeons. Whether we are senior trainees, lecturers, associate professors, or professors, we have to function as a surgeon. That involves certain kind of leadership we show while making a diagnosis, offering surgery. Beyond that is the admin. So that's the clinical leadership. One more thing I will say is that the day I finished training and started practicing as a surgeon, I realized that the proportion of time I spent in managing a patient flipped. So till I was a trainee, I was spending about 80 to 90% of my time trying to manage a patient. And the day I became a consultant, I started spending 85 to 90% of my time managing people who would manage patients. So the amount of leadership skill that I was expected to have suddenly went up overnight. And if I wasn't prepared for it, I was going to struggle. The second type of leadership is administrative leadership. So remember, you were all part of a department, or you're still part of a very good department. And the department is what it is today because somebody has put in a lot of leadership effort into making it that. Then there is the research leadership that I don't need to talk a lot about. Everything that we benefit out of as clinicians is somebody's hard work. And there's some very, very good researchers in the IAPS community. And the last is the social leadership. Surgeons are very privileged people. Even the VVIPs in the society will go unconscious just for us to be able to care for them. And we should always be mindful of these responsibilities and powers and think about giving back to the society, which I'm sure we all do. But it will be nice to think about how we can do it more effectively and using the leadership principles. So do we, as doctors, come across as natural leaders? And most people say yes. And this is why MBBS people were top candidates in being selected for MBA programs. So while becoming doctors, we have a lot of leadership skills. We take responsibility for our actions, we communicate our plans very loudly, and most importantly, we naturally work as good team members. But then something changes as we become surgeons. We are told to say the word I all the time in every answer we do, in every answer we give, in every decision we make. We start thinking more from our personal positions, and we stop empowering the people around us. And suddenly we become an island of excellence with very poor connections to the people around us. And in being focused on ourselves, we lose the power to connect and innovate. So how do we change that when we become young surgeons ready for practice? I would recommend you all read a good book on leadership, but this is the one I have read almost every year. It's a book called The 7 Habits of Highly Effective People by Stephen Covey. And the first 3 habits are about making yourself better, but the next 4 habits are about leadership, habit number 4 to 7. And through these brief discussion of these, I'm going to give you 2 or 3 things that you can think about doing differently when you start off in practice, or when you go to practice, back to practice tomorrow, and trying to make things better. One thing you have to learn, like I was mentioning, is when you are a leader, you are no longer responsible for doing your job, but you are now responsible for inspiring, coaching, mentoring, and motivating your team to do the job. And in fact, to do the job better. And this is far more difficult than doing your job. So the first habit that, the first principle that you can use is called think win-win. Now, for people who have management experience, this is a very, very basic management principle. And that is based on the fact that we cannot succeed alone anymore. And when we have to negotiate or talk to somebody, it is important that you never have a make or break approach. You always try and seek the middle path. Relating that to practice in India, I would say when you're negotiating with the corporates, try and find a middle path. If 2 or more sides benefit, then cooperation is natural. The other thing I would say is, this is what I personally learned very strongly in my practice. I noticed a lot of people approach people for referrals or asking for more surgeries, thinking about the situation from their own angle. And then this quote from Mandela became apparent, who said, "I learned a lot from my father, who was a tribal leader." And why was Mandela so powerful? Because he followed this one habit of his father's, where they always sat down in a circle, and his father, who was the leader, he spoke last. What it tells me is that we need to constantly inquire about our team and our helpers, perhaps at the start of every day. And remember that you don't have to always be in charge. Sometimes you can be a part of the team after you have done the basic groundwork. For example, if you're trying to attract more referrals from a pediatricians, I saw a lot of colleagues go and tell the pediatricians what operations they can do well. The ones I thought did better were the ones who went to the pediatricians and said, "What can I do to help you? Because I am interested in practicing in this area." Reversing the question had a much deeper impact on the referrals. My research in incontinence entirely started from that one question, because I realized the pediatricians were looking for someone to help them out with incontinence problems. And if you focus on what they want, they're more likely to help you. On the other hand, if you focus entirely on what you want, they will do the same. And that's not a very good situation. The third practice of leadership is my favorite sportsman, Virat Kohli, taught me this. It is called synergize, which means you have to inspire and collaborate. When Virat Kohli was the captain, he went to the fast bowlers of the Indian team and told them to come up with a plan by which they could take 20 wickets in every test match. It so happens that in 58 of the 68 test matches he was captain, India took all the 20 wickets. It hasn't happened since. And his approach was to outsource the thinking to the fast bowling group, but support them on the field. And they delivered in more than what he expected. So the way that can be transpired into pediatric practice is to reach out to people and empower them to help them produce outcomes that you want. For example, you can meet with people outside your specialty for collaboration. You doesn't have to be all within pediatric surgery. You can reach out to eminent people in other walks of life. I'll give you an example. We were struggling with a disease called cystinuria, which you're all aware of, where there's a high stone burden in little children. And we thought we should try and help make the management of cystinuria better.
Sorry to interrupt. This hyperlink seems to be working for you, but not for us.
Oh, is it? Sorry.
Yeah, because you need to unshare and again share that PowerPoint. Yeah.
Is that better?
Yeah, right.
Okay, so this is an example I could think of to bring out the importance of synergizing, where you reach out to people and try and help them help you get the outcome you want. So we reached out to laboratory researchers and donors who had interest in cystinuria, all for their personal reasons. And we were able to, I don't think it works for me now. Oh. So we were able to do this very complicated research where we created a mouse with the exact mutation that we wanted to find a solution for. And we were able to give a medicine that stopped cystinuria stones forming in the animal model. And we are now going to translate it to humans. But the point in this is, look at the number of people that had to be involved to get one single simple outcome. And as you can see, the photograph does not have the clinician who wanted the solution. So that is just an example of how you can reach out to people and empower them, give them independence, give them the belief to get the outcome you want. And the last and perhaps the most important thing that I would suggest we all think about as we step out as young surgeons in practice is the concept of sharpening the saw. Habits are very important, and we all know that. But what is the danger we run? We run the risk of, as we set out as individual surgeons. Remember, Novak Djokovic has a coach. Every top tennis player has a coach. Now, what is the tennis stroke that Novak Djokovic needs to be taught? Nothing. Then why does he have a coach? And the coach is very highly paid. Atul Gawande gave a very, very good talk recently in the TED series, where he said, having a good coach is a lifelong necessity and is key to improving in the face of complexity. So being a surgeon is a very complex task, and coaching is even more required the higher you go in the complexity scale. So a coach can provide an accurate picture of our reality. And this applies to people who are very skilled, very competent, and very capable. So even the most successful people in the world have coaches. And Gawande believes that getting a coach is the best advice you will ever get. I will admit to you that I, once a month, operate with a senior colleague of mine, and we criticize each other. This is an extremely powerful way of staying on top of the game. And it also brings with it integrity, transparency, and confidence in your colleagues. So if I had to reflect on my leadership journey, my success in my career has been proportional to the amount of leadership I have embraced. When I was a solo surgeon with minimal leadership, I was not getting the same amount of success and reciprocation from my colleagues, from the society, and from the community at large as I'm getting since I've embraced leadership. And my mantra has been, you should take only 1 second to say yes, but think at least for an hour before you say no when anybody offers you a new opportunity. And this applies especially to non-surgical tasks. As surgeons, we are likely to say no to non-surgical tasks and yes to surgical tasks, but I would encourage you to think about it. Not say no in a hurry. If you want to say yes, say quickly. If you want to say no, think hard. Starting as a surgeon, you should spend some time thinking about how the health system works. Understand your own personality, your strengths and weaknesses. Having weaknesses is a very normal thing, and it is not something you should be ashamed of. In fact, acknowledging them and showing your vulnerability makes you very popular and very well liked. We should also discuss patient outcomes and not surgical techniques. And we should discuss cost to healthcare, not just invasiveness of the procedure. These last 2 points are something I would strongly suggest we do as pediatric surgeons, because the discourse, if it goes too far down surgical techniques and invasiveness, it becomes very unappealing to the community outside pediatric surgery, from whom we need support to push this bandwagon. What we should not do is restrict ourselves to clinical work, spend too much time on WhatsApp groups where individual opinions can consume your creativity. We should also not refuse administrative activity very quickly and run away from disagreements or difficult research. I'll just leave these as statements. I'm sure you're all capable of thinking about this and what it means to each of you. There's also a role we can play outside of the hospitals in doing some non-clinical research, volunteering in some government committees, and also try and adopt the coaching principles by discussing your personal development with a senior or a junior. If we do all these do's and don'ts, I think we will automatically start growing as a leader and also start becoming successful as a surgeon, whatever type of practice we are choosing to have. So I'll sign off by saying there's 3 or 4 things we should all do. Think win-win. So when you negotiate with the hospitals or when you develop your team, make sure the other side is winning too, not just you. Reach out to collaborate and innovate. And this, you have to go beyond pediatric surgery if you really want a successful outcome and a satisfying impact. Go beyond the hospital and sometimes even go beyond the medical system. We have a lot of credibility as surgeons in the society, and we should use that. I encourage all of you to set aside some time to practice administration or local leadership of some description, because I'm sure it'll multiply your surgical success in times to come. And most importantly, I encourage you to get a coach, no matter what stage of career you are in. Thank you.
Thank you so much for the lovely talk, sir. Really enjoyed it to the core, and exploring into the domain of leadership is often not taught to us. And understanding these things, I think this is quite essential to grow as overall as a personality. And as you said, it helps us to grow as a surgeon as well. So I'll quickly have some comments from our experts as well. Sushmita ma'am, you want to add something?
Yeah, hi, wonderful talk, Dr. Anirudh. It's been lovely to see you after such a long time. And this is like you have in a very short span of time covered so much about leadership. I just want to kind of, simplify it as how I see leadership. Leadership is the ability to lead people towards a common goal and a common culture. So this is such a simple thing, but it has a profound clinical and practical application. Now, just to simplify it, the fruits, this is for obviously our Yuva of this group. The fruits are the results of what? Obviously, the roots. So if you want the fruits to improve or you want them to be excellent, then you have to focus on improving the roots. And what are your roots? Your roots are your knowledge in pediatric surgery, your application of knowledge, your thoughts, your beliefs, your emotions, your focus, your vision, your standards, and most importantly, your values. Because unless you have this, unless you create your own vision, your own standards, your own values, you will not be able to apply it, or you have a collective group of people to follow that. And this is where everything changes. Like if we are ourselves not having a vision, then how are we going to involve the other people towards a common goal? So that's all how I look at leadership. So first is improve our roots, and then we follow everything that Dr. Anirudh has said. Thank you.
Thank you, ma'am. Pavai ma'am, you want to add some quick comments?
Yeah, it was an excellent talk. Thank you, Tanmay. Thank you, Dr. Anirudh. So, like Dr. Sushmita said, we're all, when we become doctors, we are leaders. But what we should understand is in a surgical leadership, it is always a teamwork, whether it's with your nurses, with your juniors, with your seniors, whatever it is. So if you work as a team, I feel when you look at all the people who have excelled, they have worked as a team. So all the best.
Thank you, ma'am. Shilpa, ma'am, you want to add comments to this?
Yeah, thank you, Dr. Anirudh. That was an excellent comprehensive talk on leadership. I would like you to add some more because you have worked both in India and then shifted to Australia. I've also worked in the UK where people were not just made leaders, they were identified and then they were trained to be leaders over a period of 1 to 2 years. They were told certain rules which were followed as they became the leader. So like in India, things are different. People just become leaders and they don't know how to behave. They continue the same behavior that they have been doing as a colleague, or when they become a leader, nothing changes. So how is the scenario in Australia, and what would you recommend for us in India when people take up these leadership roles to do it better so that there is no complaint? There are hospitals where they are good leaders, and when they are not even around, things move very smoothly, like the hospital I'm working in right now, Institute of Liver and Biliary Sciences. Even the nursing orderly, even the person who comes to do the dusting, all of them are trained to do their work. Nobody has to tell them that you have to do this. Whereas when you come to a government institution, until you instruct them to do something, they will not do. Even simple things like fixing a light or putting a cautery plate. So we all go through this and we waste our energy in things which are supposed to be done automatically. So how do you think things can change here?
Yes, thank you, Shilpa. Nice to see you all, Sushmita, Shilpa. It is a difficult question, but I think it goes back to differentiating between management. I think even in the Australian setting, there is a certain amount of management role that you all have to play. We all have to play, especially if you are heads of departments or heads of services. We have a concept called mandatory training for every year. We have to do some child protection and other trainings. And making sure that all the members of the team do the mandatory training, do the basic requirements of the job properly. I don't think that necessarily falls under the leadership umbrella, and it should not. It should fall more in the management umbrella, which is to get the job done. But the issue is here, even if people do the job with certain degree of commitment and integrity, you can still struggle as a department because you don't have, like Sushmita was saying, the vision is not there, and the ability to work together to synergize and grow together is not there. So that's the next level of excellence. But yes, coming back to your question about how do you enforce the basic rules to get that job done, I think there's two aspects to it. One is that the management part of the job has to be supported and by the executive of the hospital, and somebody has to do it. And the second is the people who are being managed, if they feel that they are also being led, they are more likely to respond. I certainly find with our trainees, we call them registrars and residents in Australia, with the same management, you can get different outcomes by applying different leadership principles to the registrars and trainees. There are people who will respond to a caring and growing environment and do more. Whereas if the caring and growing environment and the ability to show them why we are doing this all together is not there, they will do the bare minimum. I hope that answers the question. So some thrust on getting basic management has to be there. Leadership can't survive without basic management.
Thank you so much, Anirudh sir, for that entire session. And thank you to the experts for their valuable comments. Now we move on to the last session for the day. It has been a great day. If I was to be honest, when we began the session, we didn't have so much hope that we'll be having so many good number of people turning up and staying till the end, watching the entire session. And the last session is something probably which will correlate to what Yuvacon has turned out to be. The last session is on Niti and Netritva, fostering young leadership amongst the youth in our fraternity. And it's an honor to have all our senior who are with us for this session. And I would love to ask the first question to Ramesh sir. So we have kept this session as an open forum. So I would request everyone to turn on their camera so that we can have a good discussion on this particular topic. So it's an open forum discussion. So, Ramesh sir, what do you think that such kind of sessions or annual conferences, uh, especially dedicated to the youth, how important are these to have such kind of conferences every year on a consistent basis? And what do you think were the key takeaways from today's conference that we have had? Ramesh sir, are there?
Hello, sorry, I missed that question. I was busy with something else. Sorry.
Yes, sir. So, sir, the question is like, how do you think what is the importance of such kind of a conference involving the entire youth, the young pediatric surgeons, to have it annually every year, and what were the key takeaways from today's conference?
Yeah. See, we we as leaders in pediatric surgery have to identify talent and nurture talent, and then ensure that the next generation is taking forward. It's like mentorship or training for the future. I mean, India is basically a family-based culture, and the way that the parents do it is like they initially allow the children to grow, and then at some point they slowly ask them to take over. They start running the family, the elder brother of the family or the elder sister of the family starts running the affairs, and then they are confident that they can leave the reins to them. So I think as an association, it's our duty to find the talents. And then today we've had an excellent session. The feedbacks we've got from all of you, people, friends. I mean, I'm getting messages from everybody, both the seniors as well as the youngsters, that this session was really useful to have a good interaction. Have a feedback about what people can do. I mean, we have identified so many good anchors today, so many good speakers today, and we have seen the potential of our Yuva group. And I'm really impressed with the way the thing has gone and how they've presented today. And a lot of people have actually personally messaged me that this should be a regular activity. I mean, for being a first session, we have included a lot of general topics, but we are open to suggestions, basically. I mean, every year, probably this can continue. But what I was thinking is, during summer months, we don't have physical meetings mostly. So these kind of virtual conferences can really boost our energy levels, and then also make sure that we are interacting with each one and then developing as a team. So I mean, as a team, IAPS is growing, and then today most of the seniors, I'm sure, have messaged me saying that they're very happy the way the future is. I mean, they are very confident that the Yuva, we are in good hands, basically. I mean, we have got good leaders today, and this is very important. I mean, we feel reassured, you feel happy. I think this activity should continue every year. And then we should come up with more such programs. Once a year is enough. I mean, this is actually designed at the end of the pediatric surgery week this year. But every year, the pediatric surgery week is at the end of that June 2nd week or something. So we can have it the same way. But this activity is very useful today. I mean, what we thought, we were actually experimenting. I think Vikesh can add a few words in how it is an experimental venture, and then he must be very delighted today how it has turned out to be. So, I mean, over to Vikesh. I mean, Vikesh can say a few words.
I think it was beyond our expectations today. Only thing I won't take much time. Only thing which I want to emphasize here is, like, if I recall my youth days, then we were not so confident and we were not so, aware about these type of topics in our days. So definitely the new generation is smarter than what we used to be 10, 15 years back. So this is one, perception which I got today. Another thing which I would be very frank to tell, that in our days, we didn't get that sort of platform or opportunity from our association. Probably that newer generation, newer technologies have come up. So it has opened up these opportunities in much better way. I'm not, complaining to the seniors, but I think these two things this year they matched well. That platform was being given, and you guys outperformed and did an excellent job. That is what I want to say.
And I think we would love to thank Ramesh sir and Vikesh sir, especially, and the entire leadership of IAPS, that they came up with this idea and trusted the juniors to go on with the idea. And I think in this in turn, like we collaborated with this thing along with the pediatric surgery week. So it does gives a motivation to the juniors also, so that they can come up with more ideas and present it to the seniors, that can we work on spreading more awareness about pediatric surgery in this way. Because I think as we flip generations, we see more of social media being used by the youth. So I think that's the advantage to this experiment that we did. And all thanks to the IAPS leadership for this initiative. Ketan sir is also there with us. Sir, what's your comment on this? And I would also like to know your feedback on how different models can be created, wherein we can come up with some kind of models wherein the youth especially can get mentored by the seniors, so that they can have a overall very good growth in this particular way.
Good evening, everybody. And I must give hats off to this meeting. I have attended most of it since 2 p.m. or 2:30 p.m. almost, and I have really enjoyed it. I am convinced that the youth require a good platform. They require to express themselves. During my presidency, I made some effort, but frankly, it did not work. And that is additional reason why I would like to congratulate both of you, Vikesh and Ramesh, because it has worked for you. And that's, I mean, it has done better. So that's sorry. So I think it's an excellent thing. Excellent thing. We need to have. We tried mentorship in PESI also, but that has also not worked much. I think maybe over a period of time we can think of better models for mentorship. Mentorship would involve not only surgical techniques, but mentorship in all forms. Mentorship to start when you want to start practice, mentorship to face situations. And I think now we have a reasonable number of seniors also who can be active in this, and we need to have a small group who are ready to mentor. Now with Zoom available, now earlier mentorship, if one had to do it, one had to really travel, and that was an expensive affair and would have been time consuming also. But now with Zoom, I think we are in a position to offer this more easily. And when I saw this today's program, I was thinking that we should have some form of mentorship, ongoing mentorship availability. I'm not saying that there is a program, it's an availability, because when would a person need a mentor is cannot be defined. And as I said, situations will require, and I think we should have something of that sort. I have decided that I'm going to sit with Vikesh and Ramesh and talk about this at some stage, and we'll again have to brainstorm and find out how we can best do it. But I think we should do it. As Ramesh said, that we are basically a family. We are family oriented in India, and we have to look at IAPS as a large family. And it's only if the juniors do better and better and become more and more successful that it will really satisfy and please the seniors. I think so.
Thank you so much, sir. And I think as we talk about IAPS as a family, it is like seniors were hand holding the youngsters today. So as much as the energy the youth was carrying in the entire conference today, most of the seniors stayed throughout the entire day and were there to motivate the Yuva speakers. So that was really heartwarming to see seniors supporting all throughout the session. We have Partha sir also with us. Good evening, sir. Sir, I wanted to know from you, like, so how do you see the participation of young pediatric surgeons in various leadership roles in our entire, say, IAPS, or in the sub chapters or in the state chapters? What is the current scenario? How do you see, how can we evolve it to in a better way so that youngsters come up and take some leadership roles?
See, there are two things. Am I audible?
Yeah, you're audible, sir.
Okay. There are two things. Nowadays, there are a lot of youngsters who are coming in for the association. That's one aspect of it. And that's the reason that you have so many young people, including our present president, to, steer us much better and as we evolve. But the whole thing is that because the topic was leadership, um, my only advice to the junior pediatric surgeons would be that first decide on what you want to do, excel in that, and then have the courage to challenge your mentor. When you reach that level, then you know that you have attained a certain standing to ask and challenge your mentor. And we all want our juniors to be like that. There's no point, getting depressed with everything that you can also see in the IAPS groups that, there are a lot of depression. Messages are depressive. But I guess the only thing is that walk forward, get a mentor as discussed, but be sure of what you want to do. That's all that I can say.
Thank you so much, sir. Thank you so much.
Sir, many people say, like when I speak to a lot of youngsters, and especially this election was happening, so I was encouraging people to join various positions, those who have talent. So they say, what we are going to get from this position, sir? So what is the reward we get? So I know the answer to a large extent, but I would like you to highlight the answer and give a message to them why they should join the association.
Because the biggest problem is that we are very consumer oriented present. Like if you really talk to 100 pass outs who has got a degree of MCH or and DNB, out of them perhaps maybe 80 or more would be interested to buy an apartment, buy a new car, not giving enough time to know the subject and excel. And regarding the same thing as you said, in an association job, like say the zonal secretaries and the zonal chairman, you don't find young people coming in large numbers. The problem is the social fabric. But as I said, this is a nice start, and we are all there as seniors to help them whenever they want to. But they must be having a definite, fixed idea about what they want to do.
So, Vikesh, from what you have just said, there is something which, we have all been talking about leadership throughout the evening, most of it. But there is, I'll just be a little bit devil's advocate, that to be a leader, one will need to spend time and effort. There are, of course, fruits of it. There is no question. And there is also a level of loneliness at the top. So one has to be prepared for these things. The frustrations come because you feel that it's all hunky-dory only at being a leader. But there would be frustrations. There would be loneliness. At times it can be a crown of thorns, and not leadership is not synonymous with success. So one has to decide that if he wants to be a leader, you have to be prepared for some of these negative aspects also. And there is, as I said, there is a lot of benefit. I'm not in any way trying to deter people from taking up leadership responsibilities. Leadership is a position of responsibility. And then Shilpa mentioned something about some other leaders. So you see, there will be two types of leaders. One is who take a position of responsibility, and there will be other group of leaders who take it as a position of privilege and power only. Now, I'm not going to say that which leadership is better. One has to choose yourself because uh, everybody has a different mental framework. And according to that mental framework, one has to decide whether you would like to take a position of responsibility or not. Uh, Go through that position of responsibility. And then as I said, if you take a position of responsibility, there would be some challenges and some frustrations one will have to go through and accept that because you're doing that. So it's not like everybody should become a leader. I don't think everybody can become a leader. But those who do want to become a leader, they must become a leader because there is a lot of benefit. That responsibility gives you benefit and position and enjoyment. There's no question about that. But it's not synonymous with success. So if somebody is only looking at success, then he has to look at it from a different way,
Yeah, life is hard, Nathan.
Pardon?
Life is hard.
I think life is hard, but one has to enjoy every aspect of it. I think one has to enjoy every aspect of it.
Absolutely. And I agree with you that not all are born leaders, but one can gradually, climb up the ladder in their own way.
Yeah.
So
but
now
the aspect of responsibility is very important when you are a leader, because otherwise, you are a leader who will best be forgotten, So if you don't fulfill that responsibility, then I think you've not done the job as a leader.
Yeah, and as Bikesh said, you see, you become a leader because you want, not because you expect something from it.
Yeah, right. So it is
That
like
comes.
whatever you get as a accomplishment or success is a byproduct. So it is not the goal. Yeah, it's a byproduct.
It should be a byproduct.
Dr. Tanmay, you can.
And move on to the next question, sir. So we have Ravi Ramadwar sir also with us. Sir, good evening. And my question for you is, do you see any gaps in the current training modules that we have in our pediatric surgical course? And if so, how can we work as an organization to fill those gaps so that the younger lot of pediatric surgeons that are coming out can be better trained in that particular aspect?
Yeah, good evening, everybody. Thanks, Tanmay. That is a very interesting question and a difficult one to answer. The reason for that is we have a completely different training systems all across the country. Different centers have different norms. There are different facilities and different infrastructure and different kind of people heading the units who have their own ways of doing things. As you can understand, our system has evolved over professorial teams. So the professor decides who should do what and what should not be done. I think for any trainee, wherever he is, he should utilize and learn most of the things which are positive. That is a positive learning, as well as negative, the things which he should not learn or he should not practice in his own career. So there are always two aspects for education. One is positive learning and one is negative learning. But after completing your training, you must visit multiple centers or work with different surgeons. Then you will actually become something like an Arjuna with all kinds of arrows in your what you can call Dhanush bands. So you can actually manage almost everything. But for that reason, you need to have patience, faith, and perseverance to spend time with others and learn from others and be willing to learn from others. What I have seen is that most of the people who have finished their training, they want to start practice as soon as possible. In fact, I know of many trainees who have actually started practice during their training period. The moment they become faculty in any of the departments, they start practice outside. If the goal is to earn money, then you will not learn many things. But if the goal is to master pediatric surgery, then you need to spend some time to actually learn. If you actually look at the training process is not guaranteeing you 100% training in everything. It is actually a launching pad for you to subspecialize and develop your own areas of interest after you finish your training. So I think it is going to be an impossible task for national board or for the universities to decide an absolutely rigid curriculum across the country, rigid training process, rigid number of operations being done by every single trainee, because the bosses are going to be differently trained. As has been discussed, we need to learn from other specialists also. We need to interact with other branches. We should be open to learn from them. I see a lot of time tendency amongst pediatric surgeons to talk only to pediatric surgeons and not willing to discuss anything with the other branches of surgery, like, for example, plastic surgeons, neurosurgeons, adult GI surgeons, hepatobiliary surgeons, thoracic surgeons. There is a lot to learn from every single person. I still remember that many times, if you are doing some difficult procedure, many times the attendant in the OT will tell you that do this, and that will make your life easy instead of doing the way you are doing it. So I think we should be open to learning throughout your life, and then you will find your own role in the society. And I think leadership has been discussed amply, so I'm not going to expand on that front.
So,
I hope
sir,
that answers your question.
Yeah. Sir, I would like to add one point. It's an extension to your comments that after passing MCH, one should do a self-analysis and identify his or her own gaps in the training. So identification of the gaps is very important. Accordingly, you plan the training which you need to take further after your MCH. So that identification of gap by yourself and then addressing those gaps in a very quick manner. I mean, you have to strategize it and you have to do it very quickly, like in a year or so, maybe 2 years. So that gives a big boost to your confidence and I think your success in the young age.
I think, Vikesh, what I would like to say is that don't try to finish everything within 1 year or 2 years, because you are going to be a pediatric surgeon for the rest of your life. You are going to practice pediatric surgery for next 30, 40, 50 years till the time you're alive. You're not going to retire at any stage. Most surgeons don't retire. So this is what you need to do to build up your own portfolio from the long-term point of view. Don't be in a rush to start practice, run around in nursing homes, be obliged by the pediatricians who will ask you to do some surgeries in their own tiny nursing homes and get paid for it and be happy with the money. That is not the way you're going to progress to the top. If you want to progress, you want to evolve as a pediatric surgeon, you want to innovate, you want to do something, you need further exposure and further training. And it is a long-term investment. Don't go in for a short term. As we all know, what happens in short-term investment is what we have seen on 4th of June. People have lost crores and crores of money in the stock market because they went for short-term investment. And I think we all need to teach our juniors to look for long-term training prospects and long-term development of their own practices and specialties and subspecialties.
I also think that we have to evolve some sort of mechanisms for joint practice. It's something which is very close to my heart for many years. And unfortunately, in India, we don't have those mechanisms well laid down. Because although we say that one should spend a lot of time in training himself, but I think, Ravi, for a section of people, the income is going to be relevant and important. By the time he finishes a doctor finishes his MCH, he's almost 35. At some stage he has to start earning. You can't say that you spend another 5 years in training yourself. Now, so unless we have some mechanisms by which they can earn also, and if they are just going to be observers or they are just going to be residents somewhere, they are not going to earn enough. At least some reasonable earnings have to be there along with. Of course, today the salaries are far better than what they used to be at our time. They were pathetic at our time. But still, I think that's also the age when you want to spend more and enjoy more, and you need the money for that. So we have to find out mechanisms by which they can also get some money. And I think joint practice is one of the methods. Of course, there would be other methods, I don't know. But of course, if they get a corporate job, it's great. But otherwise, if they are not in a corporate job, some sort of activity. If we can, as seniors, take some of them, help, give them some little bit financial support for services, which services means help they give us, or they, uh, participate in our work. That's one way of doing it, I suppose.
I
Sir,
think,
as you
Ketan,
rightly said, sir,
yeah.
this, I mean, Kinder Search Group of Bangalore is one such example, sir. As we saw in the presentation also today, that they are getting an opportunity to work with senior people also. So they are earning also and they are learning also. So both the things are going along with each other, going together. So they are learning like complex surgeries with the help of the seniors, and as well as they are earning a good amount of money in the group practice. Sir, Ramadwar sir, you were saying something.
Yeah, so what I was saying, like today's discussion, and I think in the past also we have had about financial management and how to make yourself financially secure. We've been discussing that for many years now in various state forums as well as national forum. And that is something which you need to start during your early days of residency. Ensure that you don't spend all the money and you save some money and make as a long-term investment. Once you start doing that, you develop that habit right from the beginning, the moment you start earning money. I think that will go a long way to take away all the financial stresses. And then learning process becomes fun, because then you're not stressed out about making quick buck by assisting somebody, going to some nursing home, doing some hernia or undescended test in a very compromised scenario with very poor anesthesia or very poor backup. So you don't need to get into that kind of practices. You can still be financially secure and advance your own skills and keep on learning. And as we said, as Ketan also said, find out your own lacunae in your training and develop in the area which you want to specialize in. Today, fortunately, which was not the scenario for us, today everything is available on the net. You have lectures, you have videos, you have photographs. Amount of literature that is available is phenomenal, and it's at the press of your keypad on the mobile phone as well. So I think the access to the literature and information is phenomenal today, and the learning should not stop the moment you finish your MCH. The learning has to continue and utilize all the options which are available for you, not only for advertising, which is what many people do, that they use social media to advertise themselves, but to actually learn and kind of improve their own skill sets, improve their communication skills, improve their patient management, improve their financial skills, and improve their overall quality of life.
Thank you very much, sir. Then we have two other invited speakers, so please,
Yes.
I will request you to move ahead.
Yeah. So I have one question for Prakash sir as well. So like we were discussing right now about how we should work as a team. And I think someone had posted in the chat box as well during the session that team doesn't just involve your own working together as a pediatric surgeons, it involves other allied branches also. So my question is, how should we adapt as young pediatric surgeons or as a fraternity so that we can showcase a better representation of ourselves to the allied branches that are there around us, and how we can work in tandems with them or have some conferences along with them so that we can grow together with allied branches also. Prakash sir, yeah.
Hi, good evening, everyone. That's a nice question. Since evening, I have been hearing about leadership and change and management, everything. And I was very happy that it's something I was learning for the last 2 years. I did a course in MBA in hospital management. So it was very nice to hear everybody speaking about leadership and management. Regarding your question on how to build a team and how to get up to others, I think it's very important that you have to develop a very good team, and you have to develop your team members when you are trying to project yourself as a leader. So when you are making your team, make sure that you have like-minded people working along with you. If somebody is giving you negative vibes, don't work with him. I think it's time to take the person out of your team. If somebody is giving you negative vibes, you should be working with people who are like-minded, whom you get along with well, whom you can share your ideas, and who are ready to listen to you and are ready to contribute to your team. So these are the members whom you should take, and not the people who are giving you negative feedback and negative vibes. Feedback is okay. You should always take your negative feedbacks. You can always work on it. Now, regarding working with other departments, definitely, as Ravi Ramadwar sir also told, we should always try to learn from others. Like in pediatric surgery, if you see, we handle most of the gynec problems, like girls with ovarian cysts or any other ovarian tumor problem in children. We only manage it. And our gynecology colleagues are not very good at it. So whenever they call us for any such thing, we should promptly respond to their call and try to show them our skills. That is when they will develop the confidence in us. And that is when they will refer cases to us. We see a lot of children with gynec problems being referred to gynecologists. But if they know that a pediatric surgeon can do it better, they will always refer it back to you. Similarly, if there are cardiothoracic surgeons working in your hospital, you always show them your case, what work you are doing. If you are doing thoracic work, good thoracic work, try to go and talk to them, meet them, present in their meetings. Then only they will know, oh, you are doing good thoracoscopic work, which they are doing by open. So why not try and call them? So that is how we have to go and liaise with them, show them our viewpoint, our ideas, our work. Then only they are going to know. Without that, if you just think, oh, I am doing such a good work, my colleagues will know. No, that is not the way they will learn or they will know about you. You have to showcase your work to them. Then only they will know, and then the referrals will start pouring in. So that is my take on how you should build your team and how you should collaborate with your surrounding people in your department or outside your department.
Sir. And
back to you, Tanmay.
Thank you, sir. Thank you. Thank you for the inputs. Is it can we have a few feedback from the Yuva pediatric surgeons also, sir? If they want to discuss.
Yeah, before that, I have invited Professor Sareen also for this session. Is he around, Professor Sareen?
I can't find him, sir.
Okay, fine.
He's not there, sir.
Thank you. Please proceed.
Yeah.
Hello, Vikesh. Can I say something?
Yeah, of course, sir. Please, sir.
So you and Ramesh have really taken pediatric surgery to great heights. I must congratulate. And we've got 3 presidents today to give their inputs. So it's been a very nice meeting. Today's meeting was excellent. But still, I would say that, some meetings like learning general surgery, like what Patta has started in general surgery, we can also start learning pediatric surgery. It will be a nice thing for the youngsters. Every week, if we can have something learning pediatric surgery. Of course, you are doing a lot of courses, but give that name and then you see, it'll help a lot. And what I feel, what Pratap Reddy taught me, group practice, that's very important in pediatric practice. Just what Ravi Ramdwar and even Ketan Parekh were mentioning, and even Prakash Agarwal was saying. So I feel the youngsters must take up to group practice. That is very important. It will be helpful. Patients will have more confidence, They have small group. And, in this, it helps quite a lot mentally as well as patient care because 2 doctors will be seeing at different times. Whatever operations, if youngsters are in groups and they practice together, initially they will think, the money is being shared, but in the long run, it will be very useful. This is my real sincere advice to all youngsters. Thank you.
Thank you. Thank you for your advice and suggestions, sir. We will try to follow it.
Thank you, sir. So I think we can have a few comments from our Yuva pediatric surgeons as well, so that they can share their inputs with the seniors. And I think Shilpa ma'am also posted something about
What do they expect from us?
About how we can volunteer
They expect from us.
IAPS, and rather than asking what IAPS can do for us, I think it's also equally important that we are available for IAPS as youngsters and are there to take leadership roles even if there is no designation for it, but then there to serve the family. Yeah. So I think we have Vidya with us. So My question for her is, yes, sir, please.
I'd like to know, what do they expect from seniors?
So I just want to take a few speakers for that context. Yes, sir.
Okay.
So, Vidya, we have Ketan sir's question also for you. And the second thing that I want to add to you is,
Yes,
what do you think about the initiative, this kind of initiatives that IAPS has taken, creating such kind of a conference wherein youngsters do take up leadership positions and are having a dedicated conference for this thing. So what's your take on such kind of initiatives, and what do you think IAPS or as a body we should be doing so that we can foster more innovative ideas from the youngsters and make a bridge wherein it's not difficult to reach out to seniors with some kind of whenever you are in trouble you can seek out for help, or if you are having some ideas you can reach out to them so that you can get a proper feedback on that. What's your take on this thing?
Sure. So I would like to start by saying this conference and this whole concept itself has been progressive and is a step towards this. That's just first was having the Yuva group, the young pediatric surgeons WhatsApp group, dedicated group, where everyone felt less intimidated to come out with their ideas. A lot of my colleagues, juniors, seniors, everybody, like the Yuva surgeons, and they felt they were open to volunteering for roles. That was also encouraged. And then there was prompt response from the senior leaders, the senior surgeons, to identify such enthusiastic Yuva surgeons to with their ideas and involve all of them. And we saw overwhelming number of, I think, volunteers to speak. A lot of them were interested to speak. The topics were interesting, and also the speakers also, many of them were there. So we've been taking a lot of strides in this regard. I think I first volunteered for the social media, whatever, design, content creation, and then it's come to here, and I didn't expect to be part of it so much. Sir even recommended me for the WIPSCon conference, and I got involved in that. Everything has been a learning also for us. It's not something that you know when you start off with. There are a lot of learning throughout this journey, and I think more of them are inspired. Even my colleagues now are inspired to uh, participate, and they're already looking forward to the next event. And with so many seniors being involved in such a platform, uh, I think people also make note of who they can approach next when they have a doubt or when they have targeted questions to the seniors after today's session. I think we're in the right stride. I keep going this way. That's it. That's it I have to say.
Thank you. And you still have to answer Ketan sir's question, which is,
I'm sorry. I'm sorry.
what
smartly, skip that
what do we
answer.
expect? Yeah. So
what do you expect from
IAPS?
IAPS? What else IAPS can do towards your, concerns and all?
So the WhatsApp is a good platform, and timely such sessions would be helpful. I think we already have Wisdom from Seniors as a session webinar. Just continuing this annual meeting, I think would be good enough. And not sure, even the national conference, I think we can have one session.
Okay, I suggest on
involving
your
us.
behalf something.
Yeah,
Suppose
sure,
I would have been at your place 15 years back, then I would have asked for something which I'm going to ask here. That,
I'll put in demand, sir.
Okay, fine.
Because I think
okay.
I had this discussion a few years back while I was doing my residency there. And I think we have a fertile ground. We are looking for ways, but then at that time COVID happened and we couldn't get it through. So it was that I feel that we should have some involvement of the youth also in the constitutional body. It should not be designated part, so it should not be some designation or some post or something like that, but some kind of involvement of the youth in the IAPS, so that we can bring in some issues which are being commonly faced by all of the peer groups, and then we can you can raise in a proper channel whatever discussion that needs to be done, so that we can get ideal feedback from the seniors on this, And there are lots of things which we may fuss about a lot, but then there are very simple solutions available from the senior. So I think if we are able to do that, then probably we'll be able to bridge a gap between the seniors and the young folks that are passing out, I think. Just a humble request from my side.
So the basic background behind what I understand his sentiments, that whatever like youngsters feel doesn't reach up to top IPS bodies unless the office bearers are like very proactive and they are like well gelled up with the juniors. They are easily accessible, and these youngsters are very comfortable talking to us. So that is the answer. I mean, what Tanmay is suggesting, that we can have some unofficial group, some committee sort of, not a position where election is held or something like that, that we don't want. So something which is closely related to the executive body of IPS and can put like represent the youngsters' problems or provide solutions also to us. Not only the problems, they come with the solutions. This is what, am I right, Tanmay?
Yeah,
this is
perfectly put.
Can I add a point?
Yeah, please.
Yeah, see, we actually, when we formed this WhatsApp group, I mean, we formed 2 WhatsApp groups, one for the postgraduate students and then one for the Yuva. So the idea of it is to directly ask them what exactly, because, you know, we should have, previously we are only discussing through the HODs or our peers, but now we want to directly ask them, because we are going through a generational shift in IAPs. So the senior pediatric surgeons have slowly become like, you know, retiring, and then now we are taking over. Then Vikesh, and then further generations are going to come. So we are going through a generational shift, and the way we think, the way we project, the social media presence, as well as, you know, the reach to people, everything should reflect the current era of thinking. So that the only way to involve them is like, for example, even the teaching activities, we felt that instead of having a lecture, if we focus it for the students, like, you know, an exam based or a practical problem based, that kind of activities will be more, you know, connecting with them, the actual need of the Yuva. So that's why we formed this WhatsApp group, and we are already able to, you know, connect with them very nicely. I mean, as Vidya has said, initially there was a lot of reluctance, but now they know that, you know, we are not, you know, some scary people, so we can easily be approached and all, you know. So there's a lot of, you know, ice has been broken between us. So that's very important. And also, like Vikesh mentioned, we need some Yuva reps. Not easy positions, but reps. So even PGs can have reps. Only thing is, it should be a mobile thing. So as you finish your 5 years from passing out, you should pass the baton and not hold on to that rep position. So that also should happen. So then the newer pass out PGs should move on to take up that position of, you know, the growing pediatric surgeon, what the actual problems they face, and all these things. So I mean, it is not a static group. So basically, it's a very mobile, fluid group, and that's how we should evolve the leaders and you know, student reps, Yuva reps. All these people can actually bring up immediately the problems. Then immediately the IAPS can fix it. So I mean, it's becoming more interactive and two-way active thing these days, and I think this should continue, because as I foresee, the next generation of leaders who will take up, you know, will be younger and younger. So they should inculcate this two-way communication process and then be receptive to all ideas as the leaders become younger in future.
I request Rasik sir also to comment if he's still there with us. Rasik sir.
I think he,
okay.
He was there.
Okay. He was there, but probably he's left. So please proceed, Tanmay.
And I think what efforts IAPS has been taking, the entire leadership has been taking, has been able to channelize the energy of the youth as well. So we were very active on Pediatric Surgery Day and even in Pediatric Surgery Week. We especially in the social media front. So we have been pushing in posts. We do share it with different other subspecialties as well, try and join in. Like today's session was also shared among lots of other super specialties and subspecialties as well. So I think that that serves the purpose and the broader goal. And I think if our energy is directed in a proper channel under the leadership, then we'll be able to create some impact. I hope. And I think we can conclude. It was because it has been already a marathon day. If anyone wants to give any inputs, I think we can have that, and then we can conclude.
Tanmay, can I make a final comment? I mean, sorry for Dr. Prabhu.
Yeah, Prabhu, please.
Sir, 2-3 things I want to put it across. One, what is the change that youth will be taking up in next 4 coming years? Already you have set an example, sir. Probably people will be following you up there. So that part is sorted out. And question asked by Dr. Ketan Parekh, sir, like what is that IAPS? What is that the youngsters wanted from IAPS leaders? So in future, it's going to be something like this. So whether you like it or not, every pediatric surgery thing is going to be an organ-based specialty in future. So what I would urge all the colleagues of mine or forthcoming generations is that everybody, you take your MCH as an acquaintance, and as an training to the acquaintance to the surgical aspects of the child, and then march forward towards an organ-based specialty. Now, for example, I narrow down to complete pediatric urology, but I do have a lot of vacancies. This is where the part of the seniors comes in. That means there are lots of rare cases where only few people operate. For example, urogenital sinus mobilizations, or very, very rarely things that would happen in a private sector, not in a. So in that kind of things, that can be magnified. For example, an expert is operating somewhere, lots of cases can be pulled up, and all the youngsters can go and watch it there. Or a senior person can be looped in when there is a case available in their own hospitals, or two, three cases can be looped, can be piled up, and a senior person who is expert in that can come over. Can be requested to come over, like an IAPS buddy, a senior buddy, and he or she can help the juniors out there. So probably this is the lacuna, this is a suggestion, and this is what I would like to wind up. Thank you.
No, Tanmay, you can proceed with vote of thanks.
Yeah. So this brings us to the end of the first ever Yuva conference of IAPS, and we are highly thankful on behalf of the entire Yuva pediatric surgeons. I would again like to thank the IAPS leadership, the seniors, Vikesh sir, Ramesh Babu sir, and all the seniors who have supported us in this entire conference, and all the seniors who are really young at heart and gave us the same energy input that we carried us along with this for the first ever conference. And I think this is just a start, and we have a kind of a guiding light now, and probably we'll carry this along, and we'll only take it forward from here. And thank you everyone who have stayed in till the end, attended all the sessions. We would love a feedback from all of you about which sessions did you like, which sessions would you want to have detailed discussions on. We'll have our seniors to come in for such kind of events. And again, on behalf of the organizers, if there were any errors or glitches on our end, we are extremely sorry for that. We tried to put on our best show, and I hope we were able to do justice to what it was expected from us. And special thanks to all the session coordinators and the people who had put in hard work behind this, so that we could come up with such a great show. Thank you so much. Thank you.
One just last comment, very short one. Actually, we have been brainstorming on this program for almost 4 months in our EC, IAPS EC. So I think last but not the least, IAPS EC has been very vibrant in giving us suggestion how this program should shape up. And eventually it has come up very well. Thank you, everyone. Thank you for joining, giving your patient time here. Thank you.